acho que mete aí mete aí o português no teu escritor. Português, estás a ouvir português? Português só. Mas eu estou só na consola neste momento, ok? Eles ainda estão a preparar os laptops. Português, está tudo bem? Português, vou passar para o inglês. Canal 2 inglês. Escutas, canal 2 inglês. Canal 2 inglês, ok. Vou passar ao 3 francês, ok?
It's quite large, 70. It's a good day.
We're
The second.
We're the biggest measure. We're the main opposition.
Yeah.
She's writing her speech. Oh. Good morning and welcome everyone to the Unite Global Summit 2022. My name is Victoria Gransold and it is my immense pleasure to be hosting this flagship event for the next 3 days. The main theme of the 2022 Summit, From Pandemic to Prosperity, reflects on the global impact of the past 2 years while looking forward to what is needed to achieve the United Nations Sustainable Development Goals. It is also an honor to announce that the 2022 Summit is held under the high patronage of the President of Portugal, Marcelo Rebelo de Sousa. For 3 days, experts from civil society, affected communities, international organizations, and academia will come together with parliamentarians from across the world to discuss the most pressing issues in global health and set the agenda for the years to come. Organized by the Unite Parliamentarians Network for Global Health, a unique platform of current and former policymakers committed to reforming policies to improve global health systems, this event would not be possible without their active involvement. We therefore would like to extend a warm welcome to the more than 30 members here at the Portuguese Parliament here in Lisbon, who will work alongside representatives from international health organizations to engage personally and virtually with many guests joining us around the world and online. Before beginning the summit, I will briefly go over a few housekeeping items. Virtual participants are able to pose questions to our speakers directly via the conference platform. Please also be sure to view the summit partners within the dedicated section of the platform, along with the virtual booths. Our participants here in Lisbon are invited to ask questions by simply turning your nameplate vertically from its horizontal. Finally, translation is provided in multiple languages, both in person via the headsets and virtually by selecting your preferred language in the live stream session. Please do remember, or please do approach myself or a member of the Unite team if you have any difficulties with this. Now, without further hesitation, it is my pleasure to begin the Unite Global Summit 2022 with the opening session, Roadmap to 2030, Multilateralism as a driver to global health and development. Handing over to member of the Portuguese Parliament and founding president of the Unite Network, Ricardo Batista Leite.
Good morning, everyone. It's a great pleasure to welcome you to the Portuguese National Parliament, my home.
Nossa casa, e agradeço que tenham viajado de longe para estar aqui. Uma saudação especial à Vitória, a nossa anfitriã de hoje, e também aos colegas do painel, Francisco Colombo e Ilona Kikos. Agradeço muito também terem aceitado viajar até Lisboa e o vosso apoio ao multilateralismo e ao papel dos parlamentares no espaço global da saúde. Gostaria também de começar. Normalmente nós deixamos os agradecimentos para o final dos discursos, mas eu começaria já por aí, agradecendo ao secretariado da Unite pelo trabalho excelente que tem feito. Estamos aqui hoje com esta organização extraordinária que todos já puderam constatar, é graças à liderança da nossa equipe. Agradeço ao Líder Silva, ao doutor Equipe Lucas Chambel, que coordenou o projeto, e a toda a equipa de diferentes países do mundo que estão aqui connosco em Lisboa. E penso que é a primeira vez em que conseguimos reunir toda a equipa presencialmente. Em tempos de pandemia tem sido difícil, e portanto, por eles e todos os que trabalham nos bastidores, a nível da interpretação, técnicos, todos aqueles que tornaram isto possível, peço-vos uma salva de palmas de agradecimento.
The Unite
A rede de parlamentares Unite para a saúde global neste momento reúne parlamentares das várias câmaras e senados juntos numa missão para melhorar a agenda de saúde a nível mundial no quadro dos Objetivos de Desenvolvimento Sustentável. A Cimeira Global Unite, a Cimeira de Saúde Global, é a principal plataforma de reunião dos parlamentares e líderes da comunidade de saúde global. Muitos deles estão aqui presentes hoje, outros estamos a acompanhar à distância e muitos destes líderes destas organizações, ou lideram organizações que têm tido um papel importante em apoiar a Cimeira Global da Unite e também gostaria de agradecer a todos os parceiros que nos apoiaram e tornaram este evento possível. E também agradecer particularmente ao ONS, representada aqui pela Lisa Scaloro, com quem assinámos um acordo de parceria na última Cimeira em Berlim, Cimeira Mundial de Saúde. Nos próximos 3 dias vamos ouvir os peritos da sociedade civil. Não há saúde global sem quem está no terreno, as comunidades afetadas, as instituições internacionais, a academia e deputados de todo o mundo irão discutir aqui estas questões permanentes na saúde global e estabelecer a agenda para os próximos anos. Enquanto parlamentares, muitas pessoas perguntam, ora, esta é a sala do Senado. Bom, mas o Parlamento Português não tem um Senado. Já temos. Agora só temos uma Câmara. Mas usamos esta sala para conferências e estamos aquela sensação parlamentar que é necessária. E que também sabem que nós somos uma república, temos um presidente. Mas o quadro que está aqui na sala do Senado é o rei que nos está a olhar. Este era o rei Luís I. Foi o segundo, foi o antepenúltimo rei. É importante conhecermos que ele era conhecido como um bom rei, o rei bom pela sua visão da solidariedade e sabia que devia servir o povo. E o povo reconheceu o seu trabalho. O seu filho já não foi assim tão amado como isso, por isso que a monarquia acabou, mas 200 anos depois este quadro ainda aqui está no Parlamento com os representantes eleitos, mostra que todos nós, parlamentares, representantes do povo, a nossa primeira missão e principal missão é servir aqueles que nos elegeram e que depositaram o seu futuro nas nossas mãos. O tema desta cimeira, o tema geral, da pandemia à prosperidade. E eu penso que fala por si, porque é que isto é importante. Nós estamos a passar por tempos difíceis, estamos em tempo de pandemia, houve os confinamentos, houve as consequências da falta de capacidade, muitas vezes, para estarmos melhor preparados para responder à pandemia. E é por isso que no primeiro dia desta sessão vamos precisamente falar sobre o controle das doenças infecciosas e a preparação e resposta às pandemias. Amanhã iremos abordar o futuro dos sistemas de saúde, como reforçar os sistemas de saúde, a importância da transição digital enquanto fator de reforma e de mudança, mudando os sistemas de saúde de reação às doenças para estarem mais apostados no bem-estar e na saúde. E no terceiro dia, que eu penso que é um elemento fundamental de tudo aquilo que fazemos, a saúde enquanto direito humano, e perceber que temos que assegurar que haver saúde para todos. Temos 3 questões principais que queremos responder durante estes dias muito preenchidos que temos à nossa frente. Que progressos é que foram feitos até ao momento relativamente aos ODS, já que chegámos agora à metade do percurso este ano, ainda faltam 7 anos até 2030. O que é que aprendemos que nos pode ajudar a fazer ainda mais progressos para alcançar os ODS até 2030, nomeadamente depois da forma como a pandemia fez com que alguns destes objetivos tivessem de ser adiados. E qual é o papel dos parlamentares nos congressos, dos senados, para conseguir a mudança necessária? E esta cimeira surge numa altura muito oportuna da história da humanidade, já que enfrentamos aqui na Europa, no coração da Europa, uma guerra na Ucrânia, e queria desde já manifestar os meus agradecimentos à senhora deputada Galina, que veio desde Kiev até Lisboa, está aqui connosco, a senhora deputada Galina, do Parlamento ucraniano. Ela irá falar amanhã no nosso jantar de gala. Mas Este teve imensas repercussões em todo o mundo, com o aumento da inflação, do custo de vida, que inevitavelmente irá resultar em mais desigualdade, mais pobreza e assim pior saúde para todos. Bom, mais do que nunca nós precisamos do multilateralismo. Temos que trabalhar juntos. Todos estão a tentar encontrar soluções nos seus orçamentos domésticos, nas suas políticas nacionais. Agora, mais do que nunca, temos que encontrar soluções multilaterais para estes problemas tão exigentes. E temos que repensar a saúde e o bem-estar em conjunto. No próximo ano há vários desafios que nos esperam. E aquilo que nós discutimos aqui será da maior importância para nos ajudar a enquadrar a posição da Unite e de todos os parlamentares. Temos que falar a uma voz, seja na reunião do G7 no Japão em maio de 2023, seja na reunião do G20 em Nova Delhi, na Índia, em setembro de 2023, ou na Assembleia da OMS em maio de 2023 também, e também haverá 3 reuniões de alto nível das Nações Unidas, tuberculose, cobertura universal de saúde e Covid-19. Tudo isto serão oportunidades únicas para nos envolvermos e liderarmos a agenda global para a saúde. Este Parlamento foi formalmente esta sala, este edifício já era um mosteiro. Antes de estarem cá os deputados, eram monges que andavam por aqui. Mas com o terremoto que destruiu grande parte de Lisboa em 1755, o edifício ficou praticamente destruído. E 100 anos depois foi tomada a decisão de o reconstruir a partir das ruínas e torná-lo a Câmara dos Representantes, que é hoje a Casa da Democracia e a Casa de todos os cidadãos portugueses. Ora, da mesma forma e simbolicamente, eu creio que nesta Cimeira Global da Unite, nós também estamos a acompanhar os desafios que a pandemia nos impôs e podemos renascer das cinzas, como a fênix, e se ficarmos ainda mais fortes para os desafios globais de saúde que nos esperam. Estou certo que esta Cimeira Global da Unite irá tirar partido do nosso esforço. É tempo de nos unirmos. Unite.
Great. Thank you, Ricardo, for outlining this very important premise
destacado esta premissa importante para a Cimeira e o envolvimento dos parlamentares. Agora é com todo o prazer que vos apresento a próxima oradora, a senhora Francesca Colombo, que é chefe do Departamento de Saúde da Organização para a Cooperação Económica e Desenvolvimento, OCDE. Muito obrigada. Obrigada, Ricardo, pela oportunidade que me deram de estar aqui neste sala tão bonita. Quando o espírito como nós nos encontramos, sabemos que sempre que mais dinheiro deve ser investido na saúde, porque a saúde é um investimento. Eu não creio que nenhum de nós discordo disso. O problema é que nem sempre fomos muito eficazes em influenciar os outros. A pandemia pode mudar este diálogo, mas não é um dado adquirido. A pandemia da Covid-19 não só teve um efeito devastador sobre a saúde, um impacto devastador, mas também um impacto indireto económico enorme, causando grandes danos às economias. Os nossos sistemas foram resilientes, mas não o suficiente para salvar vidas e proteger as economias. Esta crise deixou claro que bons sistemas e sólidos de saúde, preparação e resposta são essenciais para que as economias prosperem, acelerando a equidade em todos os países. É, portanto, a única estratégia de saída para este problema. Mas a Covid-19 vai também mostrar as consequências de anos de subinvestimento no sistema de saúde, começando pelo subinvestimento na prevenção e a incapacidade de resolver as determinantes sociais globais da saúde. Ora, nós sabemos onde é que estão as falhas. Sim, a resposta é sim. Nós sabemos onde é que estão as falhas e sabemos também como abordar estas falhas. A falta global de trabalhadores, de profissionais de saúde tem que ser resolvida, assim como encontrar soluções equitáveis para a questão da migração de profissionais de saúde. A pandemia acelerou a utilização das ferramentas digitais, como as teleconsultas, e os diagnósticos à distância. Mas mais tem que ser feito para acelerar a chegada equitável a toda a parte e de dados adequados para melhorar a investigação em saúde. Encontrar novas formas de melhorar os bens de saúde, nomeadamente vacinas antimicrobianos, são essencial para combater estas crises. Na OCDE, calculamos que, mesmo nos países de elevado rendimento, um investimento adicional de 1,4% do PIB será necessário para tornar os nossos sistemas de saúde fortes o suficiente para responder aos desafios de mais uma ameaça do tipo Covid-19. Para além do sistema de saúde, as consequências das alterações climáticas para a saúde têm também que ser resolvidas. Sim, nós sabemos o que fazer. E, contudo, a história mostrou-nos que as memórias das crises muitas vezes são curtas e há sinais preocupantes já de que pode ser mais uma vez o caso. Os ministros das Finanças, o seu entusiasmo para investir na saúde está a esmorecer à medida que enfrentamos já não temos tantas mortes relacionadas com a Covid-19. Os Estados estão agora mais preocupados com a guerra injustificada da Rússia contra a Ucrânia e com as recessões económicas em muitos países. Ora, é perante este cenário muito sombrio que temos esta tarefa enorme agora de sugerir que a saúde se mantenha como uma prioridade na agenda. Eu não tenho a bala mágica, mas tenho aqui 3 sugestões, áreas em que isto pode ser feito. Primeiro, a análise económica da OCDE, a OCDE é uma organização económica, oferece algumas orientações sobre onde é que os legisladores devem investir e a resposta é clara. Prevenção e cuidados de saúde primários. Só 3% do total dos gastos em saúde são dedicados a abordar os fatores de risco e manter as medidas de saúde pública. Contudo, o nosso trabalho tem vindo a demonstrar que há retornos para o investimento ao investirmos em estilos de vida saudáveis. Por exemplo, cada dólar investido em pessoas com obesidade, para combater a obesidade, os retornos económicos são de mais 6 vezes isso. E o mesmo se poderia dizer em relação a outras medidas. Também os nossos estudos mostram que 3 em cada 4 mortes de resistência antimicrobiana podiam ser evitadas investindo apenas alguns dólares per capita nesses países. Fazendo coisas simples, como lavar as mãos e o uso de antibióticos de uma forma mais cuidada. Também uma melhor saúde alimentar pouparia em termos de PIB, reduzindo o desemprego e aumentando a produtividade. E ainda que a Covid-19 tenha mostrado que os países com bons sistemas de saúde e cobertura universal de saúde estão mais bem preparados para gerir as crises de saúde, o investimento nos cuidados primários é menos de 1 por cada 6 dólares gastos em saúde. Ou seja, nós sabemos onde é que devemos investir. A segunda sugestão é que o dinheiro investido nos sistemas de saúde tem valor acrescentado real. O trabalho que fizemos em 2017 e o relatório mostrou que cerca de 20% das despesas em saúde, infelizmente, não contribuem para os resultados de saúde. Há muito gasto em saúde que é gasto de forma pouco eficaz. É possível fazer melhor. Por exemplo, 1 em cada 10 pacientes nos países são prejudicados no próprio local dos cuidados de saúde. E depois gasta-se em corrigir esses danos causados. Uma porcentagem significativa das missões é para cuidados que podiam ter sido resolvidos em termos primários. Muitas receitas antimicrobianas seriam desnecessárias, com 90% dos antimicrobianos e antibióticos a serem utilizados de uma forma pouco apropriada na prática geral. Ou seja, nós sabemos o que fazer. Por outras palavras, se não investirmos naquilo que devemos investir, cuidados primários, prevenção, mas também gastamos, por vezes, em coisas que não dão resultado ou que não têm valor acrescentado. Por isso temos que acelerar os esforços para melhorar o desempenho dos sistemas de saúde e resolver estes desperdícios inaceitáveis. Poder comparar o desempenho dos sistemas de saúde entre vários países é uma forma importante de monitorizar os progressos. E apraz-me constatar que hoje vamos lançar um relatório sobre um relatório de saúde comparativa legislativa que poderemos carregar da net. Finalmente, terceira sugestão, temos que continuar a mobilizar mais recursos. Os progressos para com os ODS estão atrasados. A lacuna de financiamento dos ODS nos países em desenvolvimento já vai em 56% desde o início da pandemia. Apesar do investimento recorde na assistência ao desenvolvimento externo, a seguir à Covid, tem havido um decréscimo de 22% nas receitas domésticas nestes países em desenvolvimento em 2020, desde 2020, e uma queda de 20% no financiamento privado. E é por isto que as soluções para colmatar estas lacunas de financiamento requerem ações múltiplas. Todos os países têm que unir esforços para mobilizar o seu financiamento para a saúde, criando bases necessárias com sistemas de saúde de cobertura universal. Temos que continuar a promover os esforços internacionais para financiar as lacunas em termos de preparação e resposta e reforço dos sistemas de saúde. Em última análise, isto significa que serão necessários mais recursos, mais ajudas, mais financiamento dos bens públicos e mais do financiamento doméstico. Para concluir, a janela de oportunidade para investimentos grandes nos sistemas de saúde poderá ter já passado, mas há ainda muitas oportunidades significativas que permitem manter a saúde na agenda política, tanto a nível nacional como internacional. Enquadrar as mensagens em termos de crescimento económico que se pode conseguir com investimentos mesmo mínimos em saúde pode ajudar. E a colaboração da OCDE com o United é muito importante, através da parceria que temos com o Secretariado, e temos vindo a trabalhar para reformular todos estes argumentos. À medida que se aproximam 3 reuniões de alto nível das Nações Unidas em 2023, será ainda mais importante fazer chegar a mensagem sobre o investimento, a importância do investimento em saúde. Temos que explicar bem aquilo que pedimos, mostrando quais são os ganhos em termos de PIB, criação de emprego e poupanças e ao retorno de investimentos, tanto na saúde pública como na cobertura universal de saúde, através de sistemas de cuidados primários fortes. Muito obrigada pela vossa atenção e espero que realmente consigamos fazer progressos e trabalhar para resolver estas questões em conjunto. A senhora esteve a ler um texto que não entregou aos intérpretes, dificultando sobremaneira o nosso trabalho.
Thank you very much, Francesca. Important words on the need for investing in health systems and also in health workers. So now for our final speaker, Ms. Alona Quickbush, International Advisory Board Chair for the Global Health Center at the Graduate Institute of Geneva.
I'm delighted to be here. Thank you very much for the invitation. It's wonderful to be able to have this discussion with parliamentarians, but also to be really where decisions are made, where things are being discussed. Because, you know, for a long time we have said, let's put health on the political agenda. But much of the global health community, when they said that, who did they think of? They thought of heads of state, they thought of finance ministers, they thought of the G7, they thought of the G20, and much of that has been happening because of the pandemic. They thought of regional bodies, the European Union, the African Union, but often they did not think of parliaments, and they did not think of parliamentarians. And this, of course, has to change. And that is why it is also so important that this memorandum of understanding that Ricardo Leite mentioned between WHO and UNITE is so critical. Because it brings the voice of parliamentarians who take decisions that impact both nationally, regionally, and globally, and to actually find a way to coordinate that in a better way. So, if we recapitulate what parliaments actually do, then it becomes much clearer what the challenge actually is. Because, first of all, and Ricardo alluded to it, parliamentarians represent their constituents. And that means they need to be in constant contact with their constituents. They need to be in dialogue. They need to have feedback loops. And we saw during COVID-19 that this did not always function. Remember, the issue of trust became one of the key issues during COVID-19.
Foi uma das questões mais debatidas durante a Covid-19.
Parliamentarians also have a discussion with their constituents. Why is it that we need to invest not only here at home, but perhaps in the wider European neighborhood, in Africa? Why do we need cooperation with countries which at first instance doesn't hit you, you know, as a normal citizen? This is what we need to do. So this issue of representing constituents is absolutely critical and is an issue how we can make global health more democratic. This is absolutely key. The second, of course, is what you do. You write and adopt laws and you adopt budgets. And through that, you make policy. And particularly, and I'll come back to the law side of things, the budget, speaking a budget for global health. And I must add, this is not only an ODA budget. This is a much larger budget that also relates back to financing global public goods, and in particular relates to the funding, for example, of the World Health Organization. I think parliamentarians should be at the forefront to fight for a strong WHO that is sustainably financed and therefore independent enough to do its job. And of course, the third absolutely critical function is oversight. So your oversight of what government does and has it done what you asked it to do, representing your constituents, and then from that also go that step forward and say, if we as parliamentarians decide to fund the Global Fund, WHO, and a whole range of other global initiatives, are they doing their job? And part of that accountability also means, are they working together? Or is each of them going ahead just doing their own thing? So just by looking at your three critical and basic functions, it becomes clear straight away why you are so important in global health, and I will add a couple of other things as well. During COVID-19, we have also experienced that many of the political parliamentary processes we would have needed were not in place. And we actually saw in some countries that parliaments were sidelined. And this is an absolutely key issue that parliamentarians need to be taking up now, as there is an assessment of did we do the right thing during COVID-19. And what I am seeing is that, yes, we're analyzing, did the Institute of Public Health do its job, and did the Minister of Health buy enough masks or too many masks, depending where you come from. But a really detailed analysis, is our political process up to speed? Is it pandemic-proof during a crisis? And if you just think also of the issues that particularly Mike Ryan from WHO mentioned frequently, he said, you know, the key thing is speed. Do we have mechanisms in place where parliamentarians can make quick decisions? Another is where most countries have great problems, is evidence-based policy making. How is the interface between the science community around a virus where we don't know very much yet, on the one hand, and the need to take decisions on the other hand? And that, of course, takes us back to transparency and trust. How many governments and how many parliaments were able to really communicate with the population and their constituents about what is happening, what we know and what we don't know. So there is a tremendous learning there, and again, why parliamentarians are so important. They should be that link between the constituents and the government, and they need to see their role in a pandemic in this way. And part of that is, of course, also how does the population then have a voice through parliamentarians and through what extent, and this is being looked at very carefully now in a number of countries, to what extent have we ensured human rights in that process? The whole element of human rights and pandemics is one, the rights of citizens, and of course, if we look at a country, the rights of those living in that country that are not citizens in the way we would define it. So, but we must obviously not just look at pandemics. We must look in general how decision-taking for health and for global health is organized, and how parliamentarians can help shape and ensure the accountability of government for health and global health at national, regional and global level. And I just want to plug here that last week the European Commission adopted a Commission communication, a global health strategy. So again, the issue here is now we have, WHO, we have the European Union strategy, we have our national strategies. How does that come together? And who is accountable to whom? And again, parliamentarians at the national level, also in communication, of course, in this case, for example, with the members of the European Parliament, is absolutely critical. And for the African Union, there are very similar issues. After COVID, many committees, etc., were created to speak about the reform of global health, and some of them even called, like the European Global Health Strategy does, for a new global health order. And many of you have also experienced the difficulty of thinking about this in a situation of polycrises, of geopolitical standoffs, and, let's be honest, a weakened multilateralism. And so this interface between being responsible for the health of the people in your country by writing laws, by adopting budgets, etc., you have to bring across to the population and to policymakers, no one is safe until everyone is safe. And we need to invest. We need to invest, as also Francesca has alluded to, in the health of other countries. We need to invest in global norms. We need to invest in international organizations. At the same time, and I've alluded to it, is the present global health order is no longer effective, and it is highly inequitable. I'm looking at the parliamentarians here who have come from the African continent, and they will know what I'm talking about. The global health order did not ensure that vaccines reached Africa when they should have. And if you look at the map of who's been vaccinated and who has not, you can see there is this big area in the middle. And I think it will be the role of parliamentarians, and particularly of UNITE, to actually address this. I will come to a close. The key issue really is the balance of normative and financial power that is increasingly skewed in global health. Global health has become a marketplace of competing organizations and initiatives. And we experience that at the global level, and in many developing countries of the global south, they experience it at the national level. So I think it is absolutely central that you must build trust with your own constituents about the investments that are needed. You must build committees within parliaments that actually discuss global health. You are many things at the same time. You are advocates, you are lawmakers, and you are guardians. And I think I would like to end with that call: please be guardians. Be guardians of trust, be guardians of democracy, and be guardians of human rights in global health. We need you to be strong. Thank you very much.
Thank you very much, Ilona. Very strong and powerful words on the importance of parliamentarians and having that trust for advancing global health and policies. So for the sake of time, I will transition directly to our final speaker for this opening session, which is from the Director General of the World Health Organization, Dr. Tedros Ghebreyesus, who has prepared a video message for the guests today.
Excellencies, dear colleagues and friends, I thank the Parliament of Portugal for hosting this important summit, and to my friend Ricardo Batista Leite for his leadership in guiding UNITE. In October, WHO and UNITE made an important step forward in signing a memorandum of understanding on global health. The MOU outlines three key areas for action. First, equitable access to health and ensuring adequate budget allocation to close the financial gap to reach universal health coverage. Second, sustainable financing for WHO and for strengthening health systems around the world. And third, strengthening the global health architecture, including promoting and implementing the International Pandemic Accord that countries are now negotiating. As you may know, WHO has formed a new global network of chairs of health committees, and we very much look forward to the engagement of UNITE and its members. WHO is pleased to contribute to the work of this summit, and in particular, the discussion on universal health coverage led by UHC 2030. As parliamentarians, you have a crucial role to play in closing gaps in service coverage and financial protection, especially for the most marginalized and hardest to reach groups. Thank you all for your continuing leadership and partnership as we work together for a healthier, safer, fairer world. I thank you. Obrigado.
Great. So this concludes the first and opening session of the Unite Global Summit 2022. To promote engagement with the other participants and to engage with the summit itself, we encourage you to utilize the conference platform and also the hashtag Unite Global Summit. And we will now have a 15-minute break. Guests that are present here are invited to go out in the corridor for coffee and refreshments. And we'll see you back here at 9:45. Thank you. Okay. Oh, okay, perfect. Okay, now officially, welcome back to the Unite Global Summit 2022. So now to begin with the first panel session, hosted by CEPI, the Coalition for Epidemic Preparedness and Innovation. It will set the stage today for discussing infectious diseases and pandemic preparedness. So in this session, we will answer the following questions. What can we learn from the global effort to fight the pandemic? What successes have we seen against COVID-19 that can be replicated for other infectious diseases? And what are the policy barriers that might hamper our ability to stop the next lethal respiratory pathogen from becoming a global pandemic? So without further ado, please allow me to welcome the moderator for this session, Eloise Todd, Executive Director and co-founder of the Pandemic Action Network. Eloise, please. Thank you.
Thank you so much. Everybody, what a pleasure to be here and kicking off this session on pandemic prevention, preparedness and response. And to welcome us properly, we've got the Deputy CEO of CEPI itself. I'm going to go straight over to Norway so he can give us his opening remarks before we come back for the moderation of the panel. Frederic, are you there? I think he's there. I've been assured he's there. While our technical team are getting him online, so we can see, I'll talk you through what's going to happen today. We've got, here he is. Frederic, you've emerged. That's brilliant. Frederic, can you hear me? We can see you, Frederic. Can you hear us?
I'm sorry,
I'm not sure he can.
I see myself, but I cannot hear you.
He can't hear us. In a moment, we will go to CEPI when we get that little technical hitch organized, and then we're going to come back to the room and hear from CEPI's policy director before a broader discussion with our fantastic panel of MPs, 3 of whom are in the room, 1 of whom is also going to join us online. And then we'll have 25 minutes for discussion in the room. So when we get to that point, I'd ask you at that point to turn your name cards on the side, introduce yourselves, and hopefully we can have a lively discussion. I'm waiting for a signal for when it's going to be okay to go back to Frederic. Sorry? Yeah. And one of the things that's exciting about our panel is that not only do we have MPs from 4 countries, it's actually 4 continents. I'm not sure that happens very often, certainly not in our world. So that's absolutely fantastic.
So
I'm looking forward to those different perspectives.
You can hear me, although I'm afraid I heard your technician, but I cannot hear the main conference. But if you allow me, even if I haven't heard the opening, to give a few words. So, honourable ministers, members of parliament, dear partners, Unite, Ricardo and team, and the Pandemic Action Network from with Eloise Todd. Ladies and gentlemen, all protocols observed. My name is Fredrik Christensen. I'm the Deputy CEO of CEPI, and very honored to share this engagement platform with you all. So thank you, particularly to Ricardo, Unite, and the team for organizing this global summit. And let me just say a few words about what CEPI does. So to pave the way for a further talk from Naren Rao, who is there, and Eloise Todd, who will moderate the discussion. CEPI was launched in 2017, really based on the experiences with the major Ebola epidemic in West Africa, where there was a tragic failure to prepare, or the world realized that we hadn't prepared properly for a foreseeable outbreak of an infectious disease, which cost the lives of over 11,000 people. And so the mission for CEPI is to develop vaccines and other related biological countermeasures against epidemic and pandemic threats, so that they can be prepared, ready to be deployed, and be accessible to all people in need. Because we do really think that there is a possible vision of a world where epidemics and pandemics no longer are a threat to humanity as we have experienced them now. Now, we do this as a coalition with collaborations with vaccine developers, manufacturers, sovereign governments, philanthropies, civil society, and other global health organizations with WHO, Gavi, and UNICEF in particular, and all the other multilateral organizations. And this allows the world to really pool and deploy resources in ways that nation states and even regional organizations often cannot. Because the backdrop here is that these kinds of outbreaks are unpredictable by nature, and at least unpredictable in timing, and as such, the industry does not have the necessary financial incentive nor the logic to really be sufficiently prepared. So CEPI was set up to pool finances and help the world to be better prepared. And we have embarked on an ambitious $3.5 billion US dollar 5-year plan, which we call CEPI 2.0, so that we can actually dramatically reduce or even eliminate the future risks of pandemics and epidemics. And we underpin this by 3 major objectives. One is to prepare for known pathogens that can cause epidemics and pandemics. The second is to transform the way we respond to the next novel threat, including the disease X of the future. And the third is to connect and enhance global collaboration in this area. So part of this, and a central part of it, is really to accelerate the development of vaccines and other medical countermeasures. And we've launched the 100-day ambition, supported now by the G7 and the G20, to really compress the time it takes to develop safe, effective, and globally accessible vaccines against new threats in just 100 days. And achieving this would give the world a fighting chance to tackling and containing outbreaks close to the source before they become really major pandemics. And combined with preparations for ensuring equitable access, this should give us a fighting chance to be better prepared for the next major outbreak. And in a few moments, Naren Rao will tell you more about the 100-day mission. But for now, I will turn it over to my both friend and our partner, Eloise Todd, who is the Executive Director and co-founder of the Pandemic Action Network and the moderator of this session. So thank you very much for your time.
Me thanking you, but that's a fantastic welcome to this session. And just to introduce myself a bit, Pandemic Action Network was formed in 2020, bringing together groups to advocate for not only the COVID response at the time, but also pandemic prevention and preparedness. And one of the things we're really keen to do, while there is a lot of action on the political agenda globally for pandemic preparedness, we're really seeing at the national level something of a dropping off for some national leaders in terms of the pandemic agenda, which again is why it's so exciting to have such a committed group of MPs in the room on global health more broadly, and today on pandemic prevention, preparedness and response in particular. And just know that there is this group of advocates, campaigners, comms people, policy people, all around the world that want to help and support MPs in what they do so that we can all work together to keep pandemic prevention, preparedness and response on that national political agenda as well as internationally. So I think moving on to our first speaker, we've got Naren Rao, the Director of Policy for CEPI, who is going to give us a presentation to a deeper dive into what achieving the 100 days mission and enabling equity will look like. Naren, you have the floor.
So to turn this on. Hi, can you hear me? No. Can you hear me? Okay, I'll speak. That's fine, I'm loud enough. Okay, good morning, honorable ministers, members of parliament, ladies and gentlemen. CEPI is honored to share this platform with you this morning to engage on our, not just present to you our work, but also have a two-way discussion with you on how we can jointly collaborate in order to ensure that we have a seamless end-to-end approach to pandemic preparedness and outbreak preparedness. So I'm going to focus to a great extent on CEPI's 100-day mission to contextualize what we need to do together. And this is by no means all that CEPI is about. We have a broad portfolio that I can't possibly cover in 20 minutes, but I'm hoping that using our 100-day mission, we are able to convey a compelling message of the need for collaboration and partnership in order to ensure an end-to-end perspective on pandemic preparedness and response. So, that being said, let's look at what the world needs as our point of departure, and then we could hone in on CEPI's role as an international organization, trying to take on leadership in terms of some of what the world needs, but needing to work with yourselves, other international organizations, other organizations like PAN and UNITE to ensure that we achieve our broader goal in terms of serving the world better in pandemic preparedness. Next slide, please. Okay, this sometimes takes a while. Oh. Do I have the clicker? Oh, sorry. Oh, sorry. Okay. There we go. Thank you very much. Sorry about that. Okay, my apologies. So, what does the world need? This is quite a scary shopping list if one looks at what the task before us. But I'll pick. Sorry.
Closer to your mouth for the
sure.
Translate interpreters.
Does that help? Is that better? Okay, excellent.
Thank you.
So the first item on our shopping list of what the world needs is we have to have the agility to meet surge demand during a pandemic or during an outbreak. We have to have the ability to rapidly develop the stock of vaccines or other medical countermeasure required to respond to an outbreak. Platforms and innovative technologies then allow us to respond rapidly. And in order for some of our partners to continue to be involved in the space, we need to ensure that where particularly large pharmaceutical companies are involved, there's a sustainable business model for them to remain in the environment even in non-pandemic times. And this was one of the challenges that many of us encountered during COVID. And lastly, we need a skilled workforce to support all of the above, whether it's the supply chain issues, the manufacturing issues, the R&D that underpins all of that. Okay, so that, in broad strokes, is what the world needs. So what does CEPI do in order to try to rise to the challenge and to play a leadership role in taking the world towards what it needs? I want to emphasize that we cannot do this alone. We cannot achieve very much beyond a fairly narrow mandate alone. And in order for us to achieve an end-to-end preparedness and end-to-end strategy in responding to an outbreak, we need to work with all these partners, and we need to engage and support these partners towards our common goal of pandemic preparedness. So what did CEPI do during COVID-19 in order to help the world respond to this crisis? And what are the gaps that we realized coming out of COVID-19? So firstly, CEPI has the world's largest vaccine portfolio. We have 3 coronavirus vaccines that have emergency use authorization, and I'll talk more about that shortly. We also work extensively to bring manufacturing closer to outbreaks. So geodiversification of manufacturing is one of the fundamental pillars to what we do. In order to bring vaccines into our environment, we need to ensure that there's the enabling science to support this. And further related to vaccine development, CEPI's fundamental focus, point of departure, is supporting R&D on vaccines. And lastly, I mentioned in the previous slide the supply chain challenge. And we've realized that if we want the world to have access, we need to look critically not just at manufacturing, but at the supply chain that will enable that manufacturing to take place. So CEPI's portfolio of partnerships and of investigational activities comprises more than 70 research organizations, international organizations, and other partners across the world. There are 250 awardees of our grants and technical support, and we're present in more than 50 countries. And all of this is dedicated towards not just realizing our mission of developing a vaccine in 100 days, but taking us closer, we hope, towards ensuring that when such a vaccine is developed, we are able to supply it to the world on an equitable basis, ensuring equitable access for all. So what are some of the vaccines that we look at? These are the world's deadliest viruses, and we are developing responses to them. If you look at the first few, MERS, Lassa, Nipah, with those 3, we have vaccines in development already. With chikungunya, we have a vaccine that's in the advanced stage of approval. And with many of the others, we have early stage development activities. So this is the portfolio that CEPI looks at. And as I mentioned at the outset, if you look at COVID, we have 3 vaccines registered for emergency use. So how do we get to this 100-day mission? What is this about and why is this important? If we look at the history of vaccine development, and we look at the first 2 on that list, typhoid fever and meningitis, plus minus 100 years had elapsed before vaccines were developed for those viruses, as responses to those viruses. If you look lower down that list, with Ebola, more than 20 years had elapsed before we developed an Ebola vaccine. For COVID, does anyone know how long it took us? Yes? Sorry, yes, anyone?
360 days.
That's it, very good, 364 days, well done. Excellent, sorry? Sorry? 6 months. Little more than that. So 364 days in total. In 6 months, a big part of the work was done. You're quite right. But the total time frame to get it to market is 364 days. So we're looking at 364 days. If we critically assess 364 days and look at efficiencies that we could possibly gain, we can bring that down to 250 days today. So how do we get to 100 days? That's the big question. And why is 100 days important? Let me make the case for that in the next slide. So the reason we want to do this in 100 days is because the easiest way to translate that business case is in terms of the millions of lives that will be saved. And here you see it. So if we looked at the 364 days versus 100 days, the difference in lives is almost 70 million. So if we get a vaccine in place in the first 100 days, we only have 2 million confirmed cases in that period. And that's why it's critically important to accelerate that time frame. And if you look at the end of that chart, 326 days, when the vaccine started into the market, you're looking at almost 70 million confirmed cases. So that difference of roughly 65 million cases is our motivation, our incentive to get this done in 100 days. Okay, for those of you into motorsport, if we had to translate that outside of the vaccine space, what does it mean? In the 1950s, I have a nice video, but I wasn't sure the technology would work, so I rather went with this. It's always safer. In the 1950s, when a motor racing vehicle entered the pit stop, it took them 1 minute to change the tires and dispatch that vehicle again. I would also lose 1 minute of my presentation if I showed you that, or more, so I couldn't afford that. It would take 1 minute. Today, when a motor vehicle enters the pit stop, it takes them 2 seconds to change the tires. It's the most remarkable thing to experience. And it's not just because the car is fancier and smarter. It's because the process that they follow to change the tires, to ensure that the vehicle is ready to leave the pit stop, has been honed to an art that allows them to save 58 seconds as compared to the 1950s. So they looked at every step of the process and they perfected it. And that was the difference between 58 seconds and 2 seconds. 60 seconds and 2 seconds, the 58-second difference. And that's the same translation one has to use in terms of saving lives. I don't want to make slight of the implication for lives, but we need to look at this in a parallel context as well to better understand why the 100 days is crucially important. Okay, so how do we start moving towards this 100 days? And what is CEPI's perspective on what we need to do in terms of the 100 days? So as I've said, we're a scientific organization. Our starting point is R&D. And we also look at manufacturing and the innovation and technical advancement that can take place there within that space. But at some point, we hand over to countries because we don't, at this point, have the capacity to deliver vaccines in arms. We leave that to other partners, and we leave that to countries and regions to take care of. So with an emphasis on the upstream side of the process of medical countermeasure development, what are the issues that one wants to focus on? First, on the scientific advancement side, we look at the development of vaccine libraries for each virus family. And the reason this is important, we're actually experiencing as we speak. Many of you know there's an outbreak of Ebola in Uganda. And despite the fact that we have a vaccine, it's for the wrong strain. So it is crucially important that going forward, we take a different perspective on outbreaks and viruses, not look at specific strains, but try to broaden our perspective to the overall vaccine family. Aside from the Ebola experience, we also experienced the same with COVID, where we were very in tune with members of the virus family, but not in tune enough that we were able to respond more rapidly to COVID-19. We need to develop rapid response vaccine platforms so that we can move quicker. We need to look at manufacturing and bringing manufacturing closer to outbreaks so that there isn't a delay in terms of moving medical countermeasures across the world and to places where outbreaks may originate. we need to look at regulatory frameworks, and this is where this meeting becomes particularly important, ensuring that we can prepare within our countries and within our regions for rapid approval, and within our countries and within our regions, we have the political environment that is conducive, not only to encouraging research and development, but to supporting that research and development with clinical trials. So the overall environment is particularly important. And to have your country or your region on the radar for global clinical trials is critically important, so that when a vaccine comes about, it is aligned with the needs of your particular population and their epidemiology. Lastly, and probably some would say most importantly, this was raised this morning, we need to look at financing for rapid scale-up in terms of outbreak or pandemic response. So, what are some of the activities we're involved in? And this is a snapshot of current activities, so it doesn't go back to the 250 plus partners we have. This is some of the activities happening right now in the recent past. So we have, from COVID to now, scientific advancement in terms of those partnerships with Moderna, with AstraZeneca and Oxford, and the University of Queensland and Clover. Then we have, on the development side, and particularly on the manufacturing side, the development, CEPI's leadership in a COVID marketplace. And the COVID marketplace is particularly involved on the supply chain side. It connects the parties who require raw materials with those who have a surplus. It connects those who have additional vaccine or medical countermeasures with those who do not. Okay, so the marketplace tries to matchmake, and it tries to ensure a more fluid response in terms of outbreaks. We've also recently signed a deal with Aspen, the Serum Institute, and the Bill and Melinda Gates Foundation to drive forward vaccine manufacturing in Africa. You can read more about that online, or I can talk to you in the break around that. And lastly, advocacy is a big part of what we do. And we advocate for what we would like the world to look at. We advocate for an improved pandemic preparedness and response ecosystem at the G7, the G20, events like this, and with CSOs as well, hence Eloise being with us today. Okay, but access is crucially important to our plan. All the research, all the innovation, all the manufacturing investment will fail if we cannot get vaccines into arms. And how do we ensure that we do that? And we try to do that as close to this 100-day window as possible. It won't happen within 100 days, but as soon thereafter as possible. I've made these points. To achieve that, we need to work together, and this is where the collaboration argument becomes fundamentally important. So CEPI is involved in order to trigger equitable access, in order to trigger broader access. CEPI ensures that in all its R&D contracts, it has equitable access provisions. It compels its partners to ensure that while we're funding their research and development activities, they have an eye to the future in terms of providing access. But that's not always difficult to ensure, because we sometimes exit the partnership when the vaccine is being deployed. So we rely on others to try to help us enforce that our funding recipients behave in a bona fide manner in terms of equitable access. I think I've made the point around manufacturing sufficiently, so I'm going to skip that. I've mentioned the COVID marketplace, also critically important to access, and something we don't often speak about perhaps openly enough, is we need to ensure the price of the product is sufficiently affordable. Not just at the country level, but also when it comes to global organizations like Gavi, making certain that it can, for each dollar, cover as many patients as possible. So price is critically important, and for our investment in R&D with companies and with research organizations, we try to influence them to plan for an affordable price down the line. So, how can you support us in terms of this mission of developing a medical countermeasure or a vaccine response within 100 days and having vaccines in arms as soon after 100 days as possible. Firstly, at your leadership level, in your countries, with your policy influence, you need to ensure that you plan for a range of responsibilities, a range of possibilities. This is a COVID lesson, that we don't take a narrow perspective on an outbreak. Some of you will remember that when COVID first came about, they said it was not an airborne virus. Do you remember that? They weren't sure that it was an airborne virus. And only later on did we learn it was an airborne virus. So those kinds of missteps cost lives and impede the speed of response. So we need to plan for a range of responsibilities to ensure that whatever comes our way, we are prepared effectively. Secondly, we need to reassess our strategies around the way in which we test and our the diagnostics materials that we use, the therapeutics that we may use outside of vaccine responses, and non-pharmaceutical interventions, the behaviors that all of you remember that were orientated around COVID. We also need to collaborate around sharing of information and surveillance, around sharing of pathogen characteristics, genomic sequencing information. That's crucially important. And then when, God forbid, an outbreak does face us, we need to ensure that we don't resort to behaviors that are myopic in their perspective, and those being trade policies that trigger vaccine nationalism and prevent vaccines from being shared across the world, as one example. I spoke about geodiversification and equitable access, and lastly, if I didn't call on you to support the work of CEPI, I would be amiss in sharing this podium today. Thank you very much for allowing me this opportunity. I look forward to chatting with you in the course of the day and at the dinner tonight. Thank you. Thanks.
We're now going to start with our parliamentary panel with a series of 5-minute interventions by our distinguished, august panel of parliamentarians. And it's my great pleasure to start and introduce the president and co-founder of Unite, the Honourable Ricardo Batista Leite. Thank you so much for having us here. The floor is yours.
Thank you, Louise, and hello again. I promise I won't be on every panel, so, but I've been asked to be on this one, and I'm really happy I can, because it's such an important topic. I must say that Unite is almost a twin brother of CEPI in a way. We were born in the same year, in 2017. And at the beginning, we started off, Unite is now the Parliamentarians Network for Global Health, but we started off as the Parliamentarians Network to End Infectious Diseases, with a very clear focus also on pandemic prevention, preparedness, and response. And we were very fortunate to work very early on with Richard at CEPI and with many other organizations that were being set up precisely amongst the fear that we would not be prepared in the face of a new pandemic. Well, then COVID hit. And I remember how we were discussing Disease X as something almost science fiction, and then seeing how important those 4 or 5 years of work were critical to make us accelerate to the 364 days. And now we need to accelerate more, as we have seen. I would say that we need to understand, and as policymakers, we all, I think, understand this now better than before the pandemic with COVID-19, is that we cannot expect to learn to fly after we jump off a cliff. And this was more or less what happened throughout the pandemic. And this is a problem that we need to address head on. We must admit, in many countries, policy-wise, we reacted exactly the same way as we did in 1918 with the Spanish flu. There were many advancements that we did not embrace technologically. We did not use the knowledge that was collected over those 100 years. But fortunately, when it comes to vaccine development, we were better prepared. And that's why, looking at that graph of how long it took before to develop vaccines and to see how long we were able, this global multilateral effort of pushing technology in the right direction was so so critical and saved millions of lives. Of course, on the policy side, there's much more that can be done. Right now, following the mandate given to WHO at the World Health Assembly, a pandemic treaty is in negotiation right now. We're going to be talking about this further on. It's so important that we as parliamentarians are part of this discussion. Many of our countries demand that a treaty, if it is passed and approved by governments, it will need to be ratified by parliaments. And the truth is, there is a lot of pushback already from the general public on these issues. Because, as Ilona mentioned at the beginning, the importance of human rights, how many people felt that these human rights were not respected throughout the pandemic, have led to people many times not trusting their representatives. And also I would add to that the acceleration of technology, the fact that we developed the vaccine in less than a year, also leads to suspicion. You know, when you ask someone to vaccinate a child, as a father myself, you understand how you feel mixed feelings when dealing with those issues. We need to understand this. We need to understand the behavioral sciences also to be able to incorporate this into the development of policymaking. And we need to do what both Frederick and Nirim mentioned, which is our capacity to detect outbreaks before they become pandemics. Much must be done there. But also to have the tools needed to act both in endemic and in pandemic situations. And so the investments on research and development, I would say, are critical. And you put out many ways that governments can do that. But for governments to do that, we need budgets to allocate the funding. And that's where parliamentarians also play a very important role in keeping governments accountable to not only their international commitments, but also to the responsibilities of keeping their people safe. And as been said already, no one is safe until everyone is safe. And so it's not something we can solve alone in each of our countries domestically. We need to work inevitably together. And we heard how globalization is being redefined. The truth is, the idea that we can count on one country or one part of the world to provide us with essential needs and goods for the rest of the world is something that failed to correspond then to the needs of the people in a timely manner. So this redefining of globalization, this regional autosufficiency, which is being debated right now, it is very important for us as parliamentarians to be in the forefront of this discussion to make sure that this is actually something that can help us grow in terms of multilateralism, make globalization even more effective for the populations and not to be part of the anti-globalization movement which exists and that may undermine our efforts once again, because without multilateralism, we won't be able to solve the issues. And we need capability of response for an accordion kind of model in which, working globally, we need to grow teams and shrink in them based on health emergency status. And this is something that policy is not so good at because it is slow many times. So we need to present, as you were saying, in policy innovations that can present us with the tools so that everything can happen in a seamless manner, so that when needed, when we enter emergency mode, everything is prepared, everybody knows who does what, where, and when, and where are the resources to get that job done. There is so much that needs to be done. The research and development gaps were mentioned. I won't get much into detail. They were very well presented. But the library of prototype vaccines, I think, is so important. And also the genetic sequencing tools will be extremely important as we move forward. You were saying, too, the need for speed. I have teenagers at home. They would say too fast, too furious, probably. But we do need to accelerate the agenda and establish a global network of lab capacity, which is still not exactly where it is needed. As I said, keep governments accountable, have mechanisms that can make sure that every part of the system, and including every government, is doing their job. That kind of accountability mechanisms is so critical. And to make sure that we also learn from how we were not able to avoid tremendous inequities during the COVID-19 pandemic when it came to vaccine distribution. And this between the rich and the poor countries is something that I think that, of course, on day 3 of the summit we will address on human rights. But this is something that is critical because what we may see in the future is the next pandemic may be not so kind in certain aspects as this one. And of course, tools that were created, not to perfection, because they were created on the fly, like COVAX, like ACT-A, but they were mechanisms that are there and that we should foster and develop and perfect so that they are capable of doing what is needed when the time comes. So I conclude by saying that we are in a very unique moment where I think there's still political will that we can build on. We have practical experience that is still close to our knowledge and to our heart through what we are living. That we have technical and scientific progress that we have seen accelerate throughout the pandemic. And so we have the technology, we know the paths that need to be followed when it comes to science, if we want science-based and evidence-based policymaking to become a reality. So at the end of the day, we need strong political leadership to get the job done. And that's where parliamentarians now have to step in and say that they are capable of leading the way. And when governments are not doing what they need to, parliamentarians need to give that extra push. And I'll stop there for now. Thank you.
Thank you so much, Ricardo.
Thank you.
We're now heading west over the Atlantic, and I hope the Honourable Saray Núñez Cerrón is going to be able to join us on screen.
Hello? Everyone can hear me?
Yes. Can you hear us?
Yes, I can hear you.
Fantastic.
Well, thank you so much. I'm really, really sad I cannot be able to be with you. Hello from Mexico. It is 4:34 a.m. right here. But I just have to say that I'm very honored to be in this panel. I finally finally he can hear Ricardo. I wasn't able to before. And I need to, first of all, thank Unite for this opportunity. And of course, say hello to all my fellow parliamentarians that are sharing this panel with me. Mexico's case is one we can study closely of how can we impact. So far, Mexico is close to report 8 million cases of COVID, and we have so far measured close to 600,000 deaths. The first thing we must focus on is that this COVID outbreak started in Mexico 58 days since the first outbreak began. This is close to 1 month and a half. It was on February the 28th. 2019. It was a month later that we finally established the long distance campaign. But one thing I must tell you all, we as governments or parliamentarians never really assumed that masks were useful. Now we know they are. This is why I believe that multilateralism, which Ricardo just talked about, becomes so important. And panels like this definitely save lives. We could have saved thousands of lives in Mexico. And that's why I also believe initiatives such as CEPI are crucial for this. We're talking about lives of people. And I believe that as parliamentarians, we should definitely expand and focus on things such as investment. One thing that many countries, and one, I have to say Mexico, are turning a bit away from it, and this is research and development. We have to pursue the goal to strengthen defenses against future known and unknown threats, as well as definitely accelerate vaccines development timelines by developing countermeasures for most prominent known and epidemic and pandemic threats. As I said before, we as parliamentarians approve national budgets. We have to put people at the center. With regards to health, it is definitely crucial to reduce the global vulnerability to threats of novel pathogens outbreaks that we now know can happen anytime. So I believe we should definitely focus on how innovation and technology systems can help us through this. I can think of many ways, especially condition of prices of products that were definitely something that Mexico at the very beginning of the pandemic suffered from. We cannot reach products like health products, so those that were in the first row attending the pandemic, and I'm talking about all the medical institutions and of course its people, doctors, nurses, and also I'm talking about allocation, data sharing, and transfer of technology in publicly funded research and development, which will definitely help in the result of more equitable access to medical countermeasures. Preparedness also has to do with ensuring equality. Equity must be at the center of all aspects of pandemic prevention. Preparedness and response, we have to make sure has to be effective, fair, and timely. I began by putting an example of how it took almost 2.5 months to establish a measure such as the distance measure, which was so simple and could have been done much earlier. I am convinced that as parliamentarians now must focus again on preparedness, on budgets, and putting people always at the center of our decisions. Thank you so much.
Thank you so much. And a huge thank you from all of us for giving us your perspective at 4:30 a.m., really above and beyond the call of duty, and we've really enjoyed hearing from you. We had a couple of difficulties with the sound, but actually most of it I think we got, so thank you so much. So we're coming back to the room now, and now to the Nigerian perspective. It gives me great pleasure to welcome the Honourable Benjamin O. Kalu. It's so great to have you here. You have the floor.
Thank you very much for having me, and I want to appreciate CEPI as well as Unite for the great job you are doing. You can hear me?
Yeah. Yes, that's working. It's working.
It's working now. I was saying I want to thank Unite for organizing these global summits, and I also want to appreciate the great job you've been doing. I've followed up your work for quite some time, including the Parliament. In Nigeria, I'm the spokesperson of the House of Representatives, and I'll try to showcase the job you are doing to the Parliament, and the Speaker send his regards. CEPI, getting to know a lot about you today, and so impressed with the job you are doing within this space. I'm happy we're bringing this discussion closer home, and the intervention from Mexico shows what is happening in their country, and I'm going to be using Nigeria as a case study. The historical aspect of it, where we were before the pandemic, what we did during the pandemic, the challenges there, what we're doing about the challenges, and what we think should be the task of the parliamentarians and the way forward. So you will recall that 2014 came with Ebola, which Nigeria was one of the countries that experienced it. It left a bitter taste on our lips, but suffice that to say that there was an advantage there because it helped us sensitize the system, the health sector and the government. And the menacing impact of infectious diseases such as COVID and pre-warned us about an occurrence like COVID happening in the future. So based on that, the government and the health sector stepped in to strengthen the laws around the national disease control agency of the government. And as well as also made us adapt quickly to the protocol. You recall that Nigeria, handled the issue of COVID more than most nations expected. It was a success story. The reason being that there was like a mock trial for us. There was a preparatory aspect of it which was offered by COVID, by Ebola. But that did not happen without struggles. We experienced our struggles. And the struggles as well came with new learnings. And those new learnings revealed a couple of information that has made us so uncomfortable and is of a concern to us. And I'm happy we are discussing some of them today. And I'm happy that agencies, bodies like UNITE and CEPI, they are looking into some of those critical areas that are of most concern to us. We found out through the new learning that Africa was very poor when it comes to vaccine manufacturing. In fact, the gap that we need to fill in the space is huge because the knowledge revealed that about 96% of our vaccines we have imported, as well as 70% of pharmaceuticals. They were all imported. And that is not healthy for a nation that is channeled towards health security. We also discovered that most of the companies in Africa playing in the space of vaccine production, because it's a major concern for us. Vaccine was the major issue. It wasn't about obeying the protocols. It wasn't about adapting to the challenges of the COVID. It was about how do we solve it, with vaccines. And we found out the new learnings was that most of the companies playing in the space were handling it at the peripheral level. There was no upstream production. What we had was packaging and labeling companies. We had fuels companies participating from time to time in fuels and finishing stages. And that is not really what Africa needs at the moment. And we also discovered that the continent and the concept of the globalization that we are talking about, where we say each is a part of the whole, that was eroded by this health insecurity that was brought by COVID. It appears every nation, every continent went to their tent to serve themselves first. And 1 billion people from Africa were out there looking for help. So the concept of interconnectedness, being one part of the whole, did not play out because the issue of charity beginning at home was more of what was adopted by most nations. Let's save ourselves first. You wouldn't blame the nations because, you have to be saved first before you save the other. That calls for us to think deeply on how to make sure that what affects one part of the globe trickles down to the rest of the globe. The issue of stockpiling vaccines in some parts of the continent, while Africa was in need of this said vaccine, is against the principle of globalization and making sure that we are one small community all in one. The challenges has been, how do you address this issue of lack of vaccines? What are the countries doing about it? You find out that vaccine manufacturing is not as simple as just building a factory. You build a factory, and that is all. No. It's a mixture of so many things. It's a complex endeavor that involves a whole lot of things. And for it to be sustainable, for us to be able to produce locally, some of the concerns, some of the challenges need to be looked into. We discovered some of them. One, the people, the money, the technological know-how, that is knowledge, and regulatory bodies. When you talk about the people, you talk about brain drain. In search of greener pastures, most Africans who are well-educated, who are sound, who will be able to work locally to help the manufacturing of vaccines in our country are all overseas. Most of them are overseas. So that leaves a gap in Africa where we need to train and retrain so that we can build a new team with the right skill set to be able to play this role, because coming all the time from Europe or America to solve our local problem may not really be what will give us a sustainable, a lasting solution to this problem. So a new workforce needs to be raised. The second one is there is no predictable and sustainable financing. That is the money. You know, it costs money to get this done. And you know, Africa is in debt. And most times they are indebted to the advanced countries. Allowing Africa to build the base for the production of all this vaccine that costs a lot of money may not be achieved in a long while. So the dream of 100 days production of vaccine might be a far cry if Africa is left on their own to raise the resources to get this done. That calls for another issue that we have been projecting, that debt forgiveness or debt cancellation in view of COVID impacts that has impacted most African countries should be something that should be placed on the front burner. Because if you, cancel some of these debts, you find out that the money will go back to doing this by ourselves. The next is the issue of knowledge access. I've heard you mention it, CEPI, when you were presenting. They call technologies of vaccine production is not, the core knowledge of that technology is not what you find on the streets. It's something that must be, transferred from those who have, proven to be the experts in it, and Africa we don't have a lot of that at the moment. So it's a problem. If we want to produce this, like I wanted to mention this before I started, when you say production in 100 days, I hope that production also includes distribution, because there is no need producing in 100 days and it's not getting to my rural area in 300 days. It defeats the essence of the speed that we're all looking for. The 100 days production is to make sure that availability of vaccine is there for the affected communities, for those who need them. So if you produce in 100 days and it gets to me in 200 days or 300 days, it's not delivering the objective of this target. So we must try and find a way of putting in distribution into the mix. And that brings me to, supply chain. In Africa, it's a problem when you talk about you need a strong supply chain, facilities like storage facilities, Thank you very much. I hope you can hear me now. Thank you very much. Now, you have regulatory bodies, and regulatory bodies that we have in Africa, most of them are not as experienced as they're supposed to be. For you to regulate, knowing when to regulate, where to regulate, how to regulate, you need experience. Experiential knowledge, expertise is important. We are legislators, and legislators, we make laws. And some of the laws we make must be based on knowledge, must be based on credible information. And those who go there to implement them must be those who understand the intent and purpose of making those laws. And so when you set up regulatory bodies and you fill it up with those who are not well equipped, what are they regulating? Because you need proper regulation to be in place for this to be sustainable. The next one is corruption. It's a challenge. There is corruption everywhere, don't get me wrong. Transparency International will tell you that. But it's high in Africa. How do we go around that? It's one of the issues that must be considered in the mix if really we are serious about achieving this target. The question becomes, are we just talking about the problem, or we have taken steps towards solving them as a nation? I will speak as a Nigerian, and I'm sure the situation is the same or almost the same in some of the African countries because we share almost the same issues. What has been done so far is that in sustainable financing, as a nation, we have been able to draw up a joint venture establishment with a local pharmaceutical company known as May & Baker. We formed what we call the BioVaccine Nigeria Limited. The BioVaccine is expected to produce vaccine in the coming years. But for the time being, they are going to start with the usual field and finishing stages. In the coming years, we hope that it will not be 10 years. When we say coming years, we hope it will not be 5 years. And that is why this conversation is important, because I know in this room are stakeholders who will help to make sure they shorten the time for this particular establishment. Good idea of the government that it comes to fruition by supporting the government or becoming part of the partnership. Nigeria is open to bring in more partners into that. But in order to be sustainable, the nation has already agreed to source 15% of all vaccine supplies from these joint venture establishment, which means there is a reduction from the 96% of vaccine importation to about 81% if we achieve what we want to do with this particular BioVaccine Nigeria Limited. I want to say kudos to the World Health Organization on technology transfer. We have been asking, when is this going to be done so that we'll build ourselves to be able to solve our problem? And I am happy to celebrate WHO for establishing a global technology transfer hub for mRNA vaccine in South Africa, set up to train and license local vaccine manufacturers from Kenya, from Nigeria, from Senegal, from Egypt, and from Tunisia, which is almost the various parts of Africa, the West, the South, the East, and all that. That is very impressive because it shows there is hope. So I celebrate you, WHO, if you're in the room. It's a good step in the right direction that we can go and be well equipped. Nigeria has also taken what we call the Nigerian vaccine policy. The Federal Ministry of Health developed this policy and launched what we call Nigeria vaccine. The aim of this is for us to be, self-sustainable with regards to vaccine production. While we are looking for help to come from overseas, we want to be able to control our own brand as well as our own supply chain. We have also inaugurated what we call the Technical Working Group Committee for Local Vaccine Manufacturing in Nigeria. What is the expectation of the people on this particular project from the Parliament? How can the Parliament help? You know, it is the duty of the Parliament to stimulate the discussion about this local vaccine production. It's a political process. It doesn't just happen. We have a role to play, and there are few of us in the Parliament who even understands what this topic is all about. Most of them are interested in their constituency projects. They are not looking at the globe and the impact of what they do in the Parliament affecting the entire globe. So there is the need for strong advocacy group to be built around the Parliament, around the parliamentarians. And I want to celebrate Unite again for these good steps they have taken by bringing parliamentarians closer to health sector and issues around the health sector. But more work is needed there because some of these jobs are done through voting in the Parliament. If you don't have enough members in the Parliament supporting your proposition, they will not be able to push it through. Finally, I want to say that the role of the Parliament in encouraging local vaccine production must be considered through the lens of their constitutional powers and function, which is one, lawmaking, appropriation, like you have mentioned during your discussion, because if we allocate more budget to health, then there will be enough for this to be done. Oversight function, when the establishment of this vaccine production starts, how do we go through to make sure that they comply with the world best practices? It is our job as parliamentarians, and also representation, making sure that what is done there reflects what will benefit our people, not what will be against our culture, our other interests, but it will be something that will not only solve our health problems, but also build our people in line with human rights, expectations, and all the rest of them. I don't think we have more time. Maybe if given another time, we'll discuss other steps that we have taken so far and what we can do going forward. Thank you very much.
And we're so grateful that you managed the trip. I know it wasn't easy getting here, so thank you so much. We're grateful that you got here. Now over to our last parliamentary speaker, the Honourable Kelvin Lee Wen from Malaysia, our fourth of 4 continents. You have the floor.
Thank you so much. Could you hear me? Good afternoon, and thank you so much again for CEPI as well as Unite for the great works that you are doing. Thank you so much for all the health activists and organizations, and of course, fellow member of parliaments. It's always hard to come in last because most of the important points have already been mentioned, but as politicians, we like to reframe it and rephrase it and make it our own. My name is Kelvin. I'm a second-term member of parliament. We just had our elections about 3 weeks ago. So it is 8 hours difference from Malaysia. So I slept at 4 in the morning. So if I go rambling and all, please forgive me. I took some shots of coffee just now. I was the chairman for the Select Committee for Health. I lost my job during the election. Hopefully we're reappointed, or even better, moving forward. But today I just want to share in context of certain general principles of what we have learned from the pandemic itself and what the roles as we parliamentarians moving forward, as well, if we have time, of course, the lessons of Malaysia and how we as a global entity can move forward together. So we know that COVID-19 is not the last pandemic that we're going to face. We know that the next pandemic is closer than we think, especially exacerbated by climate change. There are hundreds, if not thousands, of zoonotic diseases that are getting ready to jump from animal to human ecosystem. And this is something that we need to be prepared and to a certain extent institutionalize our approach, our lessons learned, and what each country has done when we face a pandemic in the future. So just now, our very distinguished panelists mentioned that the COVID-19 vaccine took 364 days, and this was a medical and, of course, scientific wonder. And I like to, of course, multifactorial how we managed to do it within a year. But I'd like to maybe to a certain extent summarize into 5 factors why I believe it could be done because we want to learn from the lessons, how we can improve. And in my view, the bare minimum in the next pandemic is how can we replicate this timeline. This is the bare minimum, of course, we want to improve. But the 5 main factors I believe that we could achieve in 1 year was, of course, number 1, there was better science advancements. There was more vaccine scientists, and of course the inventions of mRNA vaccines, which of course is not new. This was since the 2000s, and the knowledge that we had helped us in coming up with the vaccines really quickly. Second point is, of course, better philanthropy, better governmental funding and support. Third, of course, greater collaboration, data sharing, knowledge sharing, and of course, more volunteers for clinical trials. And fourth is, of course, the pharmaceutical companies were backed by market guarantees. We know that even before the vaccines were produced, governments were buying and pumping money into the pharma companies, and this is something we have to acknowledge. And of course, the last one is the necessities. It's because of loss of lives and livelihoods that push pharmaceutical companies, scientists to develop it at record speed. So by acknowledging these multi-factors, how can we improve on it? And as I said, bare minimum to have it within the year for the next pandemic. So moving forward, as I said, COVID-19 was a stress test, not just for our individual countries, but a global entity. And how we respond to it determines our future. So parliamentarians, as we are parliamentarians, our job is, of course, to propose policies for domestic and, of course, international regulatory framework and ecosystem. And again, I would like to propose 5 major policy directions which Malaysia is of course focusing on, and something that I think on a global entity and a global stage we should be as well focusing on. Of course, number 1 is that conducive, and it was mentioned again, conducive policies and infrastructure to enable innovation. This is of course enhancing platforms to facilitate rapid production and scaling, preparing supply of commercial quality raw materials, clear procedures, checklists for rapid adjusting existing process to new pathogens, and all this could be done even before an outbreak. And number 2 is something, of course, very important, very sensitive, but very important, is of course robust and comprehensive inter-country and global data sharing, knowledge sharing, implementing best practices, leveraging on each other's scientific development, and of course, uniforming global medical regulatory framework. So in Malaysia, it's the NPRA, the National Pharmaceutical Regulatory Agency. In the US, it's the FDA, the EMA, and the European. How can we uniform it so that we do not take time individually to approve any drugs, any interventions, any pharmaceutical drugs, or even vaccines? How can we do that in a more efficient way? Number 3, investing in, of course, global capabilities for early characterization of pathogens and outbreaks, and also assessment risk of severity. And number 4 is also very important, education, empowering the people by breaking misinformation early. Like in Malaysia, one of the issues that we face is the rising case of fake news, misinformation, even issues of emergency use vaccines. Actually, we need to educate the people even right now what that actually means, what the procedure is, so that they understand, so that in the future when vaccines are approved or produced in a faster period of time, they have certain assurance that it is safe to be used and it is the risk outweighs, the benefits outweighs the risk. Communications is something communications framework, we have to be doing it right now. In a public health crisis, I'm a trained medical doctor, in a public health crisis, communications is as important, if not more important than sometimes the medical intervention. Because in order to get in a public health crisis, people's compliance is important. And to get people to comply with such interventions, they need confidence in the system. And the best way of confidence is communications. And of course, number 5, and this was mentioned by my distinguished colleague again, is fair, transparent, and equitable, not just inclusive and accountable distribution network, not just internationally, but also domestic distribution, as you mentioned, how it goes from the cities to the rural areas. And this, of course, includes the controversial topic of IP vaccine waiver, whether it's needed or not needed. You see, vaccine in vials do not save lives, but vaccine in the arms or in the bodies of people, that's what saves lives, and that is our challenge as policymakers. If I may comment, for me, I think the approach towards COVID, we have ups and downs, we have best practices, we have done great things, but vaccine inequality is one of the biggest moral failings in our collective response to COVID-19 pandemic. At the beginning, when the world was told that there were vaccines available, there was great hope for global solidarity with even establishment of initiatives such as COVAX. but we have seen how the delivery was lacking, and it fell short of what was planned, especially when we see bilateral deals taking precedence over international collaborations and global solidarity. So in Malaysia, we support the call of WHO Director General of an international agreement on pandemic response. But this agreement must not only be inclusive and accountable, but it must be equitable and transparent. Now, what do I mean by that? Inclusive means that we may be invited to the table or into the conversation. But equitable means that we enjoy the fruits of the discussion in timely and equitable measures. Accountable may mean that we are all represented, but transparency means that we have the sight, we can see the deliverables, the deals, and even the data. So just really to summarize, in Malaysia, I think the things that we are looking at is, of course, we want to institutionalize our approach towards COVID-19. It was the biggest stress test. It was the biggest lesson. It exposed our inequalities. It has exposed our underfunding towards healthcare. We want to institutionalize it. We want to learn for the future. We, of course, invest in our vaccine production. Recently, we announced a 30 million investment into our own national vaccine development blueprint. We had some knowledge transfer, same fill and finish that we have done during COVID-19. We actually proposed tax exemptions for 10 years for companies to invest in Malaysia, and also other tax incentives further after 10 years for vaccine production companies to invest in Malaysia, and of course to provide all of society, all of network, a united, allied healthcare to unite the governmental, public, as well as the private sector in healthcare. And I'm going to end with this challenge to fellow parliamentarians. You see, I mentioned just now I was a trained medical doctor. Doctors save lives one at a time. But parliamentarians, we make decisions on policies that change the nations. People always say healthcare officers are the first line of defense. Fact of the matter is, healthcare officials are the last line of defense. We policymakers, we are the first line of defense. And we have to make good decisions so that the last line of defense do not have to make decisions who to save and who to let pass away. And with that, thank you so much.
Thank you. That's great. So we've got a little bit of time for some discussion with the audience, about 10 minutes, if we just go a tiny, tiny bit over. If you could please put your name card on the side to indicate that you'd like to speak or contribute, ask a question, or... Fantastic. Here we are. If you'd like to introduce yourself when you come in, and then after that to you. Thank you.
Thank you very much. My name is Nigar Arpaderai. I'm the Member of Parliament from Azerbaijan, and I'm also chair of subcommittee of Public Health and Sustainable Development of Parliamentary Assembly of Council of Europe. It's my pleasure to be here in this beautiful place, and I would like to thank the organizers. It's an amazing opportunity to speak and to see the industry professionals, coming together and discussing this important subject. The important thing is that what is clear is that vaccines played a pivotal role in improving public health. This is clear. Vaccines over time, they saved lives of millions of people. But why do we have vaccine hesitancy in case of COVID-19 vaccine? We have to come up with a question. I think that the reason is the mismanagement of overall process of mandating and promoting of COVID-19 vaccines. Because now that we have 2 years passed since the time of the first lockdowns and the COVID-19, I think we have to come up together to discuss the overall effect of vaccination, of lockdowns, of, let's say, homeschooling, and all these sort of things. And we have to convince people that they do need this vaccination, because when industry professionals come together, vaccines is a science, and science is based on critical thinking. And epidemiologists and health practitioners, they know why they are doing, but public doesn't know. So we have to make sure that we explain them. We have to answer the questions. Do we have enough analytical data about vaccination? Do we have enough data about testing? And do we have information about side effects of vaccines? Do we have them? Now we speak about 100 days of vaccine production. Yes, that's the challenging thing, and that's an amazing thing that people will be doing. But how are we making sure that there are no side effects of such vaccines, you know? So the dialogue and the public discussion on this subject is important. And also we face the situation when, for example, some bureaucrats and some politicians, they make decisions, but they are not epidemiologists. For example, when they do make decisions because of their, I don't know, their certain political wills and political desires, but their decisions affect lives of people. We also have seen greed of a pharma industry. Like, we have to face these challenges again. So my call is that let's discuss the overall thing, like importance of vaccinations is clear. Of course, vaccination is important, but we know one thing also, that vaccines do not, let's say, stop the distribution of the illness. In this case, for example, decision like COVID passport, is it important or not? So the dialogue is important, and the open information and the professionals being here, I believe that they do have something to say. And again, I would like to thank the Unite. This is a great initiative, and I'm really happy to be here. And I think that, again, it's important that the professionals discuss and then the politicians make a decision, you know. So that's why thank you very much for giving this chance. Thank you.
We've got several people wanting to come in this central section, so please, honourable friend, and then behind you, in fact, this whole row. So we've got middle of the middle row, back to the gentleman at the back, and then your neighbours after that. Please, the floor is yours. Yeah, yes.
Thank you so much. I'm Given Katuta, a member of parliament from... Thank you so much. I'm Given Katuta, a member of parliament from Zambia, and I just want to add a few words, maybe in form of questions, regarding the 100 days of vaccine, of manufacturing of this vaccine. I must agree with what Honorable Kalu said. We are from Africa, and I represent a rural constituents where in Africa people are so they're so afraid of just being given any kind of vaccination because of the myths which they believe this is what it is. There's a rumor Africans are supposed to be eliminated. And there's a rumor that when Africans get such vaccines, they will not be having children so that they reduce in population. There's a rumor you get that, this and that. Now, if you talk of the 100 days, I was equally worried. If you look at the HIV drugs, it took time for the drugs to be, to be tested, clinically proved, and this and that. Now, for COVID, most of people had questions. Why are they in a hurry? Why are they in a hurry? Okay. And when you look at that, it's something that we need to, first thing, the members of parliament from all over the world, especially in Africa, to be informed. Can you start talking to your people? This is an emergency. And it's a reason why we've come up with this medicine. Even if we have some medical doctors in our parliaments who would stand up and say, but this has not been clinically proven. So we need to have a strategy that should be, in place in case of such pandemics like we had COVID, whereby all the members of parliament, especially in Africa, especially in Zambia, where we don't just get anything. We are so much, we are not like, in Africa, we are not like our...
in the US. I wanted to ask a question. It is part curiosity, but part also because I think it might help us to understand how you dealt with this particular challenge, although it might be outsized in the US. When we're talking about vaccines, there is an outsized and both sad and tragic part of our culture that is deeply anti-vax, deeply anti-science, And therefore we had, as you know, we've had issues all over our country when vaccines became available. And it is sad enough to hear some of the conversations about countries that didn't have access to them at all. And then when they were completely accessible to all of our citizens and non-citizens alike, and yet you had entire sections of our country that didn't want to get them for all sorts of reasons. So since we have, Portugal, so Europe, Nigeria, Africa, Malaysia, Asia, I just wanted to, both for curiosity's sake, but also how did you, in your particular countries, how did you feel was that something that was present in the conversation about whether vaccines should be taken or not? And how did you deal with that challenge locally?
Take as many comments as possible before going to the panel because we're under a bit of time pressure. Lady in front, please. As brief as possible, please. Sorry to... We've got two here, then one there, and I think that's probably going to be it. Please.
Thank you very much. My name is Nima Lugangira. I'm a member of parliament from Tanzania. And my question is I'm just wondering in terms of what support or, genuine support from the global North countries to support global South countries in our own local laboratory and making our own vaccines. Because I remember during the COVID, we were kind of marginalized and we had no vaccines, and we could see the global North having as many as, up to the point of having even excess for booster shots and whatnot, whereas the rest of us had nothing. And the global North had zero regard about, global South countries. And this goes back to the fact that no one is safe until everybody is safe. But when African countries started talking about developing their own vaccine, it seemed as if the global North didn't recognize that interest or even come forward to support. So I just wanted to understand, genuinely, what is it? Or do we just talk on paper, but in reality, we want to make sure that we hold on to all the money ourselves, or what is it? Thank you.
Thank you. And then your colleague on the same row, and then the gentleman.
Thank you very much. My name is Dr. Ruth Labode. I'm a medical doctor and a public health specialist and a proponent for vaccine. Come rain, come sunshine. The first phase of COVID, I nearly died in hospital. I was one of the first people that went in hospital, and the news went all over the country. When by the grace of God, I came out of that, I promised myself that if there's anything that will help my people not to go what I went through, I will work for it. I was one of the first day that the first vaccine was given to Zimbabweans, head of state, ministers, and parliamentarians. I was among them. And I told my people in Zimbabwe that do not listen to those who are telling you while their people are being vaccinated that you should not be vaccinated. Because this is a do or die situation. I would rather die being vaccinated. The whole parliament of Zimbabwe, every Zimbabwean is vaccinated with 2 vaccines. We would not let you into the parliament to bring your COVID. We said no. You cannot go and change your car at a CVR in a government without you being vaccinated. You, in a government institution, you must produce your vaccine. That was a decision we took. But for us, it was important. Why? Because we had no other solution. And by the way, as a government committed money to buy vaccines. We never ran out of vaccines. We had one of the highest vaccination rates because we were determined. And you sat there while the Americans were going for the 4th vaccine, and you are in a 3rd world country wondering why you should take the 1st vaccine. No. So if I have money, let's say I have money now, and I want to put it on vaccine, should we put the money on research that will give us results in 5 years' time, or we should also put on implementation? Something must be done now. And that's what we did. I'm sorry.
Thank you. Please, last comment from the floor, and then I'm going to come back to our panel before we close.
Muchas gracias. Yo vengo de Chile. Chile es un país que yo tengo 5 dosis. Y escuchando a la distinguida parlamentaria anterior, me da, voy a decir, mucha tristeza decir algo que justamente lo escribió una persona de mi país, una, no sé, filósofa, y que hablaba sobre esto el año 2020, y dijo algo: la cooperación internacional se ha desvanecido en un juego de casino, en que los gobiernos están apostando literalmente por la solución que estará primero. Aquí estamos hablando de vacunación 30 días, rápidamente vacuna. Yo creo que los gobiernos en general, estamos representando a gobiernos, aquí hubo esta suerte de casino, yo creo que todavía no se ha perdido. Creo que esta solución, quien llega primero a tener vacunas, 30 días, produce una desigualdad, sigue produciendo una desigualdad, yo lo he escuchado atentamente a la parlamentaria anterior, hay desigualdad entre los países, hay desigualdad donde estamos. Chile, quiero decir, siento, junto con Israel fuimos los países que tuvimos más vacunación, más rápidamente, y entramos de alguna manera entre ganadores y perdedores. Los países entramos en ganadores y perdedores, y eso hizo una desigualdad. Y en este momento, qué bueno que estamos hablando sobre esto, pero UNITED yo creo que quiere terminar esto. Pero aquí se ve que hubieron ganadores y perdedores. Yo lo escucho atentamente y me duele. Esto hace que haya una lucha de poderes diferentes entre países, dentro de los mismos países. Yo vengo de provincia, también había una diferencia. Bueno, solamente decir que todavía esto que escribieron hace el 2020 se sigue dando.
Gracias. Okay, I'm going to come back to our panel. Naren, would you like to speak to the point about the speed and reassuring publics on that point, and then I'll go to our MPs.
Sure. In respect of the 100 days, I want to emphasize that safety is at the heart of the 100-day mission. We will not compromise on safety in terms of delivering on the 100-day mission. That is crucially important. And the reason that we leave here today with that message, if nothing else, is because, if I may go back to my experience during COVID in an African country, there were a series of missteps because the anti-vaxxers, the activists against vaccination doubted that the products were safe. That was the experience that many of you had as well. And one can't really develop counter-arguments to them very easily because they look back at the history of vaccination and say, well, it took you 10 years to develop a vaccine in the past. How did you now do it in 1 year? So that argument won a lot of popular support. So what we need to leave the room with today is that we need to start educating our population that the world is moving towards faster vaccine development. And we will not compromise, we will not betray our duty to the people we want to save in doing so. The second thing is, there are lots of examples I can go into, and we can chat during the break how a series of missteps was made around doing the wrong things in terms of encouraging people to vaccinate. Each time the government did something they thought was right, they actually pushed the population further away from wanting to be vaccinated. Whenever they said you now need a booster, people said, oh, this is about government and big pharma in bed together, trying to make money off us. Whenever they provided food incentives, whenever they sent vehicles to old age homes to vaccinate vulnerable populations, they said, why is government forcing us to take this vaccine? There's something not right here. They're using us as test populations, which is the point that some of you raised as well. So you could see that the more government tried to help, the worse the situation got. And this is why it's crucially important that we start communicating from today that people need to trust in vaccination. They need to trust vaccines. And many of you have a health background or medical doctors. You are the authority figures that can bring about that change. The other point I want to make very quickly is on what we're doing to encourage equitable access in the continent. I just want to use one very quick example. On the COVID side, we're in partnership with IPD, Institut du Pasteur, and we want to manufacture COVID vaccines in Senegal. So CEPI is actively and aggressively pursuing geodiversification of manufacturing capacity so that everyone is vaccinated and all the regions of the world have vaccine manufacturing capacity closer to their populations than is currently the case. Thank you.
Can I just come back to our panel to respond to the colleague?
Can
Can I add something to what you just said now?
Very brief. We are so far over where...
On the issue of communication. Yeah, on the issue of communication, I think the advocacy groups and all the organizations interested in pushing this agenda forward have a role to play. You cannot communicate to the people in my rural area through World Health Organization, maybe a spokesperson. It doesn't work. Make use of the parliamentarians in their various constituencies, let them in their various languages, push this message across to the people. It will raise the confidence level of the people who are going to, be using these vaccines to believe that in the integrity of the person who has given them this message is still intact and there is no need to doubt. So the communication from him is what we're going to work with. But if you're going to be communicating from the central body, like WHO and all the agencies, it will not work. So let's trickle it down and tailor it to meet the need that is expected, especially in local languages.
Kelvin and Ricardo, very briefly, and then I think some of the points we might have to take to the coffee break discussions.
Just to summarize, I think the two main points that was raised was whether should we allow the experts to drive the conversation and, of course, dealing with misinformation. Just to share some best practices from my side of the world in terms of Malaysia and even our neighbors in Singapore. One of the first things they did, or what we did, was to form an expert panels to deal with COVID-19. And in Singapore, there were 15 expert panels from different disciplines: infectious disease, public health, gynecology and obstetrician, academia, private sectors, and so on and so forth. And they basically guided the government's direction and decisions on all COVID measures, even on safe bets in terms of vaccines. So because they had expert panels driving the conversations, there was better public confidence, because you know how much people trust politicians nowadays. So that is one way, especially in a public health crisis, the experts need to take a front role, and we politicians need to take a back role, rather than using the opportunity to publicize ourselves, but to actually put national interests beyond everything. Communications, I said, national communication strategy was very important in Malaysia. We dealt with the same issues that you mentioned, but we took initiative to invest into trickle-down communications. We have multiple languages, we have multiple levels of educations. We even, for the young people, we invested into influencers that actually do TikTok videos, Instagram posts, Facebook posts, so that it becomes a trend to get vaccinated, and you are saving others as you are saving yourselves. Yep.
Okay.
So I know we're out of time, so I'll try to be quick. First of all, on vaccine, first of all, I want to thank everyone for a very honest discussion. This is the spirit that Unite wants to foster, and I believe that this summit only has to gain if we all share our very honest opinions, as we heard here. And vaccine hoarding was a problem, and it led to tremendous inequities, and this needs to be addressed head on. And it's one of the issues that part of the Unite effort, but also when we talk about a pandemic treaty and about new mechanisms in this new redefinition of globalization when it comes to global health, that needs to be incorporated. What are the mechanisms that avoid us making the same mistakes, that overcome our natural bias, if we will, to try to protect our own, thinking that we are doing that, while at the same time we are actually undermining those same efforts by not saving our neighbors, and therefore, and this will have a ripple effect among ourselves. It's a false sense of security, but the populist approach is much more easier to say, no, we have vaccines, our neighbors don't, but we do, but it's a false sense of information. And that's why as parliamentarians, we have this tremendous responsibility to speak to our governments and to call out actions that are not based on science. And that's why I very much agreed on how we need to work together, as was said. And the other issue that I think was pointed out here is that policy is not one size fits all. We need to respect the cultural diversity when implementing a policy. And something that works in country A may not work in country B. And also addressing what was also mentioned about the inequities within countries. You know, urban versus rural and so forth, these are all extremely important issues. The third thing on regulatory bodies, regional regulatory bodies have proven to be efficient here in Europe with the European Medicines Agency. Africa is moving the same direction with the African Medicines Agency. I think we need these regulatory tools to ensure trust among institutions and therefore as politicians to the people. And lastly, on communication, on communicating, I think it's clear, we've seen this across the world through the COVID-19, communication teams with just public health doctors are not enough. Because we need behavioral scientists, we need sociologists, we need social media experts, we need anthropologists, we need that multidisciplinary approach to understand the different realities to address the challenges. And so that's why Unite is pushing in every country we're at, and we're here to help you if you want to do this in your own parliaments, to have, as we already have 7 countries in the world that are in parliaments, have either a subcommittee or a committee or a working group on global health, a space where parliamentarians from different parties can come together and discuss the issues, not focusing on the domestic day-to-day issues, but on the global health matters that we need to prepare for the future, and doing so, hopefully, keeping our citizens safe for that future to come. Thank you.
It just leaves me to say a huge thank you to everybody on the panel, also for you all for your participation. I think the image that stays with me from this morning's discussion is that graph which showed if we get to 100 days, how much we can keep the curve down in terms of the pandemics that we know are coming. We have to invest upstream, but we've heard from colleagues, we have to invest in that distribution and access too. So let's all work together to do all of those jobs. Let's get to 100 days, and let's make sure that everybody in the world has access to those vaccines as soon as possible. Thank you so much, and I wish you all a great summit.
Thank you so much to the speakers for this very interesting and riveting conversation. So as we are a bit behind on time, we would like to start the next session at 11:45. So please kindly take a quick 10-minute coffee break, and we'll see you back here in about 10 minutes. Thank you. Mine is like on my, oh, sorry. Welcome back, everyone, to the second panel session of the Unite Global Summit 2022. So we have been previously discussing about research and development and, of course, the country-level engagement and intervention from the previous parliamentarians. But, of course, without civil society engagement, it is not possible to develop these people-centered policies that are so needed to forward global health. And so to moderate this session, hosted by Harm Reduction International, it is my pleasure to introduce the moderator for this session, Giada Ghirelli, Senior Analyst for Human Rights and Justice at Harm Reduction International. Giada.
Is this on? Can you hear me? Yes. Welcome, everyone, to this session on effective participation for effective responses, meaningful engagement in pandemic treaty negotiations. As mentioned by Victoria, my name is Giada Ghirelli. I'm a senior analyst at Harm Reduction International. Harm Reduction International works to promote the health and rights of people who use drugs, their families, and their communities. And it's precisely from the perspective of drug control and the related HIV response that we approach the pandemic treaty, which will be the focus of this session. We believe there are clear similarities, clear parallels between the response to drugs and to the pandemic that can inform the development of the treaty. Today's discussion will focus on effective participation by civil societies, communities, and members of parliament in the COVID-19 response, but also in treaty making on pandemic prevention, preparedness, and response at a pivotal time in the pandemic treaty process and the lessons that can be transposed from the former to the latter. Before diving further into the background and the context for this conversation, I want to introduce our distinguished panelists in order of intervention. Right on my left is Honorable Mariam Jashi, former Member of Parliament and Deputy Minister of Health of Georgia. Honorable Jashi is a senior-level policymaker in global health, sustainable development, and innovative financing, the Unite Chapter Chair for Eastern and Central Europe, and Secretary General of the Medical Women's International Association. Thank you. Then we have Honorable Luis Enrique Gallo, Member of Parliament in Uruguay, where he acts as President of the Public Health and Social Assistance Commission of the House of Representatives. Among many others, Honorable Gallo is co-president of the Parliamentary Front of Tuberculosis of the Americas. He's also an MD and a pediatric surgeon. Thank you for joining us. Moving from Latin America to Africa, Honorable Ruth Labode is Member of Parliament in Zimbabwe, Chairperson of the Parliamentary Portfolio Committee on Health and Childcare, and Chairperson of the Parliamentary Sexual Reproductive Health Rights Champions Forum. Honorable Labode is also a medical doctor, and she represents Parliament in the Global Fund Country Coordinating Mechanism and in the National Key Population Coordination Committee. Thank you for joining us. Joining online, we will have Mr. Sarambatar Bayarmanyai, Human Rights Officer in the Civic Space Unit at the Office of the High Commissioner for Human Rights, OHCHR. His main areas of work include the integration of civic space in UN's policies and practices, with a focus on participation of civil society in UN's policies, protection of civil society actors, and promotion of civic space, including in UN intergovernmental fora. And then last but not least, back to the floor, Mrs. Angela Leon Cáceres is the coordinator of Women for Global Fund, a global movement to make the Global Fund responsive and accountable to the needs of women living with HIV, TB, and malaria, with advocates in over 60 countries. Mrs. Cáceres has extensive experience in the development of global policies in relation to HIV, sexual and reproductive health, gender, and human rights, and has worked in pandemic management and infectious diseases control. She's participated in key global fund spaces, such as the CCM, and in the UNAIDS Program Coordinating Board. Now, going back to the focus of today's discussion, and I swear you won't have to hear from me for much longer. Right as we speak, at WHO in Geneva, the Intergovernmental Negotiating Body is holding its third session towards the development of a WHO convention, agreement, or other international instrument on pandemic preparedness and response, what we have come to know as the Pandemic Treaty. Despite efforts to promote meaningful engagement and WHO's commitment to multi-stakeholder participation, the current process remains somewhat exclusionary, with formal opportunities for engagement by non-state actors quite tokenistic, civil society and communities largely absent from the informal focus consultations that took place this autumn, and NGO participation mostly mediated by member states, while no further hearings nor consultations are scheduled for neither 2023 nor 2024. At the national level, and we'll hear more about it, the process appears led by governments, with members of parliament not systematically engaged in the development of domestic positions, and civil society communities and health experts seldom consulted. In parallel, the conceptual zero draft, which will be the basis for the negotiations, contains limited details regarding civil society and community engagement in pandemic treaty governance. Such limited engagement not only runs counter international standards, which acknowledge everyone's rights to participate in public affairs, but also risks impinging the potential of the IMB to develop an effective instrument. Indeed, as we have heard in the past session, Parliament, civil society, and communities played a pivotal role in enhancing COVID-19 responses and are key to functioning domestic health systems. During COVID-19, we as civil society witnessed and documenting the critical work of communities, and in the case of drug policy, harm reduction service providers, stepping up to sustain essential health and related services and supporting the most vulnerable and marginalized groups, including filling life-threatening gaps left by governments. At the same time, our community partners around the world documented how lockdown measures had a particularly negative impact on vulnerable and marginalized populations, with new policing powers frequently exposing those already visibly poor, discriminated against, and criminalized to greater health risks, while countries which retained and supported open civic space had stronger public health outcomes and greater resilience. More broadly, people who use drugs and other criminalized communities, such as people living with HIV and sex workers, have incredible expertise in pushing for and achieving meaningful engagement in national and international policymaking spaces, guided by the principle of nothing about us without us, and can help build effective models of engagement in PPPR and PPPR governance. These are just some of the critical lessons that we believe should be acknowledged and valued while developing new international standards on pandemic prevention and response, and we'll discuss some and more of these issues with our panelists. I'll now open the floor. The way we've structured this conversation is I'll ask each panelist a couple questions. I leave them around 10 minutes to answer, and then we will open the floor and have ample time for Q&A and conversation with MPs in the room and with participants online. So I encourage you to ask questions and to react either if you are in the room or online. I start with Honorable Mariam Jashi. Dr. Jashi has extensive experience and expertise on health and governance, both at the national and at the international level, which will be invaluable for us in setting the scene for this conversation. So what I want to ask you is, in your opinion, what do you think some of the main impacts of COVID, but also of related responses, were on democracy and human rights? What did this reveal about the health of our democracies? And based on what you witnessed, what should be the priorities for policymakers engaged in pandemic treaty negotiations be to prevent not only future pandemics, but also safeguard and strengthen democracies in the process? Thank you.
With your permission, I'll take the stage. It will be easier to engage. So, first of all, I would like to use the opportunity of greeting the distinguished delegates, honorable members of the Parliament, colleagues and partners of the UNITE. And I'll try to be brief to leave some additional time for the questions, because we have heard some of the amazing statements and positions from our members across the world, so it would be more important to hear the different perspectives of the geographic regions. And indeed, the COVID-19 pandemic demonstrated and revealed not only the fragility of the national health systems across the world, but the fragility of democratic institutions. It was the test of democracy in the testing times of the pandemic. Even the countries with stronger health systems and older and more consolidated democracies struggled during the pandemic to effectively respond both from the health and the democratic political perspective. As reported by the Freedom House, since the start of the pandemic, in more than 80 countries, the status of democracy and human rights has deteriorated. Countries across the different geographic regions have witnessed authoritative decisions in terms of restricting some of the human rights-based instruments. The decisions were dominated by political interests, and the critics were silenced. The pandemic measures were mainly decided by the governments in the way that was not always transparent, evidence-based, or free of political influence. Of course, in line with some of the critical assessment of the performance, we have to thank millions of the healthcare workers, the frontline workers across the world. Every country, we in every country have our heroes of the pandemic, and it's impossible to underestimate the work that has been done, the efforts that were invested. But today we're speaking in terms of the lessons learned and how we can be better prepared for future pandemics. As we speak about the lessons from the pandemic, I would like to highlight 3 trends of dominance. The first trend was that decision-making and the dialogue around the pandemic was dominated within the executive branch of the government, the ministries of health and relevant national health authorities. Even the parliamentarians were not actively engaged in the discussions around the evidence that we were accumulating on a daily basis with the novel virus, or the restrictive measures that had to be taken. The second trend of dominance was that the decisions were primarily dominated by the governing parties without meaningful engagement of even the public health experts from opposition political parties or other affiliations. Finally, we saw the dominance of state actors' decision-making without any meaningful engagement of civil society, whilst the pandemic was affecting the constituencies and the differing high-risk groups or vulnerable population groups, and their engagement and their representation in the dialogue might have really helped in better decision-making. So as we move forward, how we could engage and how we could improve the engagement of parliamentarians on one hand and the civil society on the other end. First of all, we have to ensure that MPs, the members of parliament, are more empowered by our global health authorities, and that is why it is extremely important that with the initiative of the WHO Director General, there is the initiative of Global Network of Health Committee Chairs has been launched, and we really look forward to more active engagement of the members of parliament in the global health discussions and the whole design of the new global health architecture. Second, it would be an important initiative that we as the members of UNITE will be supporting in all geographic regions to facilitate establishment of the global health subcommittees or councils at the levels of the national parliaments and assemblies where different political parties could be represented and really focused on the content discussions rather than the political aspect of the decision-making. At the same time, we have to facilitate our MPs to really play a facilitating role as a linkage between the policymakers and the constituencies. So supporting MPs in organizing civil society dialogue or networks would be another important point. And we have to also ensure that at the global level, we support similar tendencies. I fully agree that in the ongoing intergovernmental negotiation body processes, drafting the conceptual zero draft, we don't know exactly what the final name of the convention would be, but in the process of preparation, drafting, and then subsequent negotiations of the global treaty on the pandemic prevention, preparedness and response, even though we were honored to be invited as the Medical Women's International Association, whose Secretary General, I had the honor to be elected as the Secretary General of this long-standing international association, we never had an opportunity to intervene. So we are really thinking how we could reach WHO with the voice of 12,000 female medical professionals that MWIA is today representing. So maybe one of the initiatives would be to create a joint statement from different international civil actors, non-state actors affiliated with WHO, and provide a common recommendations. We have to acknowledge all the positive developments that we have seen, and at the same time, based on the lessons and experience, to encourage incorporation of some of the important transparency, civil society, public-private partnerships initiatives in the new treaty. With this, I would conclude my statement, and I look forward to hearing more from our colleagues. Thank you.
Thank you so much. Thanks, Dr. Josh. And just to highlight a couple of things, the things that you mentioned, the trends which I think you highlighted, we saw in many countries in terms of decentralization of power and the deep inextricable connection between health and democracy, and also the need to acknowledge the power that MPs have as a linkage, as a unique bridge between civil society and decision makers, and how we need to take advantage of that link, of you guys as the link, both at the national and at the international level. I'm gonna move now to Honorable Gallo. Honorable Gallo, you are a member of parliament, but also a doctor, a health professional. Doctors, nurses, and other professionals are the cornerstone of any health response. They are part of civil society, but they're also essential to a sustainable and resilient health system. When we talk about preparedness, that's what pandemic preparedness is. Yet they're often sidelined in policymaking, both at the national and the international level. So can you tell us more about how health professionals, including community health workers, were or were not involved in the pandemic response in your country, Uruguay? And also what policymakers can do what policymakers working on the pandemic treaty can do to learn from this experience. Thank you. Muchas gracias.
Muy buenos días a todas y a todos. Es realmente un gusto estar participando.
Good morning, everyone. Let's hope that from now on, decision-making on a global scale can be made easier. First and foremost, I'd like to talk about this paper that's based on the many years I've had as a parliamentary, an MP, as a doctor, and as a decision maker, as I was part of the government of my country. The pandemic treaty is being discussed right now at the WHO. And there's a first conclusion we can draw from this, that there's no consensus without the participation of civil society. And that's the first takeaway. It can be broad, but most situations are not very broad. If you want to have legislation that brings together all the lessons learned from the pandemic, in order to have global coordinated action, we have to work on the opinions of states, of course, on the opinions of national parliaments, of civil society bodies, of the communities, of academia, science bodies, etc. In my case, I realized that this pandemic treaty, I was made aware of this treaty thanks to UNITE, and since I was invited, I started looking into this. I've been an MP linked to the health sector for 20 years, and I didn't know that this was being discussed in one of the major health bodies in the world. And so I think active participation, not just as an observer, we have to be active. We need to respect the decisions, but we have to have our say as parliamentaries, as MPs, and as civil society. There was the COVAX fund, and we paid into that fund, but we never got the vaccines. They were late, there weren't enough. There are many good intentions, but the participation and the end result was not good. And we don't want to repeat that. So we need to have a forum for discussion with civil society. There must also be cooperation. We want this cooperation to be as wide as possible, and we want the frontline workers, like the medical workers, and also non-medical workers, scientists and civil society bodies, users of the health system, everyone. We all went through the pandemic, and we need to plan for the future better. The whole world should be talking about this opportunity. The whole world should feel like they're a part of this opportunity. And specifically, now let me talk about Uruguay. It's a small country. We have 3.5 million people. The pandemic found us in a proper situation, a good situation. Our health system was emboldened. There's a private and public health sector. They're integrated. For the past 18 years, we've had heavy investment in hospitals and health centers. And so we have an equitable and universal health service. Everybody can have access to it, and that's very important. This should be one of the main topics when we talk about the access to universal health care. Undoubtedly, this was one of our main strengths, because the health system in my country, when it comes to decision making, civil society plays a key role. There's a representation of medical and non-medical workers, CEOs in the field of health, government officials, and so whenever there's a health crisis, we already have we've gained some experience in this type of action. With the pandemic already ongoing, it was very important to count on academia in our country. And it was just as important to invest in science and technology. Politicians talk about investing in science and technology during campaigns. We talk about 1.5 to 2% of the GDP, but we invest under 0.5%. In Uruguay, we invested 0.5% of the GDP, and we realized how important science and technology is when faced with this type of challenges. We did some good things. We had a group called GATCH with over 50 scientists from all sectors, epidemiologists, virologists, engineers, mathematicians, etc., etc. They drafted recommendations to the executive power, and the decisions were up to the executive power, but they were based on these recommendations. And it was Gach that came up with voluntary confinement. So what we said was, let's stop people from moving without having to force them to do that. And society as a whole believed the politicians, and so they were locked down for most of the first 4 months after the pandemic was declared. The face masks, suspension of schools and universities. We had the Plan Ceval, where every college student or every student was given a tablet, and so they could keep up with classes through digital platforms. But there have been some things that have been not as good. In terms of deaths and infected people in 2020, we had 181 deaths. Over 2020, 181 people died. In January, February, and March, we had 793 deaths. And the Gach suggested a lockdown of 20 days, a mandatory lockdown of 20 days, because we know in 2020 we learned that if people could move around, there were more infections. And the Gach said a mandatory lockdown of 20 days. But the government did not move forward with this recommendation. And therefore, in April, we had 1,600 deaths. In May, we had 1,800 deaths, and so on and so forth. We were once the country that best managed the pandemic, and then we were the country with the worst figures in terms of deaths on Earth. There was no social dialogue. People needed to understand that these measures were necessary. As for human rights, there were several issues linked to human rights that were affected during this emergency time, and the government had to prioritize some rights over others in this period of uncertainty. In Uruguay, we had a food emergency, and this was tragic. Some of the affected groups, by several diseases, they were set aside. The needs of people were dying alone and far from their families. And these are the main topics that led us to rethink this situation of a health emergency. And how can we face this in the future from a more humane perspective? This type of situation should not occur again. As for the second question, when asked, what can the policymakers learn from this? All the policymakers that are working on this pandemic treaty. I'd like to say that the first thing that we should say is we need to learn how to listen. Decision makers need to learn how to listen and learn to take into account the several opinions and they need to leave room for people and organizations that were on the front lines, health centers. That's where the knowledge is of what was, what happened, and what could have helped make this pandemic, this moment, not as bad. Bioethics is also important. This cannot be left out of this discussion. And they need to have a more humane situation, like dying alone. I'm not just a policymaker, I'm a doctor. The heads of health centers came to us and asked us to help them decide who went on a ventilator and who didn't. And we need to have guidelines on that. This pandemic must act as a reminder of things that cannot happen again. And then we have the forgotten illnesses of the pandemic. There are many illnesses that stopped having regular, necessary controls. And I think this was just as much a problem as the pandemic itself. Some illnesses, due to lack of control, increase their mortality rate. And I'd like to quote some of them. Cancer, heart disease, infectious diseases like TB, malaria. So we need a broad participation in the draft or global policies to plan a common way of facing future pandemics in a more effective and humane for the world's population. It's important to promote events that would grant transparency to these processes, should be our flagship. The whole world should be talking about this, and the whole world should feel like they're a part of this opportunity. Thank you very much.
Thank you. Thank you so much.
Muito obrigada por ter destacado aqui a importância do envolvimento de várias partes.
Of active participation, and if I can say also funding and resources of putting the money where the mouth is. I'm going to move now to Honorable Ruth Labode and have a similar exercise of which lessons were learned, but I want to focus on women, girls, and key populations. Honorable Labode is a champion of human rights of women, girls, and key populations, including LGBTQI+, people use drugs, people living with HIV, which already before the pandemic were some of the most marginalized in society. So what I want to ask you is what were some of the specific and unique ways in which both COVID-19 and COVID-19 responses impacted the rights of these marginalized populations, especially those that were already criminalized? And based on what you observed, what do you think should be advocated for or reinforced in ongoing negotiations on the pandemic treaty? And also, how can we promote the engagement of these groups in policymaking? Thank you so much.
Hello? Can you hear me? Oh, thank you very much. I would like to thank Unite for this invitation. Normally with Unite, we work mostly around drug abuse with my colleague there, Honorable Molokele, but I'm a passionate SRH champion. When COVID visited Zimbabwe, it found a very poorly performing economy with almost 70% of informal traders being women. A very poorly capacitated health sector that did not have protective clothing, that did not have any test kit or anything. But we had to do something. We also found ourselves with a lot of bad laws governing the sexual reproductive health or services for the adolescents. The only strategy that was then, okay, thank you. Okay, the only strategy that the whole world was implementing was stay away or lock down. So we also had to lock down. We went into a unplanned lockdown, which led us in a situation where the so-called income earner, the woman who was an informal trader, found herself at home. And the children who were going to school found themselves in the houses. And what did that lead to? It meant that, one, the child now has no access to contraceptives. The person living with HIV has no access to art. When the only public transport that was there, if you to get it from where you were living to go to the public institution, you had to line up and be asked, where are you going? And in most cases, if you said you are going for contraceptives and you are below 18, the policeman would say, a policeman would say, what are you doing with contraceptives at your age? If you say you are going for art, for medicine, they will say, so how did you get the HIV? And they will ask this question in a queue so that all the people who live in your area now know who you are. It was a terrible time. And what then did happen with this? And also Parliament was closed instantly. We closed, which meant we could now not monitor who is moving funds from where to where, who is receiving donor funds. We're not there, we're at home. Of course, something good came out of it. A focal point was set up at the President's office to monitor, produce statements. We received daily data on COVID and what was being done. So what was the impact on the SRH? Which is what I was asked to answer. Increase in gender-based violence. We suddenly realized that Zimbabwean husband and wife don't exactly like each other. Because when they were now given a chance to stay together in the house, they started fighting and killing each other. In fact, we had a lot of dangerous reports where a boy has impregnated 2 or 3 sisters below the age of 18. A woman has hit the husband with something and died. All those reports were coming out and they were really frightening. We had an increase in teenage pregnancies because, one, lack of access. Teenagers, even though they had nothing to do, no social life, no recreation, so the recreation was sex. They were too young, according to our laws, to access contraceptives. At the same time, they were now, when they got pregnant, they had to seek for unsafe abortions. We saw an increase also that, how did we monitor the unsafe abortion? We saw them because they came for post-abortal care. When they were now sick and they were sent to the hospital, we saw that number going up. We also saw an increase in ART and TB drug defaulters. The institutions where people get ARVs confirmed that people were not coming because they had no way of coming. They didn't even have the money to get that pass to go and get the ARVs. We saw also an increase in sexually transmitted diseases among sex workers and LGBTI communities. Why? Simply because normally these communities have special clinics. Like sex workers will go to a place called Sesha. They have clinics, special clinics where they get their antibiotics, they're treated, and it's for free. The LGBTI community, on the other hand, they also have their own clinics, but most of the LGBTI community work in salons, they work in beauty places, they work in shops as salespeople. So once there was a lockdown, they had no job. So they couldn't even go, and the nation, there's the stigma, so they couldn't even go to their clinics to be canceled. That was a huge impact on them also. So that increased their psychosocial problems. Retrospectively, what could we have done? We could have planned better. Look, this was a new thing. We had never gone through it, but we could have actually sat down and set up a committee before closing down without thinking. And maybe, for me, I think mobile clinics would have performed a wonder. If we had brought in mobile clinic, if 2 clinics per city, and maybe 3 for every urban district, rural district, to offer services like family planning, ART, TB drugs, antenatal, and basic health care. We could have actually reduced some of these effects we ended up with. Also, put up a system to monitor, because government put in money for informal traders to be given funds since they were now not trading, but the fund disappears. It was stolen, it was corruptly taken because there was no system. How do you get these people whom you have locked down to come and get this money? So it was a problem. We could have put this money was wasted. We could have put up a better system. So, and government and donor funds, accountability was very poor. Later, we discovered that there were test kits, PCR test kits that were stolen. We discovered there were people employed supposedly going to advocate for vaccine who were not even advocating, they were just being paid. There was so much, certain evil people saw opportunity to steal and they stole, which was unfortunate. So my other question was of this famous, which Henry spoke about, the famous WHO pandemic treaty. I also heard about it for the first time when Honorable Mafauda phoned me and they said, can you speak on the WHO pandemic treaty? I said, what animal is that? And I was told, oh, there is a treaty that was reached in WHO and an intergovernmental team is looking into it and they are trying to market it. So I went and started Googling it. I read about it. It is not a bad thing, but I'm sure if I ask MPs here to say, who knows about this thing, nobody knows about it. It has not moved from Geneva. Maybe it has moved to certain sectors, but it has not moved from Geneva. This is the feeling I have. We have WHO offices in country. How come this thing is not being talked about there? It's not a bad thing. It's not a new thing, by the way. I don't know. I will give myself a little bit of time just to read something about it, just to allow my colleagues to understand. There were calls for the Global Pandemic Treaty, where they argue that the new treaty would provide a framework for key issues such as build resilience to pandemic, robust national and global preparedness system, equitable access to pandemic countermeasures, i.e. vaccines, better surveillance and better alert system. But I argue that why not, instead of developing a new international instrument, why not strengthen and amend the National Emergency Preparedness Protocol? Because every one of you, I'm sure, have something like this in your country already, which is just maybe not strong enough. We have an emergency preparedness plan in Zimbabwe. What is its weakness? It's so fantastic on paper, but it's not funded. When cholera came, we were running helter-skelter like monkeys when we have a beautiful document written. So WHO needs, for advocates' sake, WHO needs to look at each country and say, how far are you? What do you need to do? At least that's my own opinion. That's how I feel. We all have this issue. It's just that the implementation is bad. Thank you.
Thanks so much, Honorable Labode, and also for highlighting the importance of planning and preparedness. This is going to be one of the key issues covered by this new infamous pandemic treaty, and it's a shame that in Geneva, WHO, they're not hearing your voices and your experiences, so I hope we'll find ways to fill the gaps. Not that we've heard a lot about the specific impacts of COVID, so we've looked at the past, but we've also learned about the impact of the responses on health and democracy, and of the different effects of participatory, transparent versus coercive responses. I want to move this conversation back to the international level and introduce Mr. Bayar Manyai, who's supposed to be online. I hope he still is. And I hope he can hear us. Hello, great.
Yes, I can hear you.
Thank you for joining us. So, what I want to ask Mr. Bayar Manyai is, from a human rights perspective, why should these communities and civil society, but also members of parliament, be involved in treaty making at the international level? What can be done at the national level to support such participation? And also whether there are any positive examples of meaningful engagement from other processes and instruments. And I'm glad we heard some from the case of Uruguay that should be capitalized on in the context of the pandemic treaty. Thank you.
Thank you, Giada. It's my pleasure to be part of this important discussion. and thanks again for having me. I couldn't agree more with many things honorable MPs said just before me, so I will try to be brief in the interest of time. So we are looking at the participation in public affairs, and this shall not be a privilege for a few, but a fundamental human right for everyone who is seeking to engage with this process. And indeed, right to participation, right to take part in the conduct of public affairs is protected by Article 25 of the International Covenant on Civil and Political Rights and many other international human rights instruments. So this is a fundamental right. And then the second question is, what needs to be done in order to that governments do respect and protect and fulfill their legal obligations and engage as many civil society actors and people as they can, because at the end of the day, people's participation in decision-making process that affects their life, including international treaty-making process, is the litmus test of our times, and as many other MPs told us. So I'd like to highlight one good example, and there are many examples where intergovernmental processes engage civil society actors in different ways, but one of the prominent examples is how the Convention on the Rights of Persons with Disabilities was developed and ratified in 2006. So what happened is member states agreed to develop this convention, and they established ad hoc committee to do that. And around that time, it was around 2001 and 2002 when the ad hoc committee was established. And then around that time, obviously, many civil society organizations, including persons with disabilities themselves, really united and created this global movement, Nothing About Us Without Us. And of course, as an office, we supported that movement, and member states were putting in place certain measures that allowed civil society and persons with disabilities to be part of the process. Two key measures. One is those people were actively involved and spoke during each sessions of the ad hoc committee in a very transparent and non-discriminatory manner. And then many state parties started bringing their own civil society actors from the grassroots levels as part of their country delegations to those sessions. And secondly, and that's the most important thing, is the ad hoc committee also created a working group who was responsible to draft the convention. And that working group also included civil society representatives. And it wasn't just only states, but civil society representatives, and including representatives from national human rights institutions. So we had this hybrid setup where persons with disabilities actually were involved in the drafting process. And there were also other measures adopted, like Trust Fund was created by some donors to bring other actors, including civil society organizations from grassroots levels, especially from Global South, who couldn't afford traveling to UNHQ and being part of the in-person discussions. So that was one of the concrete ideas that possibly could be replicated in the pandemic's treaty process. And the result was that the 75% of the convention, legal text of the convention, is based on civil society contributions. So in a way, this is a convention for persons with disabilities by persons with disabilities. So this is a very stark example, which I hope can be followed and replicated in the current context. And of course, as members of parliament, you have an important role to play, important oversight role to play, to make sure that governments do actually pay attention to right to participation and create a channel for civil society to be part of this process. So this would be my urge to members of parliament to consider issuing a joint political statement or declaration to this effect, and really support the right to participation in this pandemic's process, because at the end of the day, we don't really want to have a treaty about the pandemic itself, but it should be about people and by the people. So I think I stop here, and I would be happy to answer any questions. Thank you.
Thank you so much. We definitely appreciate this idea of a joint statement or a declaration. We'll definitely take it up with UNITE colleagues. I also want to thank you for highlighting the importance of having both these official formal spaces for inclusion, and this is a conversation that needs to be taken up with WHO. The pandemic treaty process is a member states-led one, so member states are the ones who are deciding how these negotiations will happen, and that's where you have a key role, but also the importance of practical support and of funding, which are key to ensure that we hear from everyone in civil society, not only the usual suspects and not only those of us sitting in Geneva or in Europe. Continuing on the importance of civil society and community engagement, I'm going to move to Mrs. Cáceres, the coordinator of Women for Global Fund, which works to promote the rights and interests of women and girls, particularly from key populations, in the programs of the Global Fund to fight AIDS, TB, and malaria. And as such, you are uniquely placed to discuss participation in global health governance, both as a right in itself and as an enabler to the enjoyment of other fundamental rights. The Global Fund is often discussed as a best practice for community and civil society engagement in decision-making, and while it is indeed progressive in many regards, we also know there's always space for improvement. So what I want to ask you is, based on your experience with these, in these intergovernmental fora, what are the main barriers that marginalized and criminalized communities face in participation specifically? What can be learned from the Global Fund structure in the context of pandemic governance, both at the national and international level? And also, which recommendations would you give to member states working around the pandemic treaty and PPR governance towards enhancing this process? Thank you.
Good morning. I hope you can hear me. Buenos días. Bon dia.
Thank you. Good morning.
Pleasure to see you all here and share this space with amazing speakers from all over the world. Let me first introduce Women for Global Fund. We are diverse women, more than 300 advocates worldwide, working at national, regional, and global levels, who are engaged with the Global Fund and other networks, working and advocating for gender equality in the access to the right to health, mainly to have comprehensive and culture-sensitive responses to HIV, TB, and malaria. We gather to highlight and confront unequal power relationships between women and men in our communities. Our advocacy is based on evidence and observations that show that harmful impacts of gender inequality among women and girls are seeking benefit or influencing Global Fund and support programs. Here, I want to show you some facts, probably because we are trying to understand how we're going to address the next pandemic. But have we forgotten that we are currently facing the HIV and AIDS pandemic? Are we? I think we need to remember that still there are 6,500 people that were lost to AIDS pandemic in 2021, and currently 1.5 million people are living with acquired HIV in 2021. It is for me surprising to still be saying that 1 of 3 women have experienced any form of physical and psychological violence, including women of the parliament. In 2021, women and girls made up of mostly half of the new HIV infections worldwide. Every 2 minutes, an adolescent girl, young, from 15 to 24 years, acquire HIV. I will be surprised that we are not working and we are forgetting these current epidemics. I think we should still keep on thinking. Please take note of these facts as we continue in this pandemic management. We know, and we have been saying during all the session, that no one is safe until we are all safe. Many structural barriers based on harmful gender norms increase the HIV vulnerability of women and girls in all of our diversity, and they will continue to increase to other future pandemics. These norms deprive women and our voices and our abilities to make decisions regarding our own lives. They reduce our abilities to access healthcare services and that meets our needs. And those are also increasing our risk of experiencing violence and other harms. Some of these barriers are related to the lack of access to education, reduce the capacity due to career disruptions and other external responsibilities that are socially assigned roles sometimes. And also, there are lots of still of misconceptions and credibility assumptions around women in leadership. There are still accessibility barriers like language, access to technologies and communications, access to culturally sensitive information, especially for women living in remote and rural areas. Women, especially young girls, remain gravely underrepresented in global health and local governance spaces. Women participation can enable transformative policy making that fosters transparent, accountable, and just health systems. Ending these inequalities is not only mandatory, but urgent. We need to end inequalities, we need to end gender inequalities, and we need to reach those who have been left behind and addressing the root causes of vulnerability and exclusion. These are key elements for the current and the future responses to pandemics and epidemics. We know what works. Let's not repeat the same mistakes as before. We need to ensure that we have girls at schools. We need to tackle all forms of violence, mainly gender-based violence. We need to support women's organizations and invest not only quantity or funds, but we need to invest in quality interventions that are led by women in all of diversity, including gender transformative actions. We have learned that meaningful involvement of women and girls can shape social norms, and this, for example, by building social capital, trust, and community cohesion. We have evidence from science and also from our communities and our perceptions that meaningful participation at all levels catalyzes the impact of health messages, improves project implementation, and ensures successful development of policies. I think that we can say it louder, but not clearer. Women's rights are human rights. We need to guarantee the right to health, and we want to be full and equal partners, recognizing the critical roles we play in advocacy and delivery of rights-based health responses. I think now this is a moment for us as health advocates, as parliamentaries, to work. And this is also really important to answer the second question that was posed to me. What are these kind of recommendations? As this is the only network of parliamentaries from around the world currently focusing on the global health agenda, and considering that parliamentaries play an important role to get women in all of the diversity included in the processes like the pandemic treaty processes, we need to recommend and we need to understand that health in all policies is fundamental. But we need to know that women in our diversity have to be engaged in all these policies. So we recommend to timely guarantee citizen participation as a right and a tool to channel the contributions of women in all diversity in the formulation, development, execution, and monitoring of public health policies and its impact on the social determinants of health. We need to create political enabling environments in which there can be dialogues between the governments and women-led organizations. We need to bring those results to the international table negotiations. We need to invest funds and resources, human resources, in strengthening opportunities and building capacities for women participation as citizens, careers, users, and also patients in leading and managing health policy and health system actions. We need to promote and guarantee intersectoral mechanisms to eliminate gender stereotypes and harmful social norms that limit women's participation in all the health-related processes. We need to highlight the essential role of women in pandemic response and in strengthening health system as one key reasons why our meaningful engagement in treaty-making processes should be promoted and ensured. We need to advocate, we need to include women in national delegations of the international negotiation processes like this one. Finally, we need to strengthen our partnerships. We need to foster networks and support joint collaborations. It is key to consider the attendees today that fights against stigma and discrimination and tackling all these gender inequalities are paramount to the response to any epidemic. All epidemics and pandemics need multisectoral and intersectoral approaches, and these are supported by gender transformative actions. Please never forget, nothing for us without us. Thank you very much.
Thank you so much. Thank you for highlighting the importance of meaningful participation as not only a right, but also something that makes health better, more effective, and more sustainable for everyone. We still have a few minutes left, so we're going to open the floor now for questions and comments. So if anyone wants to intervene, please just raise your nameplate, and if I can see you, I'll give you the floor. I have one honorable colleague over there. Yeah.
Buenos días.
Good morning. I'm from the Honduras, Central America. First and foremost, I'd like to share with you what happens in our region, and like what our colleague from Uruguay said a while ago, in Central America, namely in the region of Honduras, we, from the beginning of the pandemic, are faced with contradictory statements or stances. In the National Congress, approved in a rush, a very hasty manner, a special budget for the pandemic, and or to respond to the pandemic. And then we went out, and in that Congress, our party was a minority. Well, now we are in a different legislature where we are a majority. But at the time that budget was approved, without the due counsel and without having resorted to expert advice, ultimately that money disappeared, and we did not meet the goal that it was supposed to achieve. Now, that's one of the questions I wanted to make already in the past, in the previous session, is how can we guarantee equity of the distribution of vaccines, that, as you said, when we don't have a robust health system in the region? We just approved a budget increase to the health budget, and for the first time in 20 years, there was this increase in the health budget for health. So maybe you can answer. But the second question is, how can we improve communication on the treaty, the pandemic treaty, to increase the participation of citizens in the process? I think communication is so important, and also for us parliamentarians. Thank you.
We'll maybe take a couple more questions if there are, just for the sake of time, and then go back to the panelists. Another over there. Thank you.
I'm going to speak Spanish.
I'd just like to say that a global treaty on pandemics that is in development. Now we no longer use the word treaty, but covenant or convention. But this did not stem from the WHO. It's not WHO that had this idea. I mean, the idea is from all of us that have been working on this for several years, even before the COVID pandemic. I mean, Ricardo from Portugal was involved, Barbara Stocking from the United Kingdom, Aquila Ghana, Gisela from Argentina. So Aku from Ghana, Gisela from Argentina. So there were quite a few of us that had been working on such a thing because we felt that the way how the WHO is today is not prepared for the 21st century. And I mean, it was an organization created in the 20th century with a different purpose. Its greatest achievement was to eradicate smallpox, but I mean, now we have Ebola and in West Africa, where the response was very unsatisfactory by the WHO. So we were thinking about this even before the pandemic. Now, yes, they did take up this idea, an idea that that had been proposed by different people, and last year, this intergovernmental negotiator body was created to start working on the pandemic treaty. But I mean, this has to involve more the countries, because I mean, if we are just to take the ideas from Geneva, that may be very narrow thinking, very limited, and I can see how the effect it will have in Latin America. I know that the African Union has a stance on equity, which is very good, but maybe the other regions don't welcome so much these proposals. So I just like to make clear that the idea of the treaty did not come from the WHO. It came from outside. Thank you.
Thank you. Anyone else?
Obrigado.
I don't see anyone. So unless I'm missing someone, I don't know if anyone wants to answer the questions. There were two, one on improving communication to increase citizen participation, including on the pandemic treaty, and the second one on guaranteeing equity in vaccine distribution without having robust health systems, both domestically and regionally. Would you like to start, Honorable Jashi?
Yes, absolutely. Thank you very much for this important statement that actually reflects the tendencies we had in terms of parliamentarians' engagement across the world, as we see now, and reconfirm the position. And it's astonishing that so many current members of parliament have not heard about the ongoing discussions and negotiations on the convention or the global treaty. Again, the name of the instrument will be soon finalized. And Jorge, thank you so much for this comment. Actually, I was waiting for our next session with Barbara Stocking to really discuss the history and how the Lancet article that you all contributed to, and then additional discussions around the improvement of the global monitoring instruments for the pandemic preparedness has really set a fantastic ground for the international instrument for the pandemic preparedness. And that is exactly another example how the communication is still not very effective. And if we don't ensure that the current process of working on the global treaty or convention does not meaningfully engage parliamentarians, civil society, and academia, we will end up in another document similar to international health regulations that de facto didn't work. And it was just a beautiful document set and approved by WHO. So we definitely need a different approach this time because, again, desperate times call for desperate measures. And the pandemic was definitely the challenge that we all have gone through and witnessed the weaknesses. So we have to use those lessons, absolutely.
Thank you. Anyone else from the panel?
No. Can you hear me?
Yes, yes.
Voy a responder en español.
I'll reply in Spanish. How are we going to change the lack of equality, of an even playing field? Well, there have been many papers in many international bodies, and it's the time to turn these papers into political will. And the symbol, the demonstration of political will is investment, not just expenditure. It's investment in public, or investment to invest in public health, in education and training. And it's important to see how we can respond to future pandemics. If we don't have policies that are understandable and accessible and adjustable to each context, then we will never be able to respond to pandemics. And inequality will remain. And if we don't involve women, then it's exactly the same. We need to ensure that citizens effectively participate and that there's a transparent and equitable procedure, and that everyone that's responsible is called to account.
Yes, I would like to say something. I just wanted to say thank you very much, but I would like to invite all the participants here to Zimbabwe next year for the ICASA. Zimbabwe has won, is going to host the International Conference on HIV next year in the mighty Victoria Falls. Please, you are welcome. Start looking for funding now. And Batista, see you there.
Thanks, we'll definitely take that invitation up. I know it's lunchtime, I don't want to hold anyone from that, so I'll close. Oh, is there any? Please, go on.
Thank you very much. Once again, my name is Benjamin. I'm from Nigeria. Beautiful presentation. My interest is with regards to the treaty. Our problem is not these documentation of beautiful ideas to make the world better. Our problem is the ratification that accompanies it. Most of the beautiful treaties of the world have not been rectified by various countries that it was designed for. And the question boils down to communication, because they don't understand it, because the orientation, the sensitization, the information sharing that ought to trickle down, like I mentioned during our section, it's not going down to the people that it's meant for. And so when the parliament sits, they want to hear from their constituents who will advise them either for or against the ratification, the domestication of that particular treaty. And they will say no, not because the treaty is not good, but because they don't just understand it. So as much as we spend money in working on all these beautiful packages that will make the world better, let us allocate a certain amount of money as well for information sharing, for a knowledge-rich communication that will not stop at the up level, but that will go down to the people that will advise their parliamentarians to domesticate this beautiful treaty. What is the essence of a treaty if it only stays up there and is not domesticated? So my opinion or advice is agencies, civil society organizations, WHO, other global agencies that work on these beautiful ideas, make it a duty to have a sound communication system. At the moment, we are faulting your communication system. It is not working, and something needs to be done about that. Thank you.
I absolutely share the latter end of your opinion. Democratic states have parliaments, and sometimes the states forget that parliaments exist. Maybe it's the executive power that decides the laws, but it's the parliaments who approve it. And so there must be a global conversation, but that must include the parliaments. And there must be joint work with international organizations like the WHO, the states and the parliaments, because a very beautiful document is useless if it's not put into practice, as has been the case in the past with the Pan American Health Organization and with the WHO. If we didn't learn from this pandemic, in fact, ladies and gentlemen, we'll never learn.
Okay, perfect. So thank you so much. I close the session. I just want to say it's clear that there's a lot of potential for working together, for communicating more, for sharing more information. Communities and civil society, at least on our side, have done a lot of work to develop recommendations on the content of the treaty, on the process of treaty making. So we're more than happy to bother you with those recommendations so that you can share them with your own governments and also together with Unite to figure out ways to work together on this process. Thank you so much, and thank you, Unite, again, and the word back to Victoria.
Thank you, everyone, for a very productive, thoughtful morning sessions and discussions. So we've reached the lunch break now. We will return again at 2:30. There is a separate venue for the lunch, so I kindly ask for you to follow the Unite staff to escort you to the lunch location, and we'll see you back here at 2:30. Thank you. Welcome back, everyone. I hope that you had a lovely lunch break. I must say it was really great seeing all the diversity at the different tables. I think this really speaks to the uniqueness of the Unite Summit, that parliamentarians from all around the world sitting together and exchanging ideas in global health. So it's my pleasure to welcome you back for the afternoon sessions today on the first day. Before we begin, I would like to remind everyone at home that you're more than welcome to engage with the speakers and pose questions through the virtual platform or engage via social media using the official hashtag #UniteGlobalSummit. And so before any further delay, I will now continue our work with a session reflecting on the new global health architecture with representation by several parliamentarians from different regions around the world. In this next session, we will discuss pandemic prevention, preparedness and response architecture, new developments, and what is next. This is co-organized with the Panel for a Global Public Health Convention, and moderating this session is my pleasure to introduce Barbara Stocking, Chair of the Panel for a Global Health Convention. Barbara, please.
Well, good afternoon, everyone. It's great to be with you, honourable parliamentarians and colleagues. I was slightly worried just before we started that the music was getting so soft and beautiful that you might all have just gone to sleep by now. But so I will, if it gets too bad, I will shout at you to all jump up for one go. But anyway, that's good. It's great to be here, and I want to say a big thank you to Ricardo and Unite, really for keeping the idea of the pandemic treaty in the whole context of parliamentarians and keep bringing it up and being the drumbeat that is keeping it going. It's incredibly important. So just a bit first before I start about the what we're doing as a panel, and going back a little bit in history. Jorge Zavenda, just before lunch, actually said that there was a study done even before COVID with interviews with people right across the world about what were we worried about getting from outbreaks to pandemics, which did result in a Lancet article. Unfortunately, by then we had COVID in play. But it was that article that really stimulated this panel to come into being, because the idea was that it's all very well having an article in the Lancet, but what you want to have is an advocacy group that is really pushing for it and keeping it going. And at that point, I was asked if I would chair that panel. And just to give a bit on my own background, I have a long background in health services, healthcare. And I think my first bit of real epidemiology was on river blindness in West Africa, in fact. But the one that I knew most about that led me to this was that I chaired the review of WHO following Ebola in 2015 and made the recommendations that there are not too many there now, but I'm absolutely delighted that so many of them were taken up by WHO, really just to produce a proper emergency function, which wasn't there before, amazingly. And it was that led to me being asked to chair this panel. And when I was asked to do it, I was told it's completely independent and you can choose who you like, though it did require a bit of talking around to find out who might be the right people to be on it. So it is a high-level panel that is really working on advocacy at the senior levels, and particularly with member states, actually, both in Geneva and obviously, back home in the capitals where possible. So we are monitoring what's happening along this treaty development, all the time, and trying to pick also from your governments, really, what it is they're wanting, what they don't like, to try and understand and bring this through. So that's what the panel is there for. And I'm going to just talk a bit more, I think in this one, a bit more about what we want in the treaty. And I'll come to that in just a moment. But I want to start with why we need your help as parliamentarians. And I'll be quick about that, because I think you've set it out really clearly through the course of the morning, that we need parliamentarians now to make sure that we do go forward with a treaty, and not any old treaty, but the treaty that is really one that will meet the needs of countries and peoples in those countries. And we need you to be knowledgeable about it, at least to some extent, and to be able to talk about it and persuade others to be behind this treaty. So that's the first thing. But then, of course, we will need you when it comes to really looking at this treaty and getting your country to ratify it. And perhaps the most important point of that is that leads to the issue that you will actually be able to then hold your governments to account. That's the fundamental issue in all of this. Because it'll have gone through Parliament, you and civil society and others will be able to challenge your governments and saying, well, you signed up to doing this thing and we are holding you to account on behalf of our people in this country. So that's why we want you. But I have learned from this morning that I know some of you are very knowledgeable about the treaty from your various work in your parliaments, but also from Unite. But I think a lot of people are a bit bemused about what's in it, and I really think it would be really good if we could have some straightforward, simple information about what this treaty is about, and even some of the the issues where people aren't agreed about it, just so you know where the questions are as well. So getting on then with the treaty itself, where does this come from? And it really comes from all the things that went so wrong, and I will move on the slides now. All the things that went wrong during the COVID-19 development of the pandemic. Again, I think you've said quite a lot of those this morning, so I won't overemphasize, but go into some that I think are really very critical. One is, of course, preparedness. Many countries are not prepared through no fault of their own. And the first thing that comes out of that is, of course, we do have to have decent funding for low and middle income countries to make sure they are going to be able to have the preparedness that is really essential for delivering and stopping outbreaks becoming pandemics. Now, I emphasize that because we're not yet in a place where we can actually prevent any of these outbreaks occurring because of all the zoonoses that we've heard about. But we certainly could stop outbreaks becoming pandemics. That's perfectly possible. So what was missing in the preparedness, as well as money, was that whole governments weren't engaged. I mean, prime ministers, presidents were very surprised to find out what they didn't know from this, that they were not prepared at all. And as we said, again, a lot of input in the morning. The populations of the countries are also not prepared. They didn't have information. And in these preparedness, the work that we need to do in preparedness, getting communications understood and right is a big part of it. And knowing what you will do when the outbreak happens and you have to speak to your people about what needs to be done. You don't want to prepare that from scratch about how you're going to do it, the communication systems, when you've got an outbreak. Very few countries ever tested their preparedness plans at all. And if you don't test them, you don't know whether they work. They'll never be the same as what happens. But I'm always amused by this, because when I was in the health service, I had hospitals that were covering, well, actually the Channel Tunnel, Heathrow Airport, and the hospitals in my region actually had to do simulations every 3 years at minimum to show that they were really fit to deal with an emergency. Now, why aren't we doing that? With pandemics, it's amazing that we don't think that we need to do that sort of approach. So that was missing. It was missing in response, and I want to just spend a minute or two on that. All morning we've heard words that said speed, and actually either said it or implied the lack of it. And that was absolutely true with COVID-19. That we really did not move at speed once we knew something about this virus and that it was killing people and that it was likely to be moving, basically. It was quite late when the public health emergency was called. That was the end of January. And as one of the reports has said, we completely lost February altogether. By then, you'd lost it. There was no way you were going to stop a pandemic after that. Now, That's true, but what do you do about this? And what's the problem? Well, one of the parts of the problem is that most people who aren't in health or epidemiology and so on don't understand that actually these diseases go exponentially. So you have one person and then suddenly you have 6. And if you have a major event, you've probably ended up with 100 already. And you can do that in hours and days. And certainly governments don't understand that. They're not used to emergencies that sort of aren't almost fully frontal in there. They have no imagination about how, or knowledge about how it might reach that level. And that really is this is an issue about sort of behavior, really, of understanding that is really critical. And it is difficult for governments in that, because if you start getting people to do things, you may scare them. You may spend money on things like lots of PPE that you never needed. And again, in my experience, I remembered with influenza, the then chief medical officer that I knew very well, bought a lot of Tamiflu for treatments of people that were never used because we didn't need them in the end. Now, that takes quite a lot of risk to believe that you have to do those things. And in fact, it was never really announced to the public because of the expected public reaction to so much spend and then the loss of that money. So there are real dilemmas. This is not easy, this thing, but somehow or other we've got to get across just how vital it is to move very quickly, even if it's only to increasing your surveillance systems, getting your equipment ready and so on, absolutely right from the start. Otherwise, we will be too late. And of course, the other part in the response was people did not, they went against a lot of not just WHO advice, but the scientific evidence about what they were doing. And that's a real problem in it. But the key reason that you need a pandemic is this third one, which is about accountability. Because IHR, the regulations that we know about, they have quite a lot of the right things in them. But actually, not just in COVID, but right from 2005 onwards, those regulations were not being kept up with. They were not being delivered on. So the question was, I mean, the fundamental arguments about having a treaty were that we need to get something where governments do have accountability, not just, as I say, to WHO or something, but to their own people that we can actually look at. And of course, we talked quite a lot this morning about the shocking inequalities of the global public goods, the vaccines and so on. And the good news for me is in the draft, actually the conceptual draft 0 that's being looked at now, there is so much more on equity that is really right. It feels like they've really got onto that subject, but getting our way out the other end is going to be extremely difficult because there are going to be big debates to be had about that. There really are, but at least getting the principle so heavily in, and the principle also in equity in terms of governance. And I'm impressed, actually, not so much with the treaty, but with the new pandemic fund, the fifth as it was, that at least they have made some steps forward in having equal numbers of countries who will receive money for those who are putting the money in. And they don't even call them donors and recipients at long last. They call them collaborators, and that's much, much better, basically. So, but I'm not going to talk much about that one because it's a very big subject. I don't feel expert in all the IP at all. But my panel that I'm working with, I mean, it's very clear. What we do have to have is manufacturing, not in every country, but right across the world reasonably. And we have to have the tech transfer to be able to do the things. That's what it's got to deliver in the end. So I talked sort of a bit about this question about, oh, I've gone the wrong way now. How do I do that? About accountability. But the first thing that, when I talk to member states, say in Geneva, say, what is this accountability about? What have we got to do, really? And the details of it are quite complicated, but the essence of it is quite straightforward. One thing is transparency. It is absolutely clear that we are really going nowhere if we can't actually find out what the virus is at the outset. We can't do the genomic sequencing, all those sorts of things. But keep going with that information about data, about what's happening in each country. So that's incredibly important. But the other key is, as I've said, is the preparedness and response. And for that, for the preparedness, as I've said, I think it is very variable about where countries are. And again, what my panel has said is really we can't expect all countries to reach the same point very quickly. And we've been suggesting that we go along like the Paris Accords in climate change, where countries set their own targets, looking at where they start from and looking what money they're going to get, and then setting themselves targets about what they can do with that. So preparedness is relatively easy to look at because we know the sorts of things that that we are actually looking at within that. What's more difficult is response. And that again is because it's very difficult for WHO, say centrally, often to say, well, what exactly should be done now? The reason being, as people have said, is maybe we don't know this virus yet. Maybe we haven't got the scientific evidence of what we should do. We're in different states. Some countries will have had an outbreak, others will not. Others will, be very far along on the curve. And on top of that, you've got the cultures and histories of countries about what their populations will and won't accept. So there are difficulties in how you measure response, which doesn't mean to say that there aren't some fundamental things that do need to be said for all countries to do. And I'm very embarrassed with my own particular country, which is a very strong public health system where they actually forgot to do testing, tracing. We didn't have so much tests then, but tracing and isolating of people in the way that we know. I mean, how could we do that? That you can definitely say is a response mechanism that has got to be in everybody's you have to do list. But a big part of this negotiation coming up with for the treaty will be that there are words that are used in the treaty that have great meaning. If it says, for example, that WHO says you should do something, that means it sort of recommends pretty strongly you should do it, but you're not actually quite accountable for it in that way. If it says you shall do this, then that is an obligation under the treaty. So we've got to be clear when, what we're saying. I'm sorry that's a bit complicated, but I think we really need to know what it is we're going to be held to account for there. So response is difficult and needs more work on, and needs to tie in, obviously, to the international health regulations, which is itself a bit tricky because they've started both negotiating more or less now, and we've got to get the two of them together to make sure this works. But just moving then to the measurement of accountability. What I've said about the financing and so on. At the moment, for looking at preparedness, there is talk all the time about peer review by other countries, that's the way you would look at whether countries are prepared. In fact, I think a lot of us believe that there has to be independent assessment to get it away from any of the politics of between countries, or for that matter, sort of confrontations with WHO and so on. That the peer review is a great thing. You can learn a lot from each other, but that is not ultimately what you've got to have. You do need independent assessment. Because response is more tricky, again, it has to be also done very fast. If we're really looking at what countries are doing and looking at what they're doing and seeing what they should be doing and advising them or really pushing them hard to do some of those things, that's got to be done very quickly, as we go along in this, very rapid, movement, really. And that's why we are saying that we think there has to be an independent body, actually within the treaty structure, not just off on its own, but an independent body that reports to the Conference of Parties, which is what you'll have for a treaty, that has the ability to get access into the country, is clear that it puts out its results publicly, and works positively with countries where they need support, and obviously often through, help from WHO through experts. But something independent is really needed, apart from anything else, because WHO, if it starts criticizing countries, as you know, many countries then threaten to send out the representative and so on. It needs to be a bit at arm's length from WHO, which it can be perfectly well within the treaty. Now, getting near to the final ones on these. But the next question is, why would anybody do this? What incentives are there to go along with this treaty? Well, we've talked about that, the whole is, we're all in it together, and we're only strong as the weakest. But there is something quite strong about mutual accountability here. If we get a treaty where you're expected to do something, And you have to, and you think about it, and it's quite difficult for you to do with your own population and so on. You want to know that other countries are going to be doing the same thing, so that you're not, doesn't just run back to you anyway. And that's where these words mutual accountability come from. Countries will have a responsibility to other countries to be accountable, really, about what they're doing, to make sure that it won't just rebound on them. So we talked about that. That's a we're all in it together, but of course that isn't the only. I mean, people are not necessarily going to sign up to this treaty just because of those almost goodwill things. But the next one down, I think, is one area where more public reporting does help, because countries are concerned about their own reputations, and if it's clear what they've been doing or not been doing, that will stand out, and you can actually see with countries where they are. And then there's one particular item that's come up, and it's sort of a bit of a wild card. Yet everybody is sort of talking about it a bit, and this is about the IMF and its Article 4. Now, Article 4 of the IMF, which I now know, I never heard of the IMF Article 4 before this, is the measure of financial stability for countries. And already they're looking at whether what countries are doing about climate change, it can be looked at, because again, of course, that is affecting a country's financial stability. But if they're doing that, there is the possibility of also that with the data from, say, an independent body, they could also look at the financial ability that comes out of good preparedness and good response. So there's some, as I say, it's a bit of a wild card, but it's about the only thing anybody, I think, can think of that might, particularly for the rich countries, make a difference in how they would operate. At the bottom, as I've said, I think immediate sanctions on a country for not doing something or doing something are almost impossible, actually. Almost anything you think you could do to a country, like, I've heard somebody say, well, we won't let them have the vaccines then. You simply can't do that. It's completely unethical to think that actually what your government has done, perhaps not as well as it should, suddenly affects the health and even life of the people in your country. So there are some incentives there, but they're not strong. So that's why, again, we have, so much need really to make sure that we're really pushing towards this treaty. I'll just put the points up, but I'm not going to go through them. What the problem is we've got not enough money for this at all. It's about 1.4 billion at the moment, where we need 10.5 billion every year. We haven't sorted out the global public goods and how to make that work with the pharmaceutical industry as well. We've got great fragmentation of the science and technology bodies, and we need to really get on with One Health to find out how we can ultimately we can prevent this all happening. People have been telling you all morning where we are with these negotiations, but it is just nice to think, though, as we're sitting here, they're sitting there in Geneva, equally bored, actually, with all these speakers telling them what they want to do, the member states giving their opinions at the moment. I hope they're not bored, and I hope we're not bored, but you never know. But anyway, it's good that we are meeting at the same time there. And then, just as my final slide, I just want to put some ideas to you about what parliamentarians can do, and we've pretty much said these, but I hope that we've got now the panel just coming up now of MPs. I hope that you and the conversation will go into thinking about what exactly practically can parliamentarians do. Obviously, being on some of the committees, the health select committees and so on, and making sure that's on the agenda. What on earth can you do in your constituencies? These are just putting these questions on the table, really, just to say, we really value what parliamentarians are doing. We need to make sure that you're well informed so that you can inform others, but we need to think how you can work through that. And with that, I'm going to stop, because I have online, I hope, where those who are looking at things online, have Larry Gurlis online. I've lost his name now. Larry Gostin online, who is the Professor of Public Health Law at the O'Neill Institute in Washington, in Georgetown. He is probably one of the most renowned public health lawyers that there is, actually. And he's going to give, it's a bit of a sideline to mine because he's been doing quite a lot of work on that question of the human rights in treaties and in this whole pandemic area. So although we've had a bit of that already, and you'll get a bit more later in this meeting, I think Larry's going to just talk for 5 or 10 minutes, just very briefly, just on really the law and human rights and pandemics. So I'm looking behind the scenes. Yes, Larry's there. Hello, Larry.
Hi, Barbara. How are you? Can you hear me all right?
Yeah, I think so. We can hear you all right.
Okay. Well, I'm very sorry that I've not been able to be there with you. I'd hoped to because I had just come back from Geneva, but it turned out that I did need to get back to Washington, D.C. I've been very active, as Barbara knows, in the revision of the international health regulations. I'm a member of the WHO's review committee for the international health regulations, which are being negotiated now along with the pandemic instrument. And as Barbara said, the intergovernmental negotiating body is meeting today and tomorrow in Geneva. And the IHR review committee just convened all last week and will be meeting virtually again this week, and then back in Geneva again in early January, where the O'Neill Institute that I direct will be hosting a global consultation because although everybody talks about equity, but also a mechanism for how to actually achieve it. And the one thing that I've learned through my participation in the pandemic treaty and the IHR is that there's a really significant north-south divide about one side preferring equity as a priority and the other information and scientific sharing as a priority. In my view, we need both. But I was tasked to really talk very briefly about human rights. We're about to enter the 3rd year anniversary of COVID-19, and it should be a moment of reflection on the untold human suffering. And it's not just the millions of lives lost or the billions, really trillions of dollars lost, but also the vast deprivations of freedom, the noxious discrimination, the erosion of democratic ideals. Very recently, my colleagues and I had a long article in the journal The Lancet that cataloged human rights violations during the COVID pandemic. And what we found through the systematic evaluation is that every aspect of the COVID-19 response, beginning with the origins of the pandemic in Wuhan to China's current dynamic zero COVID strategy, we've had severe restrictions on human rights. You may recall that in the early days in Wuhan, there was less than full transparency in terms of notification and reporting of the outbreak to the world. There was the transfer of genomic sequencing data of the virus, but that came somewhat late. There was a crackdown on protesters, and particularly a brave whistleblower, a doctor who later died in Wuhan. Fast forward to China's current COVID-19 zero strategy has been enforced through intrusive surveillance and coercive restrictions. But governments abuse their emergency powers way beyond China. And they've used COVID-19 as a subterfuge for clamping down on political protests to delay elections, and abused COVID-19 mandates to detain and arrest marginalized populations like migrant workers in India and returning refugees in Venezuela. Between the pandemic's origins and today, human rights violations have spanned the globe and the full range of human rights. And particularly, I think there are two categories. One is the idea of widespread violation of civil and political rights and democratic rights. And the other is the deeply unequal and discriminatory impact. Most glaringly is so-called vaccine apartheid, as populations in the United States, Europe, and other high-income countries were protected, but so many were left behind in terms of under-vaccination in sub-Saharan Africa and in other low-income countries. China wasn't the only country that threatened civil and political rights or jailed truth tellers. Countries including Egypt, Russia, Venezuela, Madagascar, Bangladesh did the same, including for health workers, journalists, and violated not only their freedom of expression, but also the public's right to accurate scientific information. The Chinese government, for example, targeted activists, manipulating its COVID-19 application to tightly monitor and restrict their movement. Disfavored and marginalized populations fell victim to arbitrary arrests. Venezuela targeted returning refugees for quarantine, and quarantine facilities were really deeply inhuman and degrading, with unsanitary conditions, insufficient water, food, medical care, and the like. And these conditions were also found in Burundi and Indian police in India that targeted marginalized populations. And particularly, we saw stigmatization and discrimination against migrant workers and slum dwellers. Governments also undermine democratic institutions by abusing emergency powers and extending them as an excuse for preventing political protests and even delaying elections. Operating counter to democratic principles, Hungary's prime minister used emergency powers to direct funding away from cities, which were opposition strongholds, while El Salvador's president ignored the Supreme Court order to stop arresting people for violating stay-at-home orders, and he suspended parliament. Government leaders in countries like Russia, Ethiopia, Malaysia, Zambia, and Greece used COVID-19 to delay elections, cling into power, and restrict protests. But one of the most important, I think, stories of the COVID pandemic was the unequal impact. One statistic from my own country, the United States, tells a story that's all too common across the globe, which is that U.S. life expectancy for all Americans fell in the years 2021 by 2.7 years. But it plummeted to nearly 7 years for Native Americans, leaving their life expectancy at 65, which is a level that has not been seen by the overall U.S. population since 1944. This unequal impact also occurred throughout many countries, including Brazil, Somalia, Norway, Sweden, and Black and ethnic minorities in the United Kingdom, Asian migrant workers in Saudi Arabia, and migrant workers in Singapore all had much lower life expectancy. The inequities are all too familiar to us now. The story early on in the pandemic was the initial scramble, as you may recall, for diagnostic test kits, personal protective equipment, and ventilators. But the global outrage for inequalities peaked when the most vulnerable in the world, including health workers, were unable to get vaccines. For example, in June 2021, when 1/3 of the people in high-income countries were fully vaccinated, only 0.2% of people in low-income countries were. And the COVAX facility from WHO and Gavi and other partners, never did get the funding that it needed to ensure full vaccinations, nor could it get the vaccine doses that it needs. And today, these inequalities are manifested through unequal access to antiviral therapeutics like the drug Paxlovid. There have been enormous problems with providing unscientific information to the public. The COVID-19 pandemic has reverberated into other spheres with lower standards of living, people being pushed into absolute poverty, inadequate nutrition and education. All of these trends now exacerbated because of the Ukraine crisis. It thrust tens of millions of people into extreme poverty, and merged with climate change and Ukraine. Acute hunger is now in more than 200 million people, and 460 million children could not access even remote learning, which disproportionately affected sub-Saharan Africa. In short, at its core, human rights are about human dignity. The plethora of human rights violations that pervaded and exacerbated COVID-19 have done a great disservice to equal human dignity throughout the world. And it's for us now, and particularly led by parliamentarians like yourself, to honor their lives and the lives of everyone harmed by these violations by undertaking transformational reforms in global health, human rights, security, and equity, so that the next time when the next crisis hits, and it will, that we will at least reassert the fundamental principle of equal human dignity, which emerged after World War II. Thank you very much to all of you parliamentarians. I apologize for not being with you, and I'll hand it back over to you, Barbara.
Yeah. Thank you, Larry, for that very, very expert view on human rights. And it's sort of rather horrifying. It sort of flattens you about all the things that have happened that you know individually, but it's all come together. But I hope it does the same other thing, which is to stimulate everybody to make sure, A, that we do our very best not to get anything like a pandemic like that before, but B, if we do, then we think about all those things and think about how we might do things in a different way in future and the next time. Now, with that, I'm going to hand over to Akua Dansuah for the next part, which is really to get, first of all, parliamentarians here to say a bit more about how they think that we should be going about doing things, and then also have a really good discussion, I hope. So, Akua, all yours.
Thank you, Dame Barbara. Good afternoon, friends and colleagues. I hope we are all awake. It looks like some people are dozing a bit, so let's keep up and follow the discussions. Having said that, let me make the point that the role of MPs in pushing the new global health agenda forward has been mentioned since morning in the various presentations. So whatever I'm going to say now is like a repetition, may sound like a repetition, but just to re-emphasize what role or roles we have to play. As former or current parliamentarians, before we get elected, we go into our constituencies meet the people, campaign, tell them what we can do for them, what they want us to do, and all of that. So as soon as you enter Parliament, you are cloaked with the responsibility of the development of the people and of the constituency, whether you are an opposition member or whether you are a government MP. They think that you have what it takes to solve all problems, in fact, all problems, including social problems. Yes, that is possible, but I want to look at the challenges that we face as MPs. We haven't taken time to discuss the threats to democracy in our various countries. We are saying that MPs should be able, through legislation, through budgetary allocation, through advocacy, through oversight, they should be able to help in pushing this agenda forward. But what if there are threats to democracy in our regions, in our countries? What do we do? How are we going to have this agenda pushed forward? In Africa, for instance, the Freedom House report states, as of 2019, that Africa produced 6 of 7 largest improvements in democratic study, but is also led in the West declines. Because, as you know, some countries, Niger, Guinea, Burkina Faso, and others, backslided on democracy and have gone back into military rule. So what happens in countries like that? How do we expect the global agenda to be pushed forward? We need to look at how to address this challenge. In many democracies also, we have this adversarial winner-takes-all situation. The ruling party will not want to listen to any proposals from the opposition, no matter how brilliant. And it is as if once you belong to the opposition, then you cannot perform in Parliament during your tenure. It's actually very difficult to push through anything. In situations like that, how do we address the problem? How do we empower opposition members of Parliament to also contribute their quota? We also have constitutional provisions where, for instance, 50+1 members of Parliament must be made, or where we have ministers coming from Parliament more than outside of it. In other words, what do we expect? We expect that you get elected into Parliament, and then the next thing you are looking at is being made a government minister. And once you become a government minister, do you still have that loud voice to advocate for the right things to be done? No, it is always difficult. So in situations like that, how can we empower the MPs to do their work? Because if you ask me, the desire of every MP, especially on the government side, is to get into Parliament and also occupy a ministerial position with all the good things that come with it. So we need to also look at that. We need to look at the way our governments prioritize development issues. For them, is it global health? Is it even health in country? Or is it to get as many projects into their strongholds so that they can be assured of winning the next elections? Are these national priorities or their parochial political priorities? MPs must be empowered to look at that. The point has also been made for multilateralism, partnerships of various forms and various kinds. We are all here thanks to UNITE, AHF, the Global Fund, the World Bank, and all our sponsors. Yes, but we can do a lot more if we include civil society, and especially the media, who act as voices for MPs who are not in the position to push for the right things to be done by government and for the right budgetary allocations to be dedicated to development issues, particularly health and global health issues. We need also to get involved or get more interactive with our CDCs. These are people who have the expertise, who can help in knowledge sharing, who can help in research, and who can help empower us with what it takes to even be able to identify disease outbreaks. If we have the right information, we can identify disease outbreaks as soon as they start in our constituencies, because these things start from places, they start from local areas. And without the necessary capacity, especially knowledge, and the critical eye to look out for these things, we may not be able to locate them. And if we are not careful, this is when we have epidemics first, and then they become pandemics. MPs are supposed to be representatives of their communities and the world. But we are also human beings. I've said we need the capacity, we need what it takes, we need support, we need strengthening, and we need partnerships, strong partnerships to help us in our work. I want to end by saying that disease does not discriminate, and therefore, no matter where we find ourselves, let us not politicize health issues. Disease does not discriminate. We saw this during COVID. Poor, rich countries, cities, villages, all of us were affected. So in tackling health, and especially global health issues, let's put our politics aside and do what is in the best interest of our people. Research, knowledge, experience sharing are very critical. We mustn't forget that. And we must hold our governments accountable. There have been instances during the COVID pandemic when a lot of donor resources were channeled into countries. But if we ask our governments for accountability, no, it won't come. Most of them, or let me say, some of them use those resources for political projects and left the citizens struggling to take care of themselves. So let us find a way of asking our governments for accountability in the use of these resources. The point was made this morning about our involvement in the anti-vaccine activism. It is a big problem, sometimes for religious reasons, sometimes for whatever. I really don't understand. So it is for us, the MPs, to get to the people. Let us, it doesn't cost much to tackle this problem. Once we go out interacting with the people or holding surgeries, as they say in the UK, with our people, let's use the opportunity to explain the need for them to be vaccinated. In some countries, for instance, polio is coming back. Monkeypox, or Mpox as it is called now, is also resurfacing because of anti-vaccine activism. So we need to work seriously at this problem so that we don't have a repetition of what happened during the COVID-19. It is still on. In some countries, we are still having the challenges, but let's get our people to understand the need why they must have the vaccines. Dame Barbara, Ricardo, and others have spoken about the new Public Health Convention or treaty, whatever we want to call it for now. And we want to thank them for giving us MPs the voice to also contribute our quota. AHF is also part of this very important partnership, and we are grateful to you for that. In conclusion, I expect that at the end of this panel, we will come up with new opportunities for more parliamentary engagement in pushing the global health agenda forward. We have a lot to do, but then we also need the empowerment, the capacity, and the skills to do that. I thank you very much. So on this note, I take over the moderation of the panel. We have 6 panelists. Dame Barbara will be sitting in, but she will not take questions. She will only listen and only come in as and when she feels enabled to do so.
I'm fine. I've done enough today. Thank you.
All right. So we have 3 questions that we are going to ask each panelist, one of whom is in India and is joining us virtually. That is Honorable Amar Patnaik. He is unable to join us due to the stress of parliamentary work, and so will be joining us virtually. On this note, let me read the questions first, and then I will call on you individually, according to the listing I have here, to respond to them. The questions are, how can parliamentarians help prevent the next pandemic and promote the INB Convention? That is 1. Number 2, what accountability measures at global, regional, and national levels must be incorporated into the pandemic instrument? Number 3, how can we balance the obligations set forth by a pandemic convention and national sovereignty? So, may I call on Honorable Daniel Lilayu? Yes, Member of Parliament from Chile, to have the floor. Thank you. So you are next. It's okay.
Good afternoon. Let me greet UNITE and thank you for the opportunity to be here. I've been elected very recently. I see there's a lot of knowledge here. I'm a surgeon by trade, heart surgeon. I was in the operating room until very recently. Until 3 years ago. Well, 3 years ago, there was a pandemic that changed the world, changed our lives, and changed things we believed in. If you want to try to stop something in a medical capacity, you need to know. You have to have knowledge, and you need to plan for things. You need to have knowledge. With the knowledge we've gleaned over these 3 years, we can draw up strategies. And we need to do this to have better responses, to mitigate any damage there may be. We know that now we're more ready than we were 3 years ago when the pandemic started. Generally speaking, all countries have learned lessons as they rise to meet these challenges. The demands on the health systems were very different from one country to another. Some were more successful in dealing with the challenges, and others less so. I started by saying that I come from far away. I come from the end of the earth. We have a special system. It's the president that has the ability to award funds and to manage things. In the parliament, all we do is vote for the budget. And I think this was a positive thing because the executive powers moved quickly. They bought the vaccine, several types of vaccine. And we had all sorts of vaccines. We had leftover vaccines. I've had 5 shots. The last one was the Pfizer shot. What does this mean? The MPs work, but we don't touch the budget. We cannot allocate the budget. There is a public health system, and it worked well with the private sector. This was very important. This is a lesson we have learned. The joining of both systems. No single Chilean citizen died because they needed a ventilator. Because we're at the end of the earth, we started buying ventilators and inventing them. But no Chilean citizen died because they needed a respirator and they didn't have one. When I say that we need prevention, I think countries must be able to prevent these things. We must be on high alert. We need cooperation. I started out by saying that I'm a parliamentary, an MP from a small country. I'm a doctor, like I said. I live in the countryside, and life in the countryside is different from life in a major city. What are the MP's obligations? Well, we have to draft laws and we have oversight power. And we need to oversee things, and we need to bridge any gaps, build bridges between the executive power and society, civil society. Another panelist said that we need a civil society strategy. It's important that people know that their MPs are working on their behalf. And I said it's very important to have health-focused committees. And the more we know, the better decisions we can make. We have a cold climate, we have animal diseases, and COVID was imported. There's a lot we have to learn from other countries. We have a system that needs to talk, to establish a dialogue. When the primary system works, it helps the secondary system work all that much better. we MPs, we are opinion leaders when we talk to people. But what we know best are the areas, are our conscriptions. I believe that we must play our role and keep playing our role. We must demand transparency. We need to demand investment. We need to demand transparent investment. Something that we need to do as legislators is to have local and regional cooperation. But in order to get there, we need to have strategies, communication strategies. And this is all an MP must know how to communicate. We need to have a tool to communicate. We need to incentivize environmental protection. We need to talk with the local environmental authorities, with the local health authorities, local and regional authorities. We need to talk to academia. And also we need to talk to experts. Experts in animal health, public health. We need to talk to the mayors in border areas. It's important that they all know, but we know all about where they stand. There are local issues, the depletion and the abuse of local resources. INB must be able to help promote dialogue between all types of authorities in all countries. And now let me address the second question. I believe we need to have a parliamentary observatory to see what is done in each country. I think this would be a key tool. And as for the third question, I think we need to have this observatory for the pandemic with several committees. We need to prevent, prepare, and help fight the pandemic and prepare for the next one. I'd like to close by saying that if we want to go fast, we'll go alone, but together we'll go further.
Dr. Ilayu, for bringing your professional and the Chilean experiences to bear on the discussions. The next speaker is Honorable Dr. Marian Jashi, former MP from Georgia. Please, you have 5 minutes only.
Thank you, Akua, and I also promise I will not be in the next session. So let me first start with the first question. How can parliamentarians help prevent the next pandemic, and how to promote the intergovernmental negotiation body process for the new global convention? First of all, we have to ensure that the conceptual zero draft of the global treaty convention, we can name the instrument as we wish until it's officially named, physically or virtually reaches parliamentarians. As we have heard during this earlier session from our honorable members in Uruguay or Zimbabwe, parliamentarians haven't heard about the draft negotiation process going on by the leadership of World Health Organization. So we definitely need to ensure that the World Health Organization, through its country offices and the UN coordination systems, communicates the draft document both to the government ministries and the parliaments. And WHO should be the central international body to encourage that the members of parliament are engaged in the process of reviewing the conceptual zero draft. So we have to support each other, and I believe, Ricardo, UNITE can really play a very interesting facilitating role in ensuring that the draft document reaches the members of parliament and we moderate the potential discussions at the parliamentarian level. And this would be very much in line with the historic memorandum of understanding that was signed with WHO. Also, parliamentarians can initiate a series of consultations, both with civil society organizations and academia, to enrich the comments that the member states could be communicating back to the World Health Organization. Yes, with the mandates that parliamentarians have from their constituencies, MPs can play an important role in ensuring that funding from domestic budgets are allocated for actual implementation of the draft convention once finalized. And at the minimum, the convention document itself should include the accountability mechanisms at the national level to the members of parliament. Because what we have seen again, and it was lovely to hear that encouraging that the experiences were very similar in terms of passive observers' role, unfortunately, of the members of parliaments across the different countries. So we definitely need to change that aspect. In terms of accountability and how we can balance sovereignty questions versus accountability within the Global Convention, first of all, when a global convention draft raises concerns about the sovereignty question, we have to analyze what is the actual origin and reason for that question. Because one can question whether concerns with the state sovereignty could be related to the reluctance of the national governments to fully comply with international health regulations and evidence-based recommendations, and not to use the emergency health contexts for populistic decisions that can favor political sentiments, especially around the elections cycles and the times of elections. Because if we do not counteract the anti-science and anti-vaccine campaigns that we have seen all over the world, and today was raised by our colleagues from Azerbaijan, Zambia, and also the United States, we will end up in letters sent to the ministries and the members of parliaments, like in Georgia, that maybe the country can consider withdrawing from the membership of the World Health Organization. So that was actually one of the reflections of the anti-vaccine campaigns that our country experienced. And I'm sure the examples would be diverse from different countries. So we definitely need to first understand what's the origin of the sovereignty questions, and when we know exactly the questions, of course, answers could be formulated and looked for. At the same time, the pandemic demonstrated the central and irreplaceable role of the World Health Organization. But at the same time, we have seen the lack of independent international monitoring mechanisms to really ensure that countries would comply with the best available recommendations and international health regulations. With all the due respect and incredible role that the World Health Organization has been playing, the existing political dependency of the World Health Organization on the leadership of the governments and also the funding mechanisms, the core funding of WHO, doesn't give sufficient independence to the World Health Organization to really exercise effective international regulatory and inspectorate role. So my position is in line with Barbara's position and the co-authors of the initial recommendations that it should be an independent body with very close partnership with WHO and all other players. And at the national level, accountability should engage members of parliaments, and what is most important, the accountability mechanisms, the international treaty convention should be legally binding. We cannot afford ourselves another regulation like IHR that was de jure effective, but de facto only implemented as per the decisions and kind of voluntary support of the governments. Thank you.
Thank you very much, Maria, for your insightful proposals for MPs to push the global health agenda forward. We are very grateful. I'm informed Amar is not online, and so I'll go straight and invite Honorable Aisha Mohammed Al-Mula, yes, Member of Parliament from the UAE, to make her contribution.
Ladies and gentlemen, a very good afternoon to all of you. Excellencies, dear colleagues, ladies and gentlemen, again, I would like first to thank Unite Parliamentarians Network for Global Health for organizing this summit and the panel for Global Public Health Convention for inviting me to be a speaker. My speech will be endorsing, and it's a sort of a recap of all my colleagues and all the panels previously did apply in this session. To discuss pandemic prevention, preparedness and the response, more specifically in discussion around a pandemic international instrument. This is indeed an important occasion for us, members of parliament, to come together to discuss the need for more stronger pandemic preparedness and show our support for a new initiative, a global pandemic accord, to best fight epidemic and pandemic. In the past couple of years, the world truly experienced that pandemic no geographical borders. The COVID-19 and its variants have jeopardized the social and economic situation worldwide. From this experience, we all learned that cooperation is fundamental, as no single institution or government can address future global health threats alone. Indeed, the pandemic exposed the discrimination in purchasing power among nations. While richer countries had access to vaccines immediately, others had to wait for months beside hundreds of doses that expired. We cannot let this happen again in the event of another pandemic. Additionally, as we all know, vulnerable communities more affected, the numbers of death, diseases, conflicted, affected, and vulnerable community grow faster compared to other communities. Refugees and displaced people suffer the most in the lack of adequate health system and basic services. It is therefore essential to plan and implement a universal health coverage that targets vulnerable populations, especially during health emergencies. A global treaty would be legally binding under international law. An agreement on pandemic prevention, preparedness, and response adopted under the WHO would enable countries around the globe to strengthen national, regional, and global capacities and resilience future pandemic. Such as instrument would enhance international cooperation in the fields of surveillance, alert, and response. To properly respond, I made it in 5 points. First, we need long-term political engagement at the highest level to work together to best prepare for the future. Second, we need political commitment to fund pandemic preparedness policies in the long term. Number 3 or third, we need to ensure that scientific community can mobilize quickly to respond, and that industry can also quickly deliver on the production of vital medicine and vaccines. Number 4 or fourth, we need to ensure that the scientific community can mobilize quickly, and that the industry can also quickly deliver on the production of a vital medicine and vaccines, as I mentioned. And we need to ensure universal, equitable access to solutions to health threats, including medicine and vaccines, as I mentioned. But how can we, as parliamentarians, advocate for this to ask become a reality? First, we have to raise awareness about the treaty proposal at the national, regional level, where we should build a network of focal points, partners, civil societies, organization, and academia. We need to call for increased budget for research and development, call for more international cooperation for surveillance, alerts, and response, as my colleagues mentioned previously, as well as design recovery plans that ensure human rights protection. We never just go and do that treaty and sleeping on the other side for the human rights. To make this reality, we count on the support from partners here, present, colleagues from parliaments around the world, and political leaders and civil society organizations to support in ensuring that if a new pandemic arises, no one is left behind. Thank you very much. And I would like to invite you to read more about the United Arab Emirates experience and how we went through, and it was one of the remarkable era, I would call it, more of an era, yeah. It was a remarkable success during the pandemic, our experience during that, in terms of vaccines, medication, healthcare system, regionally and internationally. We've been the only airport in the world, or actually airports, there were 2, who never slept during the pandemic, helping friends all around the world, from Latin America to the Far East. This is number 1. And I would like you also to visit the website of the Regulation Lab. We have a Regulation Lab. This is more futuristic, and we had it since long time, and we are prepared for this kind of experience. So, and many things that as I was discussing during lunch about it. So I will be very happy to share that with you and read about our country, what they did. Thank you very much. I really appreciate it. Thank you.
Thank you very much, Honorable Aisha, for your very exciting presentation. At this note, I want to call on Dame Barbara to give her concluding remarks, if any. Do you have any? Okay. Do we have any questions or responses to? Please, can you, the lady in the pink top? Yes.
Muchas gracias.
Yes, you.
Thank you. Thank you. I'm Marta Bravo from Chile. I think that as far as prevention is concerned, and I will explain why I'm using a mask here, because we should always be able to communicate risk and multidisciplinary and interdisciplinary capacitation. So teachers, social workers, we should not just be focused on the health professionals, but all other associated professions as well. As far as vaccines are concerned, we know that what first saves lives in drinking water is drinking water, and then vaccines. But there are some groups that are anti-vax, and so we have to enhance the trust of the population on the scientists and on the scientific breakthroughs. And in order to gain this trust, we have to communicate risk. And the fact that there are restrictions doesn't mean that we should forget about other measures, such as the use of mask or hand washing, that helps prevent COVID as well as other infectious diseases. So we have to teach kids that vaccination, washing hands, use of mask is not just an act of responsibility, but also of solidarity. Now, if I'm using a mask, I'm protecting people around me. And that's something we have to teach to our children. Now, regarding the test and tracing strategy, it's important that we do this in order, namely in detection of, the waters. We have to test the waters. It's also important to have information about drug addiction. So, and this involves other areas such as education policy and the policy on science, technology, and innovation. So, as parliamentarians, we have a lot to say about this. Thank you.
We have only 10 minutes more, so let's keep our contributions very short. Gisela. And then after her, you.
Yep. ¿Cómo están todos con los translators? Voy a hablar en español ya que los...
Because there is translation, I will speak Spanish. So, thank you for this panel and for all your experience. It's always very nice listening to you, Barbara, and learning from you what you can teach us and what you should expect about the future. Now, this is a question that we should all ask as parliamentarians. With this new treaty agreement on global health, the parliamentarians will eventually have to ratify it in our countries. So a lot of things that is said here from this until 2024, we have to be aware and attentive to what is going on. We have to we have accountability mechanisms, control mechanisms, and implementation monitoring mechanisms that this treaty could have. So my question is, how do you think in your different countries and on your parliaments, how can we implement these mechanisms, these monitoring and control mechanisms in our respective countries? And if the ILO could be, or the Labour Convention can be an example, or should we do something different? Thank you.
You want to take? Yeah, Maria.
I believe that currently no one has a definite answer what would be the accountability mechanism or regulatory mechanism of the convention. So this is the time when the conceptual zero draft will be finalized, and as I'm informed, and Barbara can correct me, in February the document will be sent to the member states for starting the actual negotiations. So it's this moment when we have to ensure that the document reaches the members of parliament, not only the government ministries or even the cabinet of ministries. And your suggestion on the mandatory ratification of the convention is excellent. Very frankly, I haven't heard about this proposal until now. So this is a very concrete proposal that could also feed into the recommendations from the current meeting. The regulatory mechanisms, ILO is a very good example, but the actual monitoring mechanism, how compliant the countries are in terms of the evidence-based recommendations, that is very difficult because on one hand we need political neutrality and on the other end high level of expertise to actually validate whether the actions or decisions were indeed the evidence-based. So this is the moment where we have to use to provide inputs as much as possible for the best appropriate regulatory mechanisms for the convention. Barbara.
Mm-hmm. Thank you for your contribution.
Barbara, you want to comment? Okay. Thank you.
So, no, I called somebody here. I think Honorable Ruth.
Thank you.
Yes.
Yeah, okay, thank you very much. Thank you for your presentations. My concern is still on the pandemic treaty. I want to assume that this doesn't become a death trap for the third world. Because if Zimbabwe puts its only 1 million as a collateral to join, because this thing, somebody has to fund it, like the way we do with the Global Fund. You put some 1 million there, but you see the evidence comes out, the dividend. But in an epidemic situation, you may be forced to become nationalistic by the virtue of the situation, like all of you in the First World did. You decided you didn't want to know the next person. What happens to my money now, which is stuck in that pot, which people have used and have benefited nothing? Because this treaty could actually be a death trap for the third world, unless we say you raise your own domestic funds and keep them in your own house. We share information, we share database, we share expertise, and it ends there. Not that we create a pot somewhere because we saw something else in the last pandemic. The British government pulled out 16 million from Zimbabwe at a click of finger because they had to control the epidemic. What will stop that happening next time?
Yes, before you, sir, the lady, yes, and then Nima and the gentleman. 5 minutes more, so make it brief.
Buenas tardes a todos. Soy Carmen.
Good afternoon, Carmen Late, primary care doctor. I've worked for 30 years. I am now a senator in the Senate of Spain and a member of the Commission for Social Issues and Sustainable Development in the European Council Parliamentary Assembly. I'd like to thank this organization that gathers MPs from all countries that we will bring back to our parliaments and benefit our people. That should always be at the core of the parliamentary and political activities. The Commission for Social Issues of the Parliamentary Assembly of the Council of Europe, during the COVID, passed several reports that then was conveyed to the whole Assembly of Council of Europe. I was the rapporteur of our proposal on social matters, health and sustainable development on the report of vaccines and fighting against the infectious disease that was approved by the Parliamentary Assembly. Now, everyone has to do this, and vaccines save lives. WHO estimates that child vaccination saves more than 4 million lives per year, and it is the best tool we have available to fight infectious diseases. Currently, there are anti-vax movements that, although minoritarian, they have certain social impact. Now, let me stress that the senior population, our elderly, they have no doubts. They most of them get vaccinated, and why? Because in their childhood they learned about infectious diseases that vaccines could prevent. Diseases like diphtheria, tuberculosis, measles, and polio affected populations and caused death and maimed people. Now, after COVID, vaccines were important to prevent death and the collapse of our health systems and in all our countries. So our goal should be that vaccines are not a cause for inequality in health, but we must make sure that vaccines reach all corners of the world. We need more accessibility, solidarity, equity, and universal access, so that the right to health is shared by all humanity. And if with this treaty we can improve things and make sure that in the future pandemics we are better prepared, so welcome the treaty. Thank you.
Nima, you have the floor.
Thank you very much. For me, I just wanted to quickly ask Dame Barbara regarding what is this advocacy strategy that you have for making sure that we can reach influencing and key stakeholder groups in different countries. For example, parliamentarians and religious leaders. Because during the pandemic, it was very clear that the people who kind of distorted the science were politicians and religious leaders. And in all of the advocacy, they seemed to be forgotten. There was more focus and alignment with health practitioners. So I just wanted to know, what is the plan towards having such advocacy in country? And then secondly, very quickly, even with such a plan, there is still differences in our own financial capacities as nations. How are you going to consider global South countries that are not at par in terms of their financial muscle? What's going to happen? What's going to happen in terms of making sure we have access to data, which data is expensive sometimes to get access to? So what are the mechanisms in that place? Thank you.
Yeah, shall I do that? Yeah.
Okay, so I now give the floor to our last contributor.
Sí, lo mío es muy breve. Se nota que...
I will be brief. We are parliamentarians, we like to talk, but I will be very brief. Well, MPs have a lot to do in the development of public policies, a lot to do. My concrete question is, how will the WHO include this dialogue with parliamentarians? Because we all have this dialogue, but what is foreseen by the intergovernmental body, by the WHO? What does the WHO think about incorporating this dialogue in each region of the world? That's my question.
I thought we had ended. Yes. Yeah, so on this note, I want to thank all our panelists for their brilliant contributions. Dame Barbara, you now have the opportunity to give your concluding remarks. Thank you very much.
Well, there's a mix here, some extremely big questions and then some practical things. Starting with the biggest of all questions is your points from Zimbabwe about equity and fairness in a wider sense, not just the vaccines, but in many other ways. Now, I mean, I don't think even the whole of this room could sort this out, because this is, we are, I think maybe it was Ricardo right at the beginning who was saying, we're in a time of nationalism and populism, and unfortunately, when pandemics arise, the nationalism gets stronger, where you close in. This is a real work for everybody in this room and well beyond to try to actually make our world much more equal. And I think the only way you do this is by each in our own role of trying to work on this. I mean, people don't know, but I was chief exec of Oxfam for 12 years, and Oxfam has done enormous work on inequality within countries and across countries. And you need bodies like that. That's back to our civil society work, that we're really pushing that. And that's where we need particularly civil society to be getting up and complaining and saying this is wrong. But this is a deep problem the world has got, and I'm sure I don't know how to crack that one. But the only answer is for all of us just to keep working, in my view. And at least there are, as I said, civil society is part of that. And I was just thinking about this thing, I don't know whether Eloise is still around from the Pandemic Action Network, but the work that they did to bring I don't know, several hundred, I think, civil society organizations together to press the World Bank not to go ahead with its way of governance for the pandemic fund and achieve that. It was fantastic. I mean, they may not have been the only people, but that just shows that when you come together and you use civil society and really go for it, you can actually make a difference. So we shouldn't be depressed by it. I'm just saying there's an awful lot, you know, of work to do in all that. Moving on to some of the points about your engagement. I think this question, I think we've got our linkage from Unite through to WHO sitting listening here, actually. And I think some of the points about how WHO thinks about engaging parliamentarians, you know, Elise, is really worth thinking about. I mean, again, it's not something we can say what the answer is here, but it's clearly there is a drive here for saying, well, how do the INB get a little bit closer, you know, to the countries without necessarily going through the missions and all of that. And I think something could be done on that front, especially obviously with a partnership with Unite, because that's the point of how that could happen. That comes on to maybe just some of these issues about what you can all do. And I think, again, to repeat a bit, but I think it's quite important. It's about, what's the first thing people need? People need knowledge. Knowledge about what pandemics are, knowledge about how they work, you know, and there are easy ways, I think, to get more information to you know, parliamentarians about that. Then they need, as they've asked for here, the zero draft to go to parliamentarians, at least directly through Unite, so that people can actually read it. I mean, I've had to read the conceptual zero draft, and honestly, by the time I finished, I thought it was sort of, I could read it. You know, it wasn't like there's this horrible, and you're better at these things. You have many more of these legal documents than I have to read. But, you know, you can get through it and think, yeah, I get what they're saying here. I agree with it or don't agree with it. So I think get that out. It will be out, as Miriam said, at the latest by the beginning of February, because that's when the next meeting is to agree how the negotiations are going to take place, you know, with working groups or not, etc. So I'm sort of imagining tell me if I'm wrong, but probably the middle of January is sort of the time when you might see the zero draft. So get your hands on it. You know, that's and actually you can find it at any time. Maybe you should send them the link also about the INB, because you can get on their website all the time. They're telling you on it today, you know, what probably at the end of today, what was discussed, in fact. So, you know, you can directly get to these things. So maybe the communications person from Unite around, that we could perhaps add up some of the things that people would want, so that you have an easier life and it flows and you don't have to keep sort of asking, you know, for these things. An interesting question was really how you do discussions with constituencies, but maybe that's an internal Unite question that could be discussed as well. I was very pleased that you were going along, believing in the need for accountability, because you know, there are people who don't believe that, and we have to keep pushing at it and not move away from it. And that brought up the question of this sovereignty issue. I mean, the thing that made me go, oh, whoopee, was when I read in some of the papers that, because there is an argument about sovereignty, and there is an argument going on in a number of countries that they shouldn't sign the treaty because it takes away all their sovereignty, which is really so extreme a view of what's going that we need to stop that. But the thing that I read, which is quite clear, is that in the Charter of the United Nations on this, it doesn't say countries have absolute sovereignty in health. It says you have absolute sovereignty in health, providing that is not to the detriment of other countries. And I think we have to keep reminding everybody that that is our mutual. Of course, you have responsibility for your own nations, but beyond that, it is also, especially when you're completely interlinked, you have responsibilities to others as well. So I think, again, all of this is about getting the right arguments out, but there is work to be done clearly on making sure that those who don't want this to happen don't use this sovereignty issue and wind it up, which they are doing currently. And I don't know, again, the answer to how we fight back on that, but it does need to be fought back. And it probably needs to be fought back, in particular, in countries again, between parliaments, but also, you know, civil society there. Just a technical one at the end about well, perhaps I shouldn't deal with this, but there are lots of thoughts about where, this is Gisella's question about where monitoring goes, and is ILO a model? Well, it is one of the models, but one of the more particular models is actually the IAEA model, because it's too big. You wouldn't need a big body like that, but it is really quite independent and can do all these access things. But you do need it to go back to the Conference of Parties. You need to go back to the heads of state, when you've got the results out about, what's happening. It can't just be an independent body with quite a lot of experts in it who can force governments to do what to do, but you can make it public so that actually, at heads of state levels, there can be discussions, about all that. So that was a bit of a particular one, but it goes to the point that there's a lot to be discussed in the next, 18 months, and each one will raise a specific set of questions and problems, and it's great if you get more informed about it as it evolves, and really therefore help all this move on by being the a warm background that we can really push on to make things happen. So personally, as well as I hope the room, it was a great discussion to hear, and to hear the things that you want and how you might actually help this happen, really. So thank you.
Great. Excellent. Well, thank you so much to our esteemed speakers. I think that was a very informative and constructive discussion on how we can work together to advance this Pandemic Health Convention, Pandemic Treaty, and ultimately improve global health architecture together. And so we are a bit over on time, so we will please break for 10 minutes only for coffee, and then so we'll see you back here at 4:40. Thank you so much.
It is now my pleasure to begin our next session for the afternoon. It's a bit of a different format. It's more of a fireside informal chat. It is hosted by Unite Partners UNAIDS, and it will discuss the lessons learned from COVID-19. So it's a small panel, as you can see. So we are joined virtually by Matthew Kavanagh, Deputy Executive Director for Policy, Advocacy, and Knowledge for UNAIDS. And then sitting next to me is the Honorable Peter Njume, who is a Member of Parliament from Cameroon. So I will first hand over the floor to Matthew, can you hear us and see us, Matthew?
I can. Can you hear me okay?
Please feel invited to kick us off.
Great, and thank you so much. Apologies that I can't be with you in person. So thank you, Chair, and to all of the honorable parliamentarians, distinguished panelists and guests. I want to really congratulate Unite for putting together this really important event today. You know, the summit comes at a crucial time as we've just commemorated World AIDS Day on December 1st, and the world is really thinking about kind of how do we tackle pandemics directly and confront both the AIDS pandemic and the other pandemics that are facing us. So the slogan for World AIDS Day this year was Equalize. It's a call for us to address the inequalities that we know are driving and perpetuating the AIDS pandemic. And so what we know is a few things. First off, the AIDS response has been blown really badly off track. That in fact, we in July launched our global update that described for the world how the war in Ukraine, the COVID-19 pandemic, and global economic crisis have really interrupted the AIDS response. That in fact, we now see rising new infections in Eastern Europe, rising new infections in Latin America, rising new infections in the Middle East, and rising new infections for the first time in Asia, where they had been falling. And so we're deeply worried about where we are in the AIDS response right now, having made so much progress, having ensured that despite not having a cure and not having a vaccine, that we were actually making remarkable progress. We were not on track before the pandemic of COVID-19, and now we've been blown substantially off track. We also know that the AIDS response has to tackle the inequalities that are currently driving the AIDS pandemic. If we look around the world, we can still see that the vast majority of new infections are actually happening in the global south. This is legacies of years of insufficient progress, and the north-south inequalities that we know are actually growing. Secondly, we know that the majority of new infections are actually happening among key populations, among gay men and other men who have sex with men, among people who inject drugs, sex workers, prisoners, and that globally, we can see big inequalities between the generalized population and these key populations. Gay men and other men who have sex with men, for example, have 28 times the risk of acquiring HIV than the general population. And we also know that young women, especially young African women, are particularly at risk. That in fact, in sub-Saharan Africa, 6 in 7 new infections are among adolescents or among girls. 6 in 7 in that 15 to 19 year range. So there is a lot of work to do that. I want to kick us off, and it seems like we're going to have a conversation. I want to kick us off with a few kind of ideas about what do we actually do about that. Number one, we have got to tackle the inequalities when it comes to access to the very best services. So right now in Lisbon, I think, but I could be checked on this. I'm not sure if it's actually in Lisbon. Certainly, if you went over to London or you went to Paris or you went to New York, what you would find is cutting edge new prevention technology, long-acting HIV prevention injections that actually last for 2 months. Cabotegravir, you can take it, and it actually ensures that you can stop HIV as PrEP, right? You can stop HIV immediately. Well, that is a really, really important innovation, but it's currently available in the global north and not in the global south, because it's currently too expensive in the global south to make it possible to really roll out in a big way. This is what we did previously in HIV treatment, where we rolled it out in the north and not in the south. This is what we did in PrEP, pre-exposure prophylaxis too, where we rolled it out in the north. Up until a few years ago, there were more people in North America on PrEP than there were on all of the continent of Africa, despite far more new infections. So we need to ensure that we actually make those medicines available. And that means making them generically. It means making them in Africa, producing them in Africa, Asia, Latin America, and around the world to ensure that we can get access to it and that we've got affordable prices. So that's one key piece. The second key piece I want to highlight for legislators is really this question of human rights and gender equity and how we can use law and policy as a tool to fight HIV. And there we know, because we see it again and again and again, that punitive and discriminatory laws are actually deeply getting in the way of the AIDS response. You know, we actually did a study where we looked at countries that take a criminalizing approach to key populations, to men who have sex with men, to sex workers, to people who inject drugs. Some countries around the world take a much more criminalizing approach, both in law and in the practice of that law. Whereas other countries, and there you're sitting in Portugal, that's really taken a remarkable stance when it comes to drugs and has taken a decriminalizing stance. And those countries that took a decriminalizing stance had substantially less problems with HIV. They made more progress ensuring that at a population level, people living with HIV knew their status, that among those people who knew their status, that they were on treatment, and of those people who were on treatment, that they were virally suppressed. So at a population level, the countries that avoided criminalization did far better over the last decade than the countries that took a criminalizing approach. That is within the remit of the people who are gathered today. And it's why work with parliamentarians is one of our key priorities. You have a lot of power to be able to remove those criminalizations, to change the law, but also to change the policy, right? And to ensure that de facto that's happening. The same is true on gender-based violence laws. The same is true on age of consent laws for HIV services that limit young women's access to services. And so we need to kind of address those as well. And the third piece I want to highlight is really investments in HIV. Not only that they are bigger than they are currently, because we do need more money, but also that they're used more effectively. So on the bigger side, let me start there. In 2021, available funding for HIV programs in low and middle income countries was short $8 billion of the amounts needed. Now, $8 billion is a lot of money in some ways, but a drop in the bucket in the global economy and in the global perspective of budgets of countries around the world. That $8 billion is very achievable, but we're short of that. And so we need a push from parliamentarians in the North and in the South to ensure that that funding actually becomes available. And in a moment of economic crisis, this matters the most. One of the things we see around the world is that the Global Fund and the President's Emergency Plan for AIDS Relief, these are essential pieces of the pie when it comes to financing the global AIDS response. But low and middle income countries are paying the majority of their own responses to HIV. And so with that context, when we have a global economic crisis, as we do right now, where we have ballooning debt, as we do right now, where countries are paying, one report that we just put out shows that countries are paying for every $10 in revenue, $4 of that is going to debt repayment in some of the highest burdened countries, and $1 of that is going to health overall. That can't get us where we need to be when it comes to pandemic responses. And so we need to grow the pot. Our new report shows that actually when donors increased funding over the last few years, low and middle income countries have also increased funding. And so there's been a synergistic opportunity. But where that didn't happen, we flatlined funding, and that explains why when in the middle of a dueling pandemics, our trouble comes when we don't have enough money to actually respond to both of those pandemics. And so we end up robbing the AIDS response to pay for the COVID response. And that's absolutely what's happened in practice. Finally, the point I want to make is that we also have to shift how we're funding. And so increasingly it is recognized that we need community-based solutions and community-led solutions to pandemics. That's true for HIV, but it's true for all sorts of pandemics. We have seen that where there are community-led responses, not only has HIV been able to be tackled more effectively, but those same communities are who's mobilized to fight Mpox or monkeypox. Same communities that have been mobilized to fight COVID-19. Those same communities help respond to cholera outbreaks or tuberculosis spread. And that's in the North and in the South. In fact, it was in Germany that HIV organizations were deeply responsible for responding to Mpox and stopping the spread before there were vaccines. The same was true in Thailand. The same was true in Brazil. And so as we think about all of these pieces together, we can talk about the role of the state and the role of communities as synergistic, but one ends up having a really hard time getting funded. And so as parliamentarians, I hope that you'll work with us on an agenda that really thinks about this role of communities, ensuring that they have legal rights to provide services and that they're funded, that they have access to the services, to the kind of funding mechanisms that are available out there in the world. And so I'm gonna leave it there, except to say that I'm really thrilled to be with all of you today, at least virtually, and really feel the urgency right now of ensuring that in this moment of multiple pandemics, the role of policymakers is more powerful than it's ever been. The role of parliamentarians is more important than it's ever been. And the role of law and policy in getting things right in this moment of crisis is higher than it's ever been. And so we really thank you all for being here and for gathering. Look forward to a conversation. Back over to you.
Thanks. Thank you so much, Matt. Some really important points that COVID has already strained and already fraught pandemic response to HIV and AIDS, and the communities that typically suffer from this are vulnerable populations, communities perhaps in low and middle income countries or in rural areas. And so now is not the time for policymakers and governments to roll back, but to actually have the courage to step forward with funding and to engage with civil society and the community to actively find solutions for tackling this problem and ending this pandemic once and for all. And so I will hand over now to Honorable Njumbe. I will kick you off with a question asking as a member of parliament, how can parliamentarians advocate and develop equitable policies for addressing HIV and AIDS? Over to you, thank you.
Thank you very much, Victoria. Good evening, dear colleagues. Good evening to everyone. I know you are tired, but I know you still have a little bit of energy to listen to us. I think it is a moment, especially for us parliamentarians. This question is for all of us. I want us to, listen to, maybe what I'm going to say is not going to be strange, but it's what all of you have in mind, because as parliamentarians, it is true, one of our oversight, our duty is to control government action, but we also have to understand that the population is also going to hold us accountable for our stewardship towards what we have been doing to them. And this question is actually one of those questions I think we'll be able to determine what we are doing for our populations. For sure, when we were elected, as one of our colleagues earlier said, it was a matter of us having the trust of the people. They gave us their mandate to represent them. And so we are the liaison between the people and the government. We are the voice of the voiceless. We are the ones to be able to take their worries to government and, of course, come back with the answers or with the solutions that their worries may present. Now, coming back to this question about the role of we, the MPs, on maybe preventing HIV/AIDS or inequalities and inequities on HIV/AIDS, I think the first thing I would like to say is that this question can be handled from two angles. First of all, our role, I, as a parliamentarian, who has the people at heart even before I went to parliament. Those people who are suffering are my people. It doesn't mean that if I were not a parliamentarian, I would not have something to do. So the first angle is I, as a person, as one who is coming from the same community where those who are suffering from HIV/AIDS are coming from. And then, of course, on the other angle, I would like to handle it from the point of view of my role as an MP. And so, first of all, I would like to say that for us to be able to go into handling this problem, the first thing is for us, the MPs, to be able to understand the devastating effects of HIV/AIDS. We must get the data. We must get the real facts. It is when we get the real facts, we get this information that makes us see the global devastating effects of HIV/AIDS. That is when we'll be able to have a better position, to argue with our friends, to debate with them, to present the issues to them, to convince them, and then we'll be able to also see how we can form a better group to present these issues to the government for appropriate actions to be taken. So, getting to know about HIV/AIDS, getting to get the facts, to know the facts, and be able to appropriate all of this and to interact with those who are infected or affected is very, very important. That is the first preoccupation, or the first move I think is important for the MP. The second is that the MP has to understand that he or she is a critical leader, and as a critical leader, you have to play the role of an educator. My office, the office I have in my constituency, has to play the role of an information center on HIV and AIDS. The MP should be able to frequently organize sensitization campaigns to end ignorance, myths, and fears about HIV/AIDS. When HIV/AIDS came, when people were dying in Africa, for example, if not all of Africa, but especially in my own community, most people thought it was witchcraft. They didn't believe it was a health issue. They thought it was witchcraft. And because of this ignorance, whenever you brought in the idea of testing or medication, it didn't occur to them that it was important. They said, no, it was witchcraft. So let's go and find out from the soothsayers to know where it is coming from. So the MP, therefore, has to play the role, an important role, to be able to educate the people to clear off this kind of ignorance and fear in them. And that is why our offices in our constituencies are very, very important in this particular role of educating the population. And of course, it is also important that we have to organize campaigns, If you know the facts, if you know what devastating effects HIV is causing. In my area, for example, I was taken aback by the time I got, the details of how many youths of school age who have been killed by HIV/AIDS. I was also devastated by the fact that I realized there were so many orphans, in fact, who were in my community as a result of the deaths of both parents. And all of this had to also affect the community in various forms. Of course, poverty increased, and they also reduced manpower, and some families were even left without anyone to take care of them. And so the effects were so many, and this alone was enough to cause me to move to action. And so it was therefore important for me to organize campaigns. In these campaigns, of course, I had to invite health workers who are experts. I had to also involve religious authorities, traditional authorities, so that all of us will come together and talk to the population, let them know that through medication, HIV can be handled. It was also important for me to make people to understand that In my local in the office in my constituency, we also tried to see how we could discuss on organizing or creating HIV committees. These HIV/AIDS committees, that was where they were able to get information on prevention, testing, and counseling. So I saw that it was also very important, and it yielded a lot of fruits which were there to mitigate the prevalence. Then, now as an MP, what is the role of an MP? We are all MPs. I know we have been playing major roles in our various parliaments. But I think this is just what I want to add to what we already know. It is important, this is what I came to understand later, that we must take this HIV/AIDS issue as a human rights issue. It's very important. That is what I came to understand, because the way many of our populations were abandoned to themselves, the way many of them died because they could not have access to medication due to poverty. Many of them could not have access to the right information, and so many died out of ignorance. That was when I came to understand that it was important for us to know that HIV/AIDS is a human rights issue. And so when we know that it's a human rights issue, it becomes therefore very, very easy for us to frame maybe some policies based on human rights frameworks. So if we have this, it is very easy for us to be able to push some of those new or reformed laws and policies that strengthen HIV prevention and protect those vulnerable to HIV, and of course improve care for those living with or affected with by HIV. And it is also very important that we, the MPs, I remember very well that at one moment in Parliament, we were able to come together, those of us whose areas were most hit by HIV/AIDS. We came together and we created a coalition. And with this coalition, we were able to advocate for adequate budgetary allocations, especially to those areas where the prevalence was more. And we had to work very hard for the government to not just making a global budgetary allocation, but to be specific in some areas where we had data or information that those areas had more vulnerable or more cases of HIV/AIDS. And because of this, it was also important for us to know that at the end of it, when government allocated these funds to the local councils, we were able to follow up, and after about some 2 years of this consistent budgetary allocation to those areas, we carried out another survey, and we saw that the prevalence rate had reduced. And this, of course, called for joy, because the population saw after everything that really they were dying because of lack of medication, they were dying because of ignorance, they were dying because they hadn't the possibility of getting the right information. And so when this happened, that was also an indication that the government had to do more to other areas. And so that is what we have been doing. And because of this, of course, this caused me to also think of creating a kind of caucus in the National Assembly. And this caucus, in order not to, give it a kind of impression where you will not have many MPs come together, this caucus was named a parliamentary caucus on the amelioration of the implementation of SDGs. because all of this we are working towards 2030. And so with this kind of a caucus at the National Assembly, we are able to handle issues of health globally with the Ministry of Public Health and other stakeholders. And we have been able to also work with UN agencies like UNICEF, and with this kind of a coalition, we have been able to go further to get more budgetary or finances to handle some of these health issues. And so at the end of it, we think that it is important that for us to be able to handle this issue of HIV/AIDS, it is a matter of working in partnership. We have also involved civil society organizations. We have been able to also work with schools because we realize that the prevalence among school going age was increasing. So we organized what we call HIV/AIDS clubs at the level of colleges and universities. And we also tried to see how we could provide some kind of motivation in terms of scholarship to those clubs, HIV clubs, that did very well in terms of sensitization of other young people and in terms of creative writing like poems or songs. And so that is how we have been able to move further to the peripheries. And so the issue of HIV/AIDS has gone very far into the suburbs, even up to the kindergarten, because you'll find that kindergarten children are also very much interested. You know, once you create some kind of this thing, when you listen to them sing some songs about HIV/AIDS, you begin to wonder. But then it is important they start getting this information from that early age. And some of them will tell you it is not good to use a blade that another person has used. It's not good to do this, do that, do that, do that. Those common things that they say play with. Don't use objects that can pierce you and so on and so forth. You see, this kind of knowledge, even at that level, is very, very important. And so we have been able to do all of this in collaboration with, of course, like I said earlier, traditional authorities, religious authorities, civil society, NGOs, and UN agencies. And so I think, dear colleagues, it is time for us to be able to come together. This forum, I want to thank Unite very much for this very important forum where we have been able to learn more about how it is important to unite in order to handle salient issues concerning health. And I think I personally have been able to learn a lot from here, and I'll be going back more fortified because I know I'm going to get many addresses from here, and with these addresses we'll be able to communicate. And why not think that the next summit, Unite Summit, should take place in my country, Cameroon. Thank you all very much for your kind attention.
Thank you very much. That was, I think, a really inspiring intervention and overview of what you've been doing locally in Cameroon, and also highlighting the barriers to developing some of these effective policies, either lack of education or access to information on the parliamentarian side, but then also highlighting the human cost for not having adequate government interventions. And so how early education of young people and innovative solutions are really important to tackling. Okay, we're back. So we just have a very short amount of time, but I would like to, we just, very short amount of time, so just maybe 5 minutes total. I will just get a couple questions or comments from the audience, and then we will quickly transition to our next session with the World Health Organization. So I can start with number 1, number 2, number 3, and then I think that will be it. Thank you. please.
Hola, muchas gracias.
Okay. We have to learn from the HIV. Espero só um bocadinho. E já agora desligue, agradeço que desliguem os outros microfones e deixem só ligado o microfone da senhora que está a fazer a pergunta. Porque senão estamos a ouvir uma barulheira na parte dos outros microfones que estão ligados. Muito obrigado. Pode prosseguir. Can we learn lessons from the HIV epidemic to develop the future treaty for the pandemics? Drawing lessons from the HIV pandemic, that is.
Question was, can we learn lessons from the HIV pandemic to address the COVID-19 pandemic? And so I will open this up to either, or perhaps to Honorable Najimbi first, and then.
Sorry?
Should we take the questions first? Okay, we do this way, yeah. So then please, we can get you a second, yeah. Thank you.
Yo quiero ver si una pregunta.
One question. If the gender ideology that is present in the current parliamentary debate, and as this ideology led to an increase of HIV, because our parliamentarians say this is very present.
Could you repeat the question, please?
In the parliamentary debate, a lot of countries in the world, the ideology of gender is very present. My question is if this gender ideology has had an effect in the increase of HIV.
Excellent, thank you so much. And then our final comment, please.
Thank you so much. Even in the morning, I heard of how the infection has been like on increase, But I just have a question. What role are the parliamentarians playing together with UNAIDS in order to start reducing this increase in numbers? Because I've noticed that the ones who are getting infected every day is the young ones. So I'm failing really to understand how the young ones are being infected. So what role can the members of parliament play in order to reduce this infection that is like on the increase? From the look of things, we're not going to achieve the zero infection rate that we're looking at by 2030. Thank you.
We will take the two additional hands and just quick interventions, please.
Okay, thank you very much. And if you allow it, I'm going to speak in French.
Thank you for having brought up this issue of HIV/AIDS to our debate. As a French parliamentarian, I led a study group on AIDS for 5 years at our parliament. So from what I heard and from what the colleague from Cameroon said, there are quite a few things that are true. So maybe if you let me add the following, I think that in order to meet this challenge of equality and the response we should give to HIV/AIDS, we should also take into account the role of community associations and other local agents in the societies, since their modus operandi, namely screening and prevention, is key to fight AIDS. So we should act together in order to demedicalize this process. We have started this reflection already in France, and our strength, our capacity to be heard on these matters depends on the ability. We have to make this a common challenge.
Thank you. Was there one more comment from the floor? From over here? No? Okay, now I think, sorry, I thought there was two over here, but I think I must cap it on the questions just for the sake of time. I apologize. So so we have a few questions here. The first, for lessons from the HIV pandemic, can this be applied to the COVID pandemic? Matthew, would you like to answer this one?
Sure, I'd be glad to. Thanks for that really helpful and interesting question. And look, right now, the world is debating a pandemics treaty, right? And it's also debating how best to finance pandemics overall. And there are several really big, important lessons from the HIV response when it comes to fighting other pandemics. The first is that you have to ensure that there's equity. The fact that we've moved through the COVID-19 pandemic and we've ended up with such huge inequity when it comes to access to vaccines is a huge problem. It should be a major warning sign that the world is not prepared to be able to tackle pandemics so long as some have access and some do not. The decisions that were made around who had access to COVID-19 vaccines ensured that the pandemic has continued the way it has and the length that it has. And there are other alternatives to ensuring that there is a monopoly by a handful of companies over the knowledge to make vaccines or to make HIV drugs. What we had done in HIV, after 12 million people died on the continent of Africa without access to HIV treatment after it was introduced because it was simply too expensive and it wasn't available. What we were able to do was to say all HIV treatments need to be available generically. We need to be able to produce them in Africa, Asia, and Latin America. That means we remove the intellectual property rules, but it also means we set up manufacturing capacities around the world to make sure that there's no one maker of any given product. And that has been a really essential piece of the pie when it comes to ensuring that we succeed in HIV. And we haven't seen that kind of move in COVID-19. Looking forward, we could say that in a pandemic, every country needs to share its technology, needs to share the know-how and the intellectual property when it comes to making a vaccine or making a test or making a treatment for a pandemic disease. Second lesson for us is really that criminalization doesn't work. We've seen this in HIV, that actually the imposition of criminal law as a way to change people's behavior is a pretty ineffective way to change behavior. And what it does do is it drives people away from services. It makes people distrust the state. It makes people distrust and move away. And so in a moment of pandemic crisis, using the police and the law should be the last resort. And instead, we should focus on removing those criminal laws and giving public health responses where we need it. And the third really key lesson for us is that you need really good data when it comes to equity. We have seen in pandemics again and again, whether it is gay men and men who have sex with men in the HIV response, or people who inject drugs, or sex workers, that where we don't have data, we're not able to respond. We don't see the inequalities. But look, the same thing has happened on COVID-19. We can look at really effective responses like that in Singapore, and yet there was an outbreak when migrant workers weren't counted, weren't part of that data response. And so funding that, ensuring that that's a key piece of what we're doing are three really core pieces that we need to do pandemic response. And all three of them could be part of a really clear pandemic push. And then the final point that I will just pick up on Honorable Mbeye, who was saying just now, is that this piece around community-led responses is key. Not just the state in communities, but actually communities themselves providing services, authorized to do so and funded to do so, is a critical element of pandemic preparedness. And we often neglect it because we want to make shiny, beautiful labs, which are also important, but we neglect some of these community-based organizations that are our best first-line defense when it comes to responding to a pandemic. Thanks.
Matthew, for those important words and lessons learned, I think that are very applicable to the HIV pandemic now. So just, I will turn the final word over to Honorable Njumbe. If you just very quickly would like to touch on perhaps what our colleague from France said about the need and the challenge of all the societies to working together, and perhaps it can also be folded in to the other question on infection is being increased with the young and how parliamentarians can address this increased infection rate with young people and actors working together, if yes, very quickly.
Yeah, thank you very much, Victoria. My dear colleague, I think that if the infection is increasing, I will say it's definitely because much still has to be done. In the area of information, in the area of distributing the antiretroviral drugs, in the area of counseling, in the area of sensitization, and so on and so forth. And so I think we therefore simply need to increase our partnership with others in order to be able to move ahead. It is not something for us to fold our arms and wait for others to move on, but rather we are to be on the front line. I think that is just what I have to say about that. We just have to go back to the drawing board and see what was to be done and was not done, and then we try as much as possible to see how we can cause it done. To my colleague from France, I think yes, what you have said is very true. I think for us to be able to fight against HIV/AIDS, everyone is called on board. Everyone is called on board. No one has to be left out. We are all involved, be it community, especially in the communities. If we involve the communities and we make them to understand the effects of the pandemic, I tell you, they will appropriate it and they themselves will be able to be on the front line. I have experienced it, and they are so interested. They themselves are now the ones. We gave them local training, of course. Those in the communities were given some local training by some experts, and they themselves are now moving around to educate others. So it's something that I think everyone is called upon. All of us are to be involved. I think that is all what I have to say for now. Let's just go back and see what we have to do, involve everyone. And what has not been done, let us see that it is done. And what has to be done, let us ensure it is done.
Thank you very much. I think that's a great note to end on. And so I must, or I will bring this fireside chat and session to a close. So I thank you again, Matthew Cavanaugh from UNAIDS, Honorable Njumbe from Cameroon, and we will transition now to our next session right away with the WHO. So could I please ask Elisa and Letizia to the floor? Thank you very much.
Thank you.
It is now my pleasure to introduce our next session supported and with the World Health Organization. So this year, UNITE signed a very important memorandum of understanding with the World Health Organization to support the work of parliamentarians in global health. And so this session will present the main goals of this agreement, along with a presentation on the UN high-level meetings that will be held in 2023. So we have two colleagues here from the World Health Organization. The first is Elisa Scolaro, External Relations Officer for Parliamentary Engagement, and then Leticia Bosio, Program Manager for Policy, Advocacy, and Partnerships within the UHC 2030 core team. So to first present this afternoon is Elisa, so please feel invited. Thank you.
I think I should have some slides, right? They will come. Okay. Yeah, I start with greetings, distinguished members of parliament, dear colleagues, Ricardo. I'm very honored to be here in representation of the World Health Organization, together with my colleague Leticia Bosio from UHC 2030. In WHO, I cover parliamentary affairs, so I'm the person in charge of parliamentary affairs for the organization based in headquarters in Geneva. First of all, I send the greetings by Dr. Tedros, who unfortunately could not be here today because of pre-existing commitments. But as you heard from the message this morning, is very committed to work with UNITE, and especially after the signature of the MOU. The purpose of this presentation is really to give you an overview of how WHO works with Parliament, which is something relatively new, at least in a systematic way, and to provide you an overview on what we have set as framework of collaboration with UNITE, and in a way to collect your inputs. We already got a lot of inputs today, because we will be working in the next month and a half to define a work plan for the next 2 years. So it's very useful for us to be in this listening mood, I would say, today, just to hear all your comments and be sure that then this is reflected in the plan of activity concretely. And as part of the 2023 year, there will be the 3 high-level meetings on health, and my colleague Leticia will give you the details. I like to start always with somehow the words of WHO itself, which is the WHO Constitution, because I couldn't describe better than what Ilona said this morning about the opportunity we have now as WHO to work with Parliament, and for parliamentarians to work with WHO. I think you made it super clear. I said I can even skip my presentation tonight because you really made the case. I say it sincerely. But I think everything is really in the preamble of WHO, and I think none of these actions could be concretely realized in countries without the actions in terms of legislation, advocacy, accountability, and budget allocation that are core functions of parliamentarians. And this is in line with what we call the 3 billion goals of WHO, which is somehow our strategy until 2023 that will be updated, which has as goal promoting health, keep the world safe, and serve the vulnerable. I'd like to give you an overview on somehow the journey that led us to where we are now. And because I would say WHO finally realized that we should work with parliaments, we should do it in a systematic way, but it was a long path, because I can't hide that we had even some member states telling us we shouldn't work, WHO should not work with parliaments because the natural counterpart of WHO should be the Ministry of Health, which is really, surprising. And even within the WHO culture, we have to generate somehow the knowledge on how to work with parliamentarians and the benefits that we could have. It's a long journey. And we started, I would say, more than 10 years ago in 2009. I see colleagues here from UNAIDS, the Global Fund. We started together at the time when the Interparliamentary Union, which is the global alliance of parliamentarians, started working on health with a working group on sexual reproductive rights, and we pushed so much to expand the mandate and to move from sexual reproductive rights to women, children, and adolescents, and then to global health. So it was somehow a path. And we had to measure, I would say, milestones within the IPU, because we had two important resolutions, one in 2012, then updated in 2015, which was a global resolution on women and children health, then women, children, and adolescent health, in line with the global strategy for women, children, and adolescent health, and then later on in 2019 on universal health coverage. And somehow made the case how also this kind of normative parliamentary global tools should be supported by the evidence or by the work of WHO and how we can work hand in hand. That proved somehow that this could be the right approach. But then within WHO itself, we had what we call a paradigm shift, because we realized this was important, and nobody can deny that Dr. Tedros really, because of his experience as parliamentarians, because of his vision, because his new strategic approach to WHO, he changed totally our vision about parliamentary affairs. I told him one day, you made my day, because in a day, he really gave me like all the opportunities to shape a new program of engagement with parliamentarians within WHO. So within the new Department of Health and Multilateral Partnership, now we do have a portfolio for parliamentary engagement that was shaped. Already in 2017, Dr. Tedros hosted the first technical briefing at the World Health Assembly for parliamentarians specifically, and committed to organize this on a regular basis. And then in the call for nomination to attend the World Health Assembly, there's now a clear call or encouragement to include parliamentarians into the delegation. So if your Ministry of Health don't tell you that, that's something we have done, and we keep somehow repeating. And then the change happened, of course, during COVID, because during COVID we started receiving a lot of requests by national parliaments who wanted to have guidance from WHO, wanted to have technical support, wanted also to WHO support and technical support to keep government accountable for the commitment, for the information they didn't have. And we realized that we didn't have a consistent strategic approach to this kind of request. So the organization was not prepared to respond at each level of the organization, from the country office X to the headquarters, to this kind of request in a consistent way. So we had to create a new totally internal policy to have an assessment of this request, and then to request in a consistent way, to provide in line, of course, with the legal guidance of WHO, but to support parliamentarians in this process. And then we identified the priorities for WHO engagement with parliaments in this first phase. And they were identified and were universal coverage, global health security already before the COVID pandemic. And then we retained, of course, the attention to the health promotion with a focus on vulnerable group, with a focus on women, children, adolescent health, reproductive, sexual, and rights. And we somehow, after COVID, we identified two emerging priorities, now totally emerged, which are the pandemic treaty and the sustainable financing for global health. It's really to recap, but for us it's important even the definition of the goal, why we have to do this, because we had to somehow even train our own staff, and it's really to position health at the core of parliamentary agenda, to increase the political commitment, to increase the financial investment in health, and to step up WHO leadership in global diplomacy with the overall goal of really bridging the gap between science and policy makers. And we work at the 3 levels of the organization in a more or less systematic way, because again, it's a process. At the global level, I already mentioned, we work with the Interparliamentary Union, because it's a global alliance of parliaments. And then we work at the regional level. At the regional level, we work with existing parliamentary network. We have agreement with the Pan-African Parliament. We have agreement with the South American regional parliaments. We have collaboration with the European Parliament on a regular basis. I see colleagues from the Parliamentary Assembly of the Council of Europe, where we have ongoing technical collaboration, and we would like to move towards a more systematic collaboration. But also we had some region like the Western Pacific or the Middle East region where we didn't have existing parliamentary platform working on health. And so together with our regional offices, we created a new network of parliamentarians. And we have one running in the West Pacific region already for 6 years. And the 3rd level is country level. And that is really upon request by national parliaments, where we can provide technical support, assistance as needed. And then at the bottom of this slide, we included this global network of parliamentarians, and of course, UNITE is our main focus, and I will go into the details. Here, I just wanted to mention a couple of milestones that for us are extremely relevant. Dr. Tedros announced the creation of the first ever WHO engagement strategy for parliamentarians, and this is something that never exists for WHO, as there was not an internal program for WHO. Then an important milestone for us was the recent World Health Summit, which was held in Berlin, where we worked together with parliaments, with partners, including UNITE, and we brought parliamentarians from more than 35 countries, and in collaboration also with the Bundestag in Berlin. We somehow, I would say, proved how relevant it is to include the voice of parliamentarians in these key global health fora. And there was a very interesting discussion on the pandemic treaty, but also on sustainable financing and on peace for health. And then that's where also Dr. Tedros launched for us a major initiative for the next years, which is the creation of a global network of chairs of health committees. So we had a first informal discussion, and UNITE was part of this discussion with members from the board on the purpose of this group, the terms of reference, the timeline. So this is an ongoing process. We just kick off, but there will be an ongoing process of consultation where we would like really to engage UNITE. And then, as I mentioned before, 2 important priorities for the next future: the mobilization of parliamentarians around the pandemic treaty. Of course, we heard a lot about this today, and then on sustainable financing. Here, we just try to somehow summarize, and I won't go into the details because we have 3 days, happy to have this bilaterally, and then of course opportunities within UNITE's collaboration. It's really how we want to work with parliamentarians. So in terms of governance, as I said, we didn't have a structure. This was an important step for us, the creation of a new strategy. Now we do have an office in Geneva that is collaborating with the 6 WHO regions on parliamentary engagement. In terms of process, is really to create, as we did for COVID-19, a system to respond to parliamentary requests coming from national parliaments, which didn't exist before. And then the participation is the typical example I provide you about the World Health Summit, so facilitate the engagement of parliamentarians in contexts like the World Health Assembly or other international fora. Evidence is key. What I mentioned could be framed as the overall goal, so provide parliamentarians with the technical information, the scientific evidence, providing with the tools that sometimes are even difficult to be identified. And then the external, internal capacity building. We have the full availability. We have done this already for many years, and we'll be happy to start doing this with UNITE as well. Organize capacity building activities for national parliaments or regional parliaments on specific technical topics. And on the other hand, we are moving towards increasing the capacity of WHO staff to work with parliamentarians. Technical collaboration already mentioned, advocacy will be key, and then resources. We keep receiving the requests, we don't find the tools. WHO language is not something that can be easily translated into policy. We need to have that kind of translator in between, and that's a core part of our activity. And then we move to October, when we signed this MOU between UNITE and WHO at the World Health Summit. It was a key moment for us, and the setting and the context was extremely important because it was somehow a message. We are available to work together. This is what we can do together, and the kind of benefit that we can bring to the global health dialogue. The area that we have identified in terms of collaboration are equitable access to health. And again, my colleague Letizia will go we will contribute to the summit agenda in 2 days with a session on universal health coverage, but this will be a core component of our work plan. Health system strengthening, and this is very much linked to the decision, of course, of the 75 World Health Assembly, where there was a decision of increasing WHO budget. But again, nothing of this could happen if then the decision is not implemented at the country level, and those who implemented that decision are parliamentarians. And the third piece is, of course, on global health architecture, all the discussion you had today about the pandemic treaty. We are in the process, we signed the MOU, and now, as I mentioned at the beginning, is to develop a detailed work plan covering the next couple of years. I was really in a listening mode today because we had all the conversation, the discussion about the pandemic treaty, and I keep hearing WHO doesn't listen, WHO doesn't engage us, we are not heard. And I was saying, we are here. We just signed an MOU, and the purpose, the overall purpose of this MOU is really to create a framework, a plan on how this can be done. And it shouldn't be a decision by WHO Secretariat or by UNITE Secretariat. I think we need to collect your inputs. We need to hear from you what the expectations are, and then it will be our job to understand what's feasible within, of course, the context we have, and creating somehow a plan for activities. And I like to recall that, for example, in the case of the pandemic treaty, this is not WHO still led, but this is a member states, and parliament are not living on Mars. They are not on a separate, planet, but you are part of your country system together with civil society. So it's really your task to be sure that the government is listening to you, keeping accountable for the commitment taken, and what we can do as WHO, together with partners like UNITE, is to facilitate this dialogue, is to inform you, to be sure that you are aware of the process when this doesn't happen at country level, because we know that most of the time you get with an agreement to be ratified without being engaged up front. So we are here to create somehow this opportunity for all of us to work together and to listen from you on what the expectations are and to shape a plan to work together. This is what I wanted to say. Happy again, we are available these 3 days for any kind of bilateral discussion. And then I would move to Leticia, because we do have concretely this opportunity of the 3 high-level meetings. And sometimes these happen on different tracks, and again, parliamentarians are not brought in. So this is a concrete example on how we can work together to be sure that you are engaged. So over to Leticia. Thank you very much.
Do you want to take your laptop back? So I can read my notes instead of yours. And how does... All right. Good evening, everyone, and congratulations. You almost made it through the first day. And that's quite something. It was a very busy and rich day. So I'm no politician, but I've learned from experience that a good meeting comes with managing expectations. And if there is something I must say is that I'm going to talk about processes with a lot of you in acronyms, and I can't say that is the most exciting presentation you're going to hear in your life. So here, your expectations have been managed. So coming to 2023, what is exciting for health is that we are heading into a year with 3 high-level meetings on health. One is on universal health coverage, the other one on pandemic prevention, preparedness and response, and the last one is on tuberculosis. So UN jargon for you here, HLM stands from high-level meeting, UHC is universal health coverage, and you follow the drift, PPPR and TB and all this, we love that things. So it is very busy, and I must say, as a former diplomat from the French mission in New York, that would scare me, because that means so many days and nights of negotiations coming up to September 2023 with political agreements. So that's not going to be an easy year in any way. And that's not even the rest of it. Even in the future years, but also in the past years, there have been so many more high-level meetings on health. And I think in terms of the global health community, this is good news, because it means that head of states coming to New York care about global health. Just to name a few, we had road safety this year, we're gonna have NCDs in 2025, HIV in 2026, and so on and so forth. So just to give you a little bit of a sense of how these things work concretely, because these processes tend to be complex but also opaque and not necessarily easy to access for an outsider perspective. So in terms of the recap, the decision to host the high-level meeting on universal health coverage was taken as early as 2019 in the political declaration during actually the first ever summit on universal health coverage. Very recently, the President of the General Assembly appointed the co-facilitators. So this is going to be an intergovernmental process that is going to be preferably by consensus presenting a political declaration to the General Assembly. And so that's going to be Thailand and Guyana trying to ensure consensus is reached. The modalities resolution was already adopted, and it asks for a concise and action-oriented political declaration. And the multi-stakeholder hearing is also already agreed on. It should take place sometimes before June 2023. And this is something that the President of the General Assembly organizes and presides over. And then the summary of discussion is used as one of the inputs going into the draft political declaration to then be negotiated by member states. About PPPR, the high level on, you get that, we know a lot less. As of today, what we know is that a resolution was adopted, that member states decided to hold a one-day high-level meeting, that they want to adopt a succinct political declaration, and that they have co-facilitators now, Israel and Morocco. But we don't have detailed modalities just yet. So this is still to come. About tuberculosis, about the same thing. As early as 2018, in the previous political declaration, it was decided to hold a comprehensive review at a high-level meeting in 2023. They want to usually always review progress on commitments made in the political declaration. They recently got their co-facilitators as well, that's Poland and Uzbekistan, and they don't have further modalities resolution yet. So stay tuned, more on that later. In terms of entry points for engagement, fundamentally, multi-stakeholder hearings are kind of the common place where partners can come to the UN and share their position. And that is open to civil society and many stakeholders that have observer status with ECOSOC and are registered. So there is a process, of course, but it's by and large the first and primary entry point into this summary document that is going to be then going to the larger negotiating parties. And then the one on universal health coverage, as I said, is already agreed upon. We don't know about PPPR and TB, but given it's kind of common practice, we expect that they will also host one. In terms of the political declaration and the outcome document, as mentioned, this is going to be an intergovernmental process. So this is basically member states negotiating, and the entry points in that case will be the diplomats in the New York missions, who usually receive the instructions from the Ministry of Foreign Affairs. As you know, in this particular case, they usually coordinate with the Ministry of Health or not, it really depends, and with missions in Geneva or not. The reason being that the representative from the Ministry of Foreign Affairs in New York are rarely experts on health topics because traditionally health topics are handled in Geneva. And it's only in the recent years that the health topics came to New York so many more times, and therefore this cooperation between different negotiators is actually useful. But of course, this is at the discretion of member states. So here you can see that as WHO, we are a technical agency providing technical support, so not party to the negotiations. But what we could hope for is that we end up with connected, coherent, and complementary messages and commitments. And this is because all of these high-level meetings taken together are supposed to bring us closer to health for all. So what you see here is the pyramid that reflects the ultimate mission of WHO, which is health for all, and how we suggest we get there. And basically, from the foundation on primary healthcare to the means, which is really to strengthen health systems, we believe that these foundations and means will actually address and bring us closer to those goals at once: universal health coverage, PPPR, TB, and so many other disease-specific targets that are part of the SDGs. So for us, we start with PHC, with primary healthcare and strengthening health systems. And so again, as WHO, we can only hope that member states will try to establish strong connections between these three HLMs, rallying around a common narrative and focusing on one national health system in each country, with the objective of delivering health for all. So we do see this agenda as busy and crowded, but we also see it as a unique opportunity for member states to develop this coherent and complementary agenda across those high-level meetings. And what we would like to see are actions and investments that are basically the necessary elements that we need to recover from the COVID-19 pandemic and to achieve health for all and the SDG agenda by 2023. By 2030, sorry, 2023 for the health summits. And that's it for me. Thank you very much.
Yeah, I think you can handle it. So thank you both very much, especially for providing that informative overview, and I think underlining how the WHO will be an important partner and stakeholder for parliamentarians and for UNITE in advocating for the global health agenda with the member states. So I will now open up the floor for some comments or questions to the panel. Yes, we'll begin first in the middle, and then we'll turn to you. Please.
Thank you very much. I sincerely wish to commend again Ricardo and WHO for this great progress. My issue is it's good that there's going to be, a development of a 2-year plan. I think what would be also very beneficial for us as parliamentarians is to have in-country initiatives and activities depending on the timeline of the respective countries. For example, right now in Tanzania, we've been debating on the UHC bill. And sometimes, you want to do advocacy and bring on board your fellow parliamentarians, but to do that, you need resources, and more so, not necessarily just financial resources of putting together the meetings, but also the technical support to be able to bring on board your colleagues to where you are so that, when the bill is in Parliament, we can be able to advise the government to have the best bill possible. So I would like to just find out what are the prospects of having such interventions in the 2-year plan. Thank you.
Thank you. We can collect all the questions first and then hand over to the panelists. So perhaps you would like to get the translation. I think you will ask in Spanish.
Gracias.
Thank you. First and foremost, I'd like to congratulate you for your presentations. Were very clear, transparent. And one of the questions that I made today has already been answered. There has been a change in the vision of WHO regarding parliamentarians and how it is planned, their participation. Now, we are, for many years, as MPs, involved in different areas of health, namely fighting TB. And there have been recent TB events where parliamentarians did not participate. So my question is, how can I participate in events through friends, with other parliamentarians that invite me, and not on behalf of my parliament? I think it should be the way to participate in these events, representing our respective parliaments and not at on a personal basis. So I think it's important to know how can parliamentarians participate, not at a personal level, but representing their countries and their parliaments. But the most important thing I'd like to stress is this change in attitude from the WHO vis-à-vis parliamentarians. The agreement between the WHO and UNITE is very important, but I think that we are still missing here a pillar, the legislative pillar, the official pillar, so to speak, so that the parliamentarians that participate in an event, a debate of this type, should be representing their national parliaments and not be there at personal level, on a personal capacity.
Much for the comment and question. Yes, please, Jorge.
Voy a hablar en español.
I will speak in Spanish as well. Thank you for the presentations. I like the idea that this is not a process of the WHO, but of the member states, the treaty, the pandemics treaty that we are discussing here. But the original ideas, they did not come from the member states, although they are discussing them now. It was an idea that came from several people, a lot of us, actors, members, but it did come from the civil society and main universities, academy, but the WHO brought this to the member states, and when the Omicron was discovered, the next day, the member states said then that this would be a good idea. So it seems that it was the fear of a new variant that ultimately was not so complicated, but it was the fear that made the states to come to an agreement and say that they wanted to work towards this treaty. But when fear passed, the will to invest time and resources diminishes. Nevertheless, the presentation of this zero draft, conceptual zero draft, is a good initiative, and we have signed a petition signed by many non-state actors, including parliamentarians and civil society stakeholders, where we stress this effort of the INB, and we just wanted some things to be more specific, such as the principle of transparency, that now it's practically on a voluntary basis. And we think it should be something mandatory transparency. And if a powerful government says that they do not agree, that transparency should not be rewarded, well, most of us think it should be rewarded. Otherwise, countries like South Africa or Botswana will not be transparent again and say that they have discovered Omicron, so that next day all flights will be cancelled and they are left isolated. So transparency should be rewarded, and mainly for those countries who want to be protected against this type of measures. Otherwise, they will no longer be as transparent. I mean, if they fear the consequences of this transparency. So in the letter we have, or in the petition we have sent, we want this transparency to be enhanced. In the accountability also, we want it to be enhanced, as Barbara already said. And we insist that please involve the non-state actors, civil society, parliamentarians, academics in the process. Because if we are just to be consulted, and when we are facing pandemics, we are supposed to be there in the front line. We have to be involved from the beginning in these processes. And that's also why we have sent this petition. Thank you.
Yes, Ricardo, please.
Thank you very much. I'd also like to thank the WHO and particularly to Elisa publicly, because your leadership was extremely important for UNITE to be able to establish this groundbreaking MOU of partnership between our two organizations. And I think it's only fair to acknowledge this publicly here at our summit. And we're very grateful that we will be able to work together in this long journey that you have led since 2009. And I think there are some important messages that are coming out from this meeting, as you said. And of course, the role of civil society being more than just heard, but also to have a participatory role is something that I think we all agree upon as critical. What I can say, though, is that I feel that the importance of transparency and accountability, especially when we're talking about the pandemic treaty, as Barbara was talking earlier today and Jorge mentioned just now, I want to underscore that in all the conversations we've had with WHO, this has also been a core element. And the issue here is finding the right mechanisms and frameworks to fulfill these important needs that are acknowledged as absolutely necessary if we are going to achieve a treaty that achieves its goals of being able to detect outbreaks early on before they become pandemics, and to be better prepared if a pandemic does fall upon us once again, as it may possibly happen even within our lifetimes. And so parliamentarians, I would say, have an extremely important role in this discussion, because sometimes governmental officials may just go with the flow. And if that is the case, we as parliamentarians, as civil society in a way, at the end of the day, parliamentarians represent directly the people, we are the ones that need to step up and keep governments accountable. We need to make sure that science is put at the core of all of these discussions, that the mechanisms are created to make sure that we keep our people, the people we represent, safe in the future. And we learn the lessons that need to be learned, and that we put science and technology to the service of the people. And so this is a commitment that out of this MOU comes out from UNITE's collaboration with our partners and of course with WHO. And also, since UHC 2030 is here, you have a lot of work in 2023. You have a lot of work ahead of you. Of course, you have collaborating partners like UNITE you can count on to support you. I also want to say we're going to discuss more on UHC specifically and health as a human right on day 3 of the summit. But it's very important, especially looking at how richer countries have created health systems that are more reactive to disease instead of focusing on health and well-being, that low and middle income countries can learn the lessons and can leapfrog and use UHC not to repeat mistakes, but actually to go that extra mile, focusing precisely on prevention and primary care, as was mentioned here, but doing it in a way that primary care and prevention and public health measures are not put as a side gig of health systems, but as an integrated and core element of health systems. And this is something also, once again, that we need to provide the knowledge and the tools to parliamentarians so they can advocate in their own parliaments to push for these agendas. And some of these issues are very hard. They're very technical. You know, 80% of the Portuguese parliament where we are sitting is run by lawyers. And it's never good to be surrounded by lawyers, but that's my daily my daily life here in Parliament. And, you know, they are very efficient in making laws, but many times they don't have the technical backing needed for very complex technical issues when it comes to global health challenges as the ones we are facing. And so I believe that different partners, including WHO and UHC 2030, can actually provide those tools. It's not a question, Victoria, sorry, but I felt that it was an important comment given the discussion. Thank you.
Thank you, Ricardo. No, I think that was a really important, and it touched on, I think, a few of the other comments and concerns, so thank you very much for the intervention. I actually was secretly going to ask if you wanted to intervene anyway, so thank you. Then I will just I will turn over to Leticia and Elisa, give you each the final word, if you would like to, elaborate on any of the comments and close out this session.
Yeah, thank you. Thank you, actually. Maybe I start and then...
Yes, yeah, go away.
Thank you for your comments. That's the kind of conversation we love to have with you. Thanks, Ricardo, for your words. It's absolutely mutual for us. And for us, it was important to be here today, actually, to have a better understanding of the kind of community you do have and the kind of opportunity we have. And you already made a clear point, for example, of concrete activities can be done in the area of UHC, and of course, Leticia will elaborate, and then we have the day after tomorrow where we can provide, example, the country studies that we do, and we can better elaborate on that. But you made an important point also, for example, as related to the pandemic treaty, because we're speaking about all the development part, the contribution, but then there's all the second half, which is the accountability, which is first the ratification process, and then all the accountability. So it's not, we don't finish our job when we will have a pandemic treaty, but that's where another critical role for parliamentarians starts, which is really keeping them accountable, the government, for that commitment. And I think we need already to envisage in our work plan that part. And then as related the question by Tanzania, this is the kind of work we do with national parliaments. That's where we have, I would say, the longest term experience, because upon request of national parliaments, we can provide the support needed even in the drafting process of a piece of legislation. We can co-organize capacity building for parliamentarians. We can even somehow expand the work. We did it many times in the same region or sub-region. We can organize capacity building for more than one country with a leading country that, for example, is working on that specific legislation. And that can happen bilaterally. WHO and the country with the support of the country office, but we can do that kind of activity even in collaboration or jointly with organizations like UNITE, so that we use the example of a specific parliament then to duplicate that exercise in others. That's, I would say, the most fruitful way of running that kind of activities. Then there was the question about the representation. And I think we have different scenarios because we have different organizations. I totally got your point of being somehow entitled to represent your own position or represent your parliaments, but there are different organizations like UNITE, and you all correct me if I am wrong. It's a network of parliamentarians who are particularly interests or experts in certain areas, and they can bring their expertise and they can become champions vis-a-vis their national parliaments. And that's where I think that personal capacity can help. But then there are other organizations or other contexts, like for example the IPU, where you are nominated and mandated by your national parliaments to represent the voice of your national parliaments, and there should be all a process of consultation where you do not represent your vision, but your parliament. The next step is what we want to do at the World Health Assembly, because at the World Health Assembly, we would like to have participation of parliamentarians not in their individual capacity, but as nominated by the national parliament in collaboration with the Ministry of Health, which is even a step forward. It's a process we started, as I mentioned in my presentation, we are encouraging towards that. And then there was the question about the civil society engagement and, of course, the civil society-led initiative, even related to the pandemic treaty. I just said one immediate reaction, because I'm concretely now thinking, as Barbara said during her presentation, what we can do now. And we already had this conversation. It's not at all the ideal way of engagement with civil society. For WHO, there's a lot of improvements to be done. I think we are in the right direction as compared to the past, and the same is happening for parliamentarians, but it's of course not the ideal scenario. My approach now is what we can do better. And of course, there are already the channel through the IMB, vis-a-vis the IMB, vis-a-vis the WHO directly, which are not perfect, but still it's an opportunity, and you are already contributing to that. But let's look, for example, at the opportunity that we have with UNITE, because the idea, as we mentioned before, is to have like a work plan where we set a plan not only of consultation, but really of engagement, which could not be only vis-a-vis IMB or vis-a-vis the WHO, but vis-a-vis the national government. And now that can happen. Now we can create some activities at country level, at regional level, that would be even more successful, where we engage the civil society as well. More than open to have that kind of conversation, to have this reflected in the work plan. I think we have this opportunity. I think it's something where we are in a moment where we can't keep saying we should do better, but we should use the opportunities that we have. And this is a new one that we have, so let's try to work together. And I think an added value of a platform like UNITE is that you are already, as civil society, fully engaged in the dialogue with parliamentarians. We don't need to create the system. So happy to see how that can facilitate, the dialogue, civil society towards parliamentarian, parliamentarian towards government, and then with WHO facilitating that. That's a little bit the process that I would envisage. Not ideal, not happens in a day, but I would say that we are all moving in the same direction. Laetitia, over to you. Sorry, I took too much time.
Just very briefly, to complement a couple of ideas vis-a-vis the questions that were asked. I'm going to start with TB and then move to universal health coverage. On TB, I'm not a TB expert, and I'm not part of this particular process. However, from my experience, both as a diplomat and from the UN side, engagement is relevant when it comes early. So I would encourage everyone to identify your entry points as early as possible in any of the processes that you wish to influence. And as Elisa very rightly mentioned, there are different formats according to the process and to the organization. Tomorrow, of course, you'll have the opportunity to discuss also with Lucica, who's not here today yet, with SubTB, and they are a fantastic entry point into this process. But also another thing that, as I'm a former staff of UNAIDS, by the way, and I also coordinated a high-level meeting for UNAIDS in 2016. And so, for example, we had MPs visits. So we would get delegations of MPs coming to UNAIDS, and we would discuss their views and the process. We would brief them directly. So I would say that on specific topics that you're interested in, you could also request some visits and put together a delegation, and then really come as your official function. So that was on TB. On UHC, to address Nima's point, and on Tanzania, we had the chance to actually discuss already at the World Health Summit in Berlin. And it's true that I'm just going to advertise a little bit what we do. So as UHC 2030, we have developed a parliamentarian guide, which I will speak more about on Wednesday. And actually, Nima, please come, because she will discuss the UHC bill on Tanzania, because we are presenting 3 case studies, country case studies on Wednesday. So, which brings me to my last point to complement what Ricardo was saying. I don't believe actually that richer countries fare necessarily better on universal health coverage, and I'm not going to name names, but I am convinced. Thank you. You read my mind, but I did not say it. I'm not going to lose my job at WHO. There are very rich countries that don't fare that well on universal health coverage, and on the other end, there are low and middle income countries that actually have amazing steps towards progressive universal health coverage. And so again, come on Wednesday, please. We're going to have a great session with country case studies at UHC 2030. We have a few onlines already. There is so much you can learn from each other. And I think this is why I look forward so much to the discussions on Wednesday, because countries from all over the globe are going to be sharing their experience as parliamentarians in moving this forward. And for sure, starting with investing in equitable and resilient health systems, and with primary healthcare as a foundation is definitely the way to get to delivering health for all and the right to health. Thank you.
All right, thank you both so much. And so we will close the session, and we also will close for the evening. So we did normally have scheduled another or a regional dialogue, but given our very fortunate problem of having very in-depth discussions and engaging sessions today, we decided that we will instead move the regional dialogue to tomorrow and combine it with the other one scheduled at 3:45. So thank you so much for everyone on behalf of Unite. This was a really great first day, and so we look forward to seeing you back tomorrow. Have a nice evening.
I